is reasonable that we hold a session such as this to learn more about why this decision was made, the basis for it, and to hear concerns about our constituents. So the purpose of this session is essentially to educate the commissioners and to determine what, if any, role we have in this process. It is a work session. This is not a formal business meeting. We had that earlier today. For those of you that are not familiar with what a work session is, it is an informal dialogue scheduled with the commissioners to meet with outside or internal specialists regarding specific relevant subjects. The purpose is to educate the commissioners. The purpose is to understand issues. These are not meetings where we take up or consider resolutions or motions or consider reports or approvals of reports. So please, if you are here today expecting there to be some form of motion, one way or the other, or some form of resolution, one way or the other, that's not going to happen today. We will listen, we will understand, and we will educate ourselves. And we will subsequently evaluate what, if any, appropriate response is necessary. So let me talk a little bit about the format of this meeting. We've invited Corporate Counsel Linda Howell and our Chief Health Officer, Dr. London, to join us and to present and address a number of issues that we have posed to them. These will be focused on a number of the concerns that we as commissioners have heard from our constituents over the course of the last week or so. We have given these issues to them to address and to prepare comments to respond to. They'll be given about 20 to 30 minutes. I'm told they won't need that long, but we'll see. And then once they are done, the commissioners will have the opportunity, consistent with how we run a working session, to raise questions and comments to the presenters. I'm going to ask my colleagues to hold your comments until they've finished their presentation, so we'll do it after that. Again, I suspect that you will hear information, you will hear statements from our presenters, some of which you will agree with, some of which you will not agree with. Again, please be respectful of those that may agree with you or disagree with you. Once the commissioners have had an opportunity to ask questions or make comments, we usually do 2 rounds of this, by the way, under our standing rules. They will be given a second opportunity if they wish. They don't have to, but to go ahead and ask a second round. At that point, under our agenda, the public will have an opportunity to talk to us. And that's where you come in. I understand that you have been informed already of the process we are using if you wish to make a public comment, and that includes identifying and obtaining a number. I think it's like being at the meat market, I guess. So you pull the number, and your number will be called in sequence. So you know when your number is coming up, and you'll be directed when to identify a seat in the designated spots. We have 2 microphones, and we'll be going back and forth. I'll talk a little bit more about the details of public comment when we get to that section of this meeting. So, most of us have heard from you folks. We've heard from both sides of this issue. At one point in the process in the last few weeks, we heard a lot of emails, a lot of voicemails from one side of this issue, and the week later we heard a lot from the other side of that issue. What we have asked our presenters to focus on, if they would, in addressing the concerns, the information that we want to understand as commissioners are these. First, talk about the legal basis, the legal standards applicable to this position, the legal positions and responsibilities of the Chief Health Officer, MDHHS, the responsibilities, the legal rights and obligations of the County Commission, and others. It is critical that we have a good understanding of what are the legal standards here. Secondly, We've asked them to address the issue of what is the standard, what are the conditions, what are the circumstances in our community that serve as a basis to implement this unique power of issuing a public health order. What is the magnitude of the risk? What is the magnitude of the concern? We've also, third, asked that they address the efficacy of the proposed ordered mitigation strategies, the masking. There are many questions raised about what is the effectiveness of masking. There are many issues raised about what are the concerns about masking. Do they work? Do they not work? So we've asked them to address those issues. Efficacy, we know, is a two-way street in this issue. So we've asked them to look at what's the efficacy of the mask in protecting individuals from their neighbors, and what is the efficacy of protecting others from you. Fourth, we've asked them to address what are the nature of the concerns, medical, emotional, or educational, when it comes to the use of masks in children grade 6 and less. Fifth, talk about the length of time that these orders will extend. What is it that we'd be looking at if it is to be modified, if it is to be rescinded? What are the conditions? What are the circumstances that would be looked at? And then finally, there are lots of strategies that have been discussed in our community, mitigation strategies such as clean air technologies, not just masking, but washing hands, testing, contact tracing, and many others. And we've asked them to address what are the strategies that are out there other than masking, and what's the assessment of their utilization, and how do they fit into this conversation. So that's a lot, and my guess is that they also have other things that they need to or wish to tell us. So again, those are the scopes of issues that we've asked them to focus on, because I think that from our experience in listening to you, those are the kinds of things you've been expressing concern about. All right, so with that, I am going to ask Linda Howell, our corporate counsel, to kick us off with the response and comments on the first issue having to do what is the applicable law that we're dealing with here. Linda?
Good morning. The public health system in Michigan has its ultimate foundation in our Constitution. In Article 4, Section 51, the Constitution of 1963 provides that the public health and general welfare of the people of the state are hereby declared to be matters of primary public concern. From that point, the legislature has passed laws to set up the public health system, and at the state level, that's through the Department of Health and Human Services, or MDHHS. MDHHS, together with the statutes under which it's set up, it brings some of that power down to the local health departments. There are very specific statutes out there known as the Health Code that provide very itemized, along with very general powers to the local health department. But it's all done under the watchful eyes of the state and the MDHHS, who retain ultimate authority. Under Section 333.2453, a local health officer that determines there's an epidemic in place or threatened in the area has the ability to issue orders to protect the public health. The emergency orders can prohibit the gathering of people and establish procedures to be followed in order to ensure the continuation of essential public health services and the enforcement of health laws, and to mitigate the damage that could be done by that epidemic. It's under that section that the Kent County Public Health Officer has issued the various orders during this epidemic. This week, Monday, so just a couple of days ago, the Sixth Circuit Court of Appeals took up a case and issued a lengthy opinion on the constitutionality of mask mandates. That opinion found that mask mandates were constitutional. They do not violate due process, they do not violate equal protection, and they do not violate religious free exercise.
Whoa, wait. I think I asked you all to be respectful of the comments made by our presenters and by each other. Please, let us continue. Thank you.
The court this week found that the mask mandate regulations bear a rational relation to the legitimate state interest of containing the epidemic. They found that they were applied even-handedly, not just toward one group or another, but across the board, and therefore they met the required level of scrutiny, which in legal terms is known as rational basis. That was the Sixth Circuit Court of Appeals out of Cincinnati. In regard to the...
Excuse me, I probably should have made one other rule clear, and that is that you will be able at public comment opportunity, and we set this room aside and we're here for the long haul, so anticipate we'll be here for quite a while. You'll be given an opportunity to make your comments to the commission. That is a comment to the commissioners. The commissioners have the opportunity to question the presenters, but you will not be given that opportunity to directly question the presenters at this point. Thank you.
Under Michigan law, with regard to a public health order, the Board of Commissioners does not have the legal authority to rescind that order, amend that order, modify that order, or order the local health officer to rescind, amend, or modify the order. The authority from the statutes is given to the local health officer to handle those orders. It is given to the office, and so therefore this board cannot issue a resolution or a motion compelling him to change or lift that order. Do you want me to go into funding? The bottom line is that this board is here to listen to comments, but the statutes do not provide them the authority under the existing Michigan law to change this order. If the order is to be changed, it either comes from the health department, the health officer, or the statutes in Lansing need to be changed to convey the authority to this board or some other political body. But right now, as the law is written, as the courts have interpreted it, the authority rests with the health officer and not this board.
All right. So does that cover what you wanted to present? Okay. Again, commissioners, to the extent that you have questions for Linda, you'll be given that opportunity after Adam has presented, and then we'll be able to go through the round as we usually do with your opportunity to raise questions or make comments. All right. I understand that Adam London, our Chief Health Officer, is now available to go ahead and present. Adam, are you there?
I am. Good morning, Vice Chair Stuck.
Thank you. Hold on, folks, please respect. Hold on. He is attending and presenting on a virtual platform, and if you are concerned about that, then you can direct that concern to me, because we consented to him to do that. All right, I hear you, but nevertheless, we're going to go ahead and hear from Adam and give him an opportunity to address these multiple issues, because at the end of the day, these are the information, these are the questions we want to have him respond to. So, Adam, please.
Yeah, thank
Adam,
you.
go ahead.
Vice Chair Stuck. Good morning, and thank you, Corporate Counsel Howell. I want to first recognize the fact that there are many Kent County residents who disagree with my decision. And I understand you are extremely frustrated in many cases. I'm sure some of you have come here to demand my termination, and some may believe that the commission has the power to rescind the order. As
Wait.
you've heard from the county's corporate counsel,
Wait, Adam. Ladies and gentlemen, this is a public meeting, and this commission takes very seriously the fact that we have a responsibility to proceed. We will give you plenty of opportunity to make your comments, to articulate your concerns to us. So please let this proceed with respect. Thank you. Go ahead, Adam.
thank you. As you heard from county's corporate counsel, county boards of commissioners do not have the authority to rescind an order of health officers. If I were to be terminated or otherwise removed from this office, the order that has been issued would continue to stand because its authority comes from the office of the administrative health officer and is not inherently tied to me as a person. The order that has been issued will expire in one of three ways. First, it would expire 2 months to the day after COVID vaccine is approved for children under the age of 12. Second, it would expire after the CDC has reduced Kent County's community transmission level to the low category for 7 consecutive days. Or 3, it would expire if the administrative health officer determined that it was no longer needed for whatever reason. I want to reiterate something that our corporate counsel pointed to. As county leaders, the commissioners and the health department are subject to laws and duties which have been created from the state of Michigan. I encourage those who are frustrated and anyone who feels passionately about this issue on either side to direct your energy toward the institutions that actually do have the ability to make the change you want to see, the legislative and executive branches of the state of Michigan. The law at the crux of this issue is Public Act 368 of 1978. For 43 years, these powers and duties have existed in that state law. And I strongly encourage the lawmakers who have criticized me for following the law as it's written to work toward building better laws that protect liberty and public health at the same time. From the very beginning of this pandemic, I have not relied exclusively on my own judgment, even though I could. I have over 22 years of public health experience, a degree in industrial and environmental health management, a graduate degree in public administration, a PhD in public health and epidemiology concentration. I am a registered sanitarian, which is a profession specializing in protecting humans from hazardous agents, including viruses, in their surroundings. And I'm a diplomat of the American Academy of Sanitarians, which means I've been recognized by my peers for excellence in practice and for scholarly contributions to the field of study. I've also served as president of the National Environmental Health Association. Despite all of this, I recognize that these are complicated matters and I do not know it all. And so I have consistently brought in the expertise of licensed physicians, including people specializing in pediatrics and infectious disease, certified industrial hygienists, registered environmental health specialists, an ethicist, a data scientist, a team of epidemiologists, a virologist, attorneys, and many others. So let's get to the data. 808 Kent County residents have died from COVID-19. We are now averaging 124 new diagnosed COVID cases every day. In early July, it was less than 20 per day. The rate of COVID test positivity in Kent County now stands at 10.2%. In early July, it was less than 2%. We now have 94 people hospitalized in Kent County due to COVID-19, including 2 kids who are in intensive care right now.
Yeah,
1 month ago,
Adam, hold on. Ladies and gentlemen, many of you asked questions of us. Many of you posed questions. Some of you will come up later and say, why don't we hear about this? If you don't want to have your answers, if you don't want to have your questions answered, then don't ask them. We're here to attempt to answer those questions, and you'll have the opportunity to respond. If you disagree, if you believe that is an error, you may certainly express that. Well, we're here to listen, so I want to hear what Mr. London has to say, and then we'll hear what you have to say. Thank you. Go ahead.
Thank you. 1 month ago, we had 16 people hospitalized. And the hospitals report to me that they have seen very, very few cases of pediatric admissions over the course of the summer. Pediatric cases have risen in the US from less than 10,000 per week in late June to 180,000 reported during last week. Pediatric hospitalizations are increasing at an even faster pace, especially in the South, and slowly following the expansion of the Delta variant. 36% of all new cases in states like Tennessee are kids. Here in Kent, we're seeing the number of new cases amongst kids under 10 years old increase into the #1 age bracket, with 21% of all new cases being in that youngest age bracket. As of last week, the US was averaging over 1,200 kids per day in hospitalized beds. This is the highest average daily number of hospitalized kids our nation has seen during the entire pandemic. And it appears as though the Delta variant is affecting kids more severely because the rate of new pediatric hospitalizations to new pediatric cases has increased significantly in recent weeks. Thankfully, our Kent County children, with a few tragic exceptions, have done relatively well so far. Although those who focus solely on survival rates are missing the point that children also suffer from multi-system inflammatory syndrome and long COVID. They also suffer the mental and emotional anguish when their adult loved ones are absent due to illness or death. I've heard many people say that COVID is far less harmful for children than influenza. That runs contrary to the largest study so far on that very question. The journal Pediatrics published a paper in their latest issue which looked at 250,000 children diagnosed with COVID and compared them with over 2 million children diagnosed with influenza. The researchers studied how those kids fared 30 days past diagnoses. They found that kids with COVID were 3.9 to 5.6 times more likely to require hospitalization, at least 7.9 times more likely to suffer hypoxemia, and at least 2.5 times more likely to develop pneumonia than the kids with influenza. They also could not identify any chronic consequence of influenza similar to the multi-system inflammatory syndrome and long COVID that kids with COVID sometimes develop. Further, we have lost over 800 residents here in Kent County to COVID in just a little over a year. In the worst flu years in recent memory, we lose about 100 residents. It's also important to note that children are at a higher risk of infection. Most are at a higher risk of infection. Most seroprevalent studies and models I've seen suggest that only about a third of the population has some level of acquired immunity due to previous infection. Now, the Delta variant has shown itself to be very well equipped to spread amongst children. I know that some people are concerned that wearing masks is unhealthy for children and equivalent in some claim to child abuse. Some have also claimed that masks are literally killing children. So I sought the input of pediatricians, family doctors, behavioral health specialists, and others on this question. In their practice and in their study, they can find no reputable evidence of harm to children as a result of face mask use. Secondly, I asked our hospitals if they have seen any increase in respiratory distress or infections which could be attributed to mask use. They replied they have not. They further stated that it has only been in the past month or so, during a time when masks have been mostly unused, that they have seen a notable increase in RSV and other viral respiratory infections. I also asked our medical examiner, Dr. Stephen Cole, if any Kent County children have died due to mask use. He responded there have been no deaths to children or anyone else from wearing a mask. Based on his experience as a pathologist, he recommended face mask use. The Kent County Health Department and the Ottawa County Health Department of Public Health, with assistance from the Michigan Department of Health and Human Services, hospital systems, and other local health departments, have compiled scientific articles on the effectiveness of wearing masks during COVID-19 pandemic. A document profiling that science can be found on the county's website. While each individual study may have its own strengths and weaknesses, the evidence presented in these scientific journals, taken as a whole, demonstrate that masks in healthcare and community settings are effective in reducing the risk of exposure to SARS-CoV-2 and transmission of the virus to others. Epidemiological and modeling studies indicate that communities that established mask mandates generally had reduced transmission and disease. Controlled studies examining various masks generally show that masks help prevent the spread of virus-laden droplets. Taken together, current scientific data supports the use of masks to reduce the transmission of COVID-19 in the community. There are over 60 articles from scientific journals, proceedings, and reports included in the data compilation, all of which were published in 2020 or 2021. We did not consider magazine articles, YouTube videos, blogs, or sources clearly contaminated with conflicts of interest. I will not bore you with the full dissection of each article, but would like to provide an overview here of some of the larger and more representative papers. A meta-analysis published in Lancet looked at 172 observational studies and found that an up to 85% reduced risk of COVID transmission when face masks were used. Lang and colleagues reviewed 21 studies and found that workers have an 80% reduced risk of respiratory virus infection when masks were used. An article published in the Institute of Labor Economics found that face masks reduced the cumulative number of reported COVID-19 cases between 2.3% and 13% over a period of 10 days after they first become compulsory. The authors go on to conclude that the introduction of face masks reduced the number of new infections over the next 20 days by almost 25%. In a rare example of a masking case control study, the journal Emerging Infectious Diseases published a paper from Thailand which found that wearing masks all the time during contact with others was associated with a 77% reduced risk of SARS-CoV-2 infection compared with not wearing masks. The authors also found that the type of mask worn did not significantly change their findings. The Journal of Tropical Medicine and Hygiene reported that countries with policies supporting mask use wearing saw per capita coronavirus mortality increase on average by just 15.8% as compared with 62.1% in remaining countries. The Journal Health Affairs reported that mandating face mask use in public was associated with a consistent daily decline in the percentage of new COVID cases. They further estimated that as a result of mask mandates, more than 200,000 cases were averted in the US in just the first couple months after the CDC made the recommendation last year. An article in Morbidity and Mortality Weekly Report found that schools implementing strategies, including mask mandates, physical distancing, and increased ventilation had much lower SARS-CoV-2 transmission than the community overall. Bazant and Bush investigate how long it would take for there to be a greater than 50% chance of transmission occurring if one infectious child attends a class of 25 students. Complete masking scenarios increased the time from 3 hours to 120 hours among elementary school children. The journal Medical Virology published a study in which they found that even a one-layer cloth mask could block 95.15% of virus contained in aerosols. The Journal of Aerosol Science reported that wearing simple masks in public is highly recommended and that even simple masks provide enough flow resistance to ensure that air remains close to the head, thus protecting other people from aerosolized saliva. Extreme Mechanics published an article concluding that face mask coverings, particularly masks with multiple layers, have over 70% blocking efficiency. Multiple layered fabric is found to stop droplets with more than 94% efficiency. The Mayo Clinic proceedings reported that when both the source and target were masked, particle count was reduced by more than 99.5% of baseline. The journal Science has reported multiple articles on mask value, including one which it found that the virus abundance in most environments is sufficiently low enough for masks to be effective. Another reported an increased risk of COVID-19 among people living with a child attending school in person. However, school-based mitigation measures, including mask use, were associated with significant reductions in risk, thereby protecting the students and those living with them. Now, I know there are many who will not accept the merit of these studies or the others that are in that compilation. I have heard the complaints that these are almost all observational studies. They will not accept any conclusions until they see data from randomized controlled trial studies or prospective longitudinal case control studies. Those studies are very rare because of what we already know about the value of public health in masks. It would be akin to studying the value of infant car seats by telling one group of parents not to use them for a year, and then waiting to see if that group's children suffered more injuries than a control group who did not use the car seats.
Well,
Notably,
hold on, Adam. Now, again, ladies and gentlemen, when you are given the opportunity to address us, I suspect that each one of you will want us to listen. Each one of you will want us to be quiet and listen. All right. Go ahead, Adam.
I believe that the people of Kent County, the unvaccinated children, and all the other people around them are faced with what is hopefully the last imminent COVID crisis, a surge in Delta variant cases, just as we are packing the most susceptible people back into classrooms. This is not a hypothetical. Hospitals in parts of the country where this surge first hit have been stretched to capacity. Within a few weeks, the toll in mortality and longer lasting morbidities from those hospitalizations will be better understood. And to be clear, while I am concerned about the health of children, the order I issued is not just about protecting children. It's about protecting the entire community. Placing large numbers of unmasked, unvaccinated people in close proximity at this moment is very likely to accelerate the pace of new cases. This acceleration will put them at increased risk, but will also put everyone else in the community at higher risk. Further, we cannot bring our hospitals to the brink of their capacity again. Hospitals that are overwhelmed are not in a good position to deliver best outcomes. They're also not in a favorable position to provide other essential medical services. My job as the health officer is prevention. It's to see the train coming to the best of my ability, sometimes with limited data. My job is to educate and warn people when I see danger coming, when I see that train coming. Ultimately, like other public safety positions, my job is to get them off the tracks if everything else fails. That is not a job description that I have imagined or an authority that I've bestowed upon myself. It is a responsibility position created through state law. My overriding goal is to keep the community safe. And trust me, if I did not believe that this order was protective of the people of Kent County against an imminent danger, I would not have issued it. I take no joy in exercising this authority. Commissioners, you should have in front of you a folder containing support letters from many of the institutions which have come out in support of mask use in schools. Specifically, you'll find support letters from Spectrum Health, Helen DeVos Children's Hospital, Mercy Health St. Mary's, Metro Health, University of Michigan Health, We Are for Children, Independent Pediatric Practices, Emergency Care Specialist, Kent County Osteopathic Association, the Michigan chapter of the American Academy of Pediatrics, the Michigan Academy of Family Physicians, a letter of support co-signed by 136 local healthcare providers, a letter of support from our advising health ethicist, a letter of our recommendations to the school leaders, which was co-signed by 12 physicians and provider groups who helped to develop our school recommendations, and a letter from the Kent Intermediate School District, which states that they actually observed fewer disruptions in school due to illness last year when masks were worn, and that they requested that this order be issued because if I thought an imminent danger was present, they would otherwise be able to compel voluntary compliance. And this morning I learned that the Kent County Medical Society has also endorsed this and sends their support to this order as well. And Vice Chair Steck, I will stop there.
All right, thank you, Adam. So, commissioners, again, you have the opportunity to ask questions at this point. I'm going to ask you to keep it to 5 minutes so that this does not go till tomorrow. So if I believe Commissioner Coleman, you had indicated you had questions, so I'll start with you.
Thank you, Chair. So I have to hold the button here. Is that right? Okay.
Yes,
First-
I'm sorry. You do have to keep the button down, unlike our system in the chamber.
Okay, thank you. So first, I just want to express my appreciation to Chair Bolter, Vice Chair Stack, and the staff of Kent County for pulling together in really 3 days this meeting, of 1,000 people here. Really appreciate that, and I really appreciate all members of the community showing up. I think this is great engagement. And so my questions are for Dr. London, and Adam, I don't know if you can see me or not, but I've prepared a couple just so I don't ramble, hopefully. So my first question, Adam, given reports that vaccines aren't as effective against the Delta and now Lambda variants, I have many constituents who wonder what you see as the limit on public health orders. Could you describe some things that you would never do for COVID-19 risk mitigation?
So to restate your question, Commissioner Coleman, what are the limits of the orders that might be exercised?
Your personal kind of decision making with the public health orders being very broad. What are things you see as things that should not be done? Whether that's closing schools, whether that's forcing vaccinations, any of those kind of things. Like, where do you see the limit in terms of protecting health from COVID-19?
Yeah, so, and as I mentioned, I do work very carefully with healthcare providers and many people in the community, including the residents of the community. To speak specifically to the examples that you mentioned, I do not see and do not support an order from this department, from my office at any point in time related to COVID requiring a vaccine. Now, the state of Michigan may require a vaccine for school attendance. That's a possibility. They require a vaccine or a waiver for other vaccine preventable diseases. Employers may do that, but I don't see that being the role of the county government.
That's super helpful. Thank you, Adam. Another question. So, as I've been learning and researching on this topic, especially these last few days, I ran across in January of 2020, just before COVID hit Michigan, MDHHS had issued a press release about deaths of children in Michigan in 2019 as a result of various respiratory illnesses. Given that the public health order cites the experience in schools from 2020, which you had just mentioned, knowing what you know now, do you think Michigan should mask kids every school year to avoid these small but real risks of death in children from illnesses other than COVID?
No, I do not believe that the existing infections that are well known and have been managed for quite some time need that sort of requirement. I think that that's a great example where we do have other preventions, precautions in place where education is the best. And I do support education. And education and choice is always where we go to first with these types of challenges.
Thank you. That's super helpful. And I think if I have another minute.
You have
Chair?
another minute and a half.
Okay, thank you. So I know we share the job of being a dad to a bunch of kids. And some of my kids have varying levels of disability. So I really appreciate that the public health order gave an exemption for kids with disabilities. Since that exemption means that not 100% of elementary kids will be masked, what, in your view, is the required percentage of masking that is necessary to protect the public health?
As much as possible, given the exemptions that are provided.
Can you put a specific number as far as, do we need 90% masking in order for it to be effective, or is 60% effective because it's over half? Is there any guidance from the studies and literature on what percentage is necessary?
Every percentile added will add protective value to the schools. There may be more specific information in the literature. I am not representing every data point in that literature at this time. And there may be others who could speak to that more clearly.
Thank you, Adam. Thank you, Chair.
Thank you, Commissioner Coleman. Commissioner Antor?
Thank you, Chair. Good morning, Adam.
Good morning.
Towards the beginning of this epidemic, we saw our governor be totally tone deaf to this whole thing, working with her DHSS, and by implementing or putting COVID patients into nursing homes across the state, including Kent County. That was possibly the most tone deaf, unscientific, ridiculous, stupid, you can put whatever. That decision cost thousands of lives here in Kent County. My sister worked in one of those facilities, and they didn't let anybody in, wouldn't let anybody out. They were masked up, they were wiping everything down. They had a system in place, and they were working under guidance of the health department and the governor. And then she had the brainstorm following her friend, Governor Cuomo, that this would be a good idea to put infected people in with the most vulnerable people in the world. And the result was the COVID spread going across the state and across the nation in numbers that far accelerated anything that would have happened naturally. And my point is, can I ask you what you did, where you were at on that decision? Did you fight the health department on and say, we can't do that? This is the most ridiculous thing ever.
Commissioner Antor, I remember we had lots of discussions with the state, and in many cases we agreed with, and in some cases we disagreed with strategies were taken. We always work with them to the best of our ability, and to with other providers in the community to the best of our ability to get the best outcomes for as many as possible. I am here today to talk about the mask order. I am happy to explore this at a different time with you. I had no role in that, the decision making or the direction of that program.
Please, people, let them finish. Sorry, Adam. You say you didn't have a role in that. Some people would say you don't really have a role in making decisions for parents on something. My question to you is simple. If the science is this concrete, if there's no wiggle room, if this is absolutely the only way this can go down based on your opinion, why is it so many other health departments around the state and around the country doing just the opposite? They're not mandating. are we to believe, and God bless you, I've known you a long time, I think you're a great man, I think you're a friend of mine. I was stunned by this decision. I truly believe I think you're doing what you think's right, but what about these other officials and similar, even in, I believe Wayne County is saying they're not going to mandate it, and they have the lowest rate of vaccination there too. Why is that? I don't think they trust. I don't think they trust, and I think a lot of people here don't trust what we're hearing. One other question that's really important, I hear this a lot. You were on radio about a week ago or so, and you said at that time you hadn't made up your decision yet. Oops, sorry. But I'm hearing, and I don't want you to answer this, that you had met with KISD, and I believe it was a closed meeting, not publicly noticed, and there was nobody in there. I don't know if that's true, but I would like to know what was said and what came out of that meeting specifically, and where is the document, and what exactly did these superintendents sign off on? I'm getting all kinds of varied explanations. What I want to know, was that the tipping point? Because just a day later after you said you weren't sure what you were going to do, you flipped and you're citing that. So I guess I need to ask you, Adam, did you know prior to going on Justin's show that you were going to close her down? Because that's kind of the perception people have. I'm not trying to pick you, but these are questions I'm getting. And these are questions we need to believe everybody that we deal with, and we need to know that was honest. If you screwed up maybe a little bit, we're not perfect, and I would have been certainly, if you're trying to thread a needle or whatever, I get it, but those are questions I'm getting, and I just had to ask these questions. I appreciate your answers, and I appreciate you being here.
So thank you, Commissioner Antor. There were several questions there. I think the first was, what was the agenda or the outcome of the meeting with KISD? And that is reflected in the letter from KISD that you have. Secondly, what things changed? Well, during that week, we also were moved from the substantial to the high category of community transmission. Finally, did I know about the decision before speaking with Justin? And so, his broadcast was Friday morning. I actually spoke with him Thursday evening. At the time on Thursday evening that I spoke with him, it was in draft form, but I was not to a point where it was concluded to execute that decision.
Okay, thank you. One other quick one.
Make it, I'm sorry, can you make it quick this first round? Your time is otherwise up.
Okay, I'll yield.
All right.
Thank you. Commissioner LeGrand.
Thank you, Vice Chair. Dr. London, I want to thank you for your service. I know this is not a decision that you wanted to make. I know none of us likes wearing these face masks. I appreciate that you have done it for the good of the community. I want to focus on the end of this order, what we can look forward to. We all need to know that this is temporary. And can you just reiterate, it was difficult to hear in the room when you were going over that part of the plan. So could you please reiterate, if possible, expand on, on what that means, especially the part about the 7 days and the level of transmission? Thanks.
Absolutely. Thank you, Commissioner LeGrand. There are 3 triggers for the expiration of the order. The first trigger would be 2 months after the date at which COVID-19 vaccine is made available for children under age 12. The second potential trigger for this would be once the CDC lowers our community transmission level back to the low category and we stay there for at least 7 days, the order would be expired. And the third trigger would be through my order, if I saw that that technologies have changed, that therapies have changed, that new information entered the field that would no longer necessitate the order.
Thank you. I know that you said that we had just gone from substantial to high rates of transmission. When was the last time, just so we can get a picture, when was the last time that we were in low, considered to be low transmission?
We were low through most of the summer.
Great. Thank you very much. Thanks, Vice Chair.
Thank you, Commissioner LeGrand. Okay, you wanna go next? Commissioner Jones?
Thank you, Chair. One of the questions that I have, speaking of summer, is there was summer school going on. Yes, it's a smaller set of students in there, but there was mask of choice during summer school programs. They had some distancing. I'm curious, that didn't seem to impact the COVID numbers for children. Is that correct?
Not entirely. We did see clusters of illness associated with a number of camps and other settings. Generally, those summer activities are also more well ventilated and outside a greater portion of the time, so there's lower risk. And we did, as I mentioned, see increasing risks of RSV and other respiratory viruses during that time as well.
The other question that I have for you is going to the exceptions with the mandate. Can we get the list of the exceptions to this mask mandate on record, please?
You're asking him to list the exceptions?
Either Dr. Adam London or Linda.
Well, Adam, will you just quickly list the exceptions to application of the masking rule under your current order?
If Linda has the document in front of her, that would be helpful. I want to make sure that we get the language exact.
And then while you're looking that up, my follow-up question to that is who has the authority to grant those exceptions?
So the exemptions have been granted. The schools are held to seeing them through. So each exemption has a different burden of proof, if you will. But it would be the school that receives those requests for exemptions, makes that determination.
Commissioner Jones, the order says that this order does not apply to persons in the act of eating or drinking, persons under the age of 4, however, supervised masking is recommended for children who are at least 2 years of age, persons with developmental conditions of any age attending school for whom it has been demonstrated that the use of a face covering would inhibit that person's access to education. These are limited to persons with individual education plans, Section 504 plan, individual health care plan, or the equivalent, vaccinated teachers who are working with students who are hard of hearing or students with developmental conditions who benefit from facial cues, persons who have a medical reason confirmed in writing from a medical doctor, an MD, or a doctor of osteopathic medicine, a DO, currently licensed to practice medicine in the state of Michigan.
Okay, my follow-up for you, Dr. London, is the schools have the authority to make these exceptions. Is it an option if the schools deny it to come to you for an appeal?
I'll have to consult with corporate counsel on how we would manage that process.
Thank you.
Thank you. Commissioner Jones, are you done with round one?
Yes, I'm done with round one. Thank you.
Great. Commissioner Breivy.
Thank you, Vice Chair Steck. I'm Emily Breivy, County Commissioner representing Gaines and Caledonia Township. So, Adam, I'm getting some feedback here. I've been one of your biggest supporters and supporters of the health department during my time as commissioner. I've shared info about COVID, about vaccine opportunities. I volunteered here at DeVos Place when the vaccine was available. You've led the department pretty well, but what I would like to know is what's changed? You were in lockstep with the Michigan Department of Health and Human Services and the CDC each time orders were issued. And to my recollection, you never issued an order that went over and above the CDC or what MDHHS recommended. So why now? Why are you going over and above what our state health department has recommended and what the CDC has recommended? On Tuesday, Governor Whitmer was asked by Rick Albin during a brief question and answer session about if she was going to do a mask mandate from the state level, and she said no. She said she would encourage the school districts to do that. So earlier on in our questioning today, you had said you have not exclusively relied on your own expertise throughout this. Why now are you changing course and going over and above what the state has recommended?
So the governor doesn't have the authority to issue an order. The director of the state health department, along with the directors of local health departments, have that authority. And each local health officer has to determine and decide what they think based on the data they have in front of them from their community, what it means and how to respond to that. In working with hospitals and pediatricians and all of those that I've mentioned previously, what we're faced with this portion of our community that is completely unvaccinated, coming together for school, which we want to see happen, we are gravely concerned, and I'm concerned, based on what I'm seeing from other states, the lived experience from other states where I heard from the administrator of a hospital in Orlando that they are overwhelmed with children, and what they're seeing is awful. And that's just one experience there. We can see, based on the data that's happening in other places, that a problem is coming to us. And it would be irresponsible for me not to respond to that with the data that I have and the tools that are available to me.
I do have another question on the data. So we have a easy to read dashboard on our county website. I have checked it regularly. And one thing I noticed on that, and actually brought it up to our statistician here in the county and also to you and Dr. Bora recently, I would really like to see that we show kids, 11 and under, 12 and under, positive cases. Right now, the data is sliced, so it's kids 10 to 19. And I think it would be more helpful as a community to actually see with this mask mandate how, it could be impacting our kids, or without the mask mandate, what we could expect. So I would really encourage you and our data scientists to reduce maybe the groups, or to do something 11 and under that shows the positivity rating. And also, you mentioned a percentage. You said 21% of all kids 10 and under, or there's 21% of the cases are from kids 10 and under. So you said 124 cases a day. I figure about 26 cases are kids 10 and under. How many of those kids are actually, severe, and how many do you estimate to be asymptomatic?
Yeah, we don't have that data with the information that you're referring to. All that is positivity, test positivity, cases that are diagnosed through a test. With severity, we have reports from pediatricians' offices and hospitals. They can talk to us about severity. And they have consistently reported to us that they are seeing multi-system inflammatory syndrome, they are seeing long COVID, they are seeing things that are concerning to them. And for the first time now in quite some time, we have multiple, it's 2, but we have multiple ICU admitted cases at Helen DeVos Children's Hospital. So these are trends that are mirroring what's happened in other states. Now, thankfully, with this particular surge, we are behind them by several weeks. We can learn from their experience. We can change our policy and do things here that can prevent the extreme problems that they have seen in other parts of the country.
Thank you. Your time is up. I believe Commissioner Green, you are next.
Thank you, Chair. My name is Ben Green. I'm the County Commissioner for the most of Plainfield Township and all the City of Rockford. Adam, thanks for taking the time to answer some questions today. I had a follow-up to Commissioner Jones's questions and comments regarding exemptions, because that's one of the biggest issues I've had talking to constituents and parents over the last few days who are, their kids are unable to participate in the learning environment this week as schools return because they have particular exemptions, that they should have particular exemptions according to the way that this order, the way I read this order. Many of them have kids with IEDs and with some of the other reasons that we should have exemptions, but it sounds like the way the order reads, it says the order shall not apply to the following persons. But it sounds like there must be a disconnect in communication between the health department and the school buildings, because what I'm hearing from parents is that the exemptions are not being granted. So, you know, some of this stuff is going to be a continuing conversation, but it concerns me that we have kids that are not being educated right now, this week, today, because they should have exemptions. And my question is, you know, in the short term, is there anything we can do to make that clear? Are school buildings, you know, feel like they can't move on those things, or what's the direction that they're being given? Because I think we need to improve that line of communication.
Yeah, thank you for the question and the concern, Commissioner Green. We do have open lines of conversation with the school districts, and we will revisit that with them immediately to make sure that there is an understanding of what is exempted. And if there are questions, we will have them addressed.
Okay, I appreciate that, because as I said, I know we have a number of people in the room today that have children with IEDs and need special care, and we need to get them back in the classroom as soon as we can.
Thank you, Commissioner. Chair Bolter.
Thank you, Chair. I'm Mandy Bolter, Kent County Commissioner for the 5th District, Cascade, Caledonia, Bound, and Lowell Townships. Thank you for being here today. I think as parents, we would, you know, walk through fire for our kids. And I just think this is probably the biggest demonstration I've ever seen. It's just incredible. So I'm glad that you're here, and I'm glad that you are voicing your opinion today. Adam, I have a couple questions. As a parent, Forest Hills parent, I'll tell you, last year, especially for my high schooler, it was beyond frustrating. Every single week was different. Every single week was virtual. Then we're going to half week. Then we're going to full week. So it's hard enough to kind of plan as a parent. And I know that you said that you looked at the CDC changing our status, but I do have to ask, you know, why did you decide to do this order on the Friday before school starts?
Thank you, Commissioner Bolter. A week before that, I shared with the community the fact that I did see this danger coming, and that it was a severe danger in my estimation. And at that time, I clarified that there are others that
I'm sorry, I can't hear your response. I'm really sorry. I know you're all so passionate, but I really do want to get this on record and hear responses. So please, we set this up so we can hear from you too. And I just want to hear, please. Thank you. Adam, go ahead.
Yeah, thank you. So I also, as a parent, feel that frustration with how many times things changed over the last year and a half. And I know how difficult it is when it's the day before, in many cases, the last day before school starts. But to be faithful to what the powers in the public health code provide, it's imminent danger. It means that it is severe to the community and can't otherwise be stopped by other forces or other parties. At the time, that was the case. A week before I issued the order, I reported to the community that I saw this danger coming, that in my estimation, it was severe to the community. And at that time, I recognized that there were other parties, parents, in school districts that could have intervened so that an order from the health department wasn't necessary. After giving it the week and seeing our transmission rate go up and hearing the report from the superintendents that it wasn't going to happen without an order, that's the moment it became imminent.
Okay. You know, and when that came down, I'll tell you, I think we all had a heck of a weekend on the phone. So I kind of started doing digging like everyone's done and talked to doctors and help me understand. I did have a doctor tell me, and who knows if this is right or accurate, so I am asking if it is accurate and then why they went against this. But the World Health Organization, which we all can have our own opinions on, but apparently they do not recommend masking kids as what I've been told. Also, there are many European countries who have went through Delta, the UK and Italy and others, who are including immunity as part of their as part of their calculations, and then also not masking kids at all. In Norway, I've heard UK, I've heard Italy. Why is that? And can we use that information to help inform our decisions?
Well, I think there's a lot of learning that's happening, and we're really learning on the fly because we're still in the midst of this pandemic. But when it comes to reports from different places around the world, I think we need to learn from them. But when push comes to shove, I follow the advice and the recommendation of the world's premier public health organization, the U.S. Centers for Disease Control and Prevention.
Yeah, one more, go ahead.
Okay, and then I had one last question. So I think we all just want to figure out how to get this order lifted and what criteria you're going to be using. You mentioned 2 months after the vaccine's available. I want to clarify that's not 2 months after the vaccine would be required. You said 7 days for a low category, and then you said there are different reasons. Is there any change or any possibility that, we go through this and it's just not working and kids are getting sick anyway, like the chickenpox or other diseases, and you would change that criteria? It seems to me that the CDC, using case rate when 60% of people are vaccinated, case rate's not automatically leading to hospitalization sometimes. There's different variables. So how do we get out of this? And would you look at different criteria and communicate that to the community?
Yeah, and the simple answer to that is yes. We're going to continue to watch the data, and we're going to continue to look for other developments. And if we see that this is not working or that there are other issues that we need to consider, we're going to learn from that. And that's what we always try to do. And we're going to work with our partners to make sure that we have the best information possible. And I'm not so proud to say that if we find out down the road this is a mistake, I will rescind it in a heartbeat. But at this time, it is my professional judgment that it is in the best interest. And I hope that changes, and I hope that it can be rescinded as soon as possible.
Thank you.
Thank you, Chair. Yes, Commissioner Morgan.
Yeah, thank you, Mr. Vice Chair. Adam, I really appreciate your work at the Health Department. I'd like to speak, please. Those of us that's been on the front line of this for a year and a half, we're really tired, and we're over it. I mean, I'd love this thing to be over. I'd love to have this thing. Well,
Please.
if I don't comply, my medics don't wear a mask in public, in uniform, I get fined. So anyway, what I'm hearing from my constituents is about 3 or 4 things. Number one, you didn't have the authority to do this. They wanted us to rescind it, and I think those questions have been answered. But I think what I'm hearing the most frustrating thing from my constituents is the timing, and it just caught the parents really off guard and didn't give them enough time to, to adjust for the school year. Now, when you mention when a vaccination is available or whatever, you're not mandating that vaccination, right? I mean,
Correct.
I didn't hear your answer, Adam. So you're not mandating that vaccine because that won't come out of the health department, correct?
That is correct, Commissioner Morgan. And so the children and their families who are 12 and older, they do have the vaccine available to them if they so choose. And what I have seen in other parts of the state, Oakland County rather, and other places, have actually put these mask mandates in place through the 12th grade. I don't support that and haven't done that here because they have that option available to them. It's a different question and a different level of risk with that group, but we will not make the vaccine required for the younger students in order to lift the order.
Thank you, Adam.
Thank you, Commissioner. Commissioner Hennessy.
Thank you, Vice Chair Steck, and thank you, Adam, for your leadership on this. I don't know why it's... Am I too close?
I don't know.
I'm usually too far.
It's my secret control, Commissioner.
My question is, we hear a lot of information, and even as you listen to people's reactions here, information changes as the situation changes. So as a layman, how do I evaluate what it is I'm hearing, and how do I know who to listen to? What advice do you have for me as a layman in evaluating this?
It's a great question, Commissioner Henderson, because there is so much information out there, and that's a great thing. But we do need to be careful to make sure that our information is coming from reputable sources, that there aren't clear conflicts of interest, that the information isn't coming from a source that is trying to sell something. And so those are things that we always look for. And of course, we always look to make sure that our information is coming from organizations that have a history of producing high quality research and information. We look at those peer reviewed journals. We look at the research universities that we have in the state of Michigan. And we do look to the CDC, the Michigan Department of Health and Human Services, and our local hospitals, another source of tremendous information that's reputable and something that we can count on.
Masks, are a tool, and we protect ourselves and we protect others. At least that's what I believe as I wear my mask during this meeting. But there are people who, are writing to us about masks and the effect on children, and I'd like to, you touched on it a little bit in your beginning introduction. One person yesterday wrote, children get more sick breathing in their own bacteria than they would a virus. That the idea of the mask holding bacteria for a young child on a daily basis. You're listening to you're listening, this is a concern, so is this something that you can address to us? I mean, one of the things I do with this tool is to wash it daily, but do you have other information, advice, medical information on this?
Wait, we cannot hear.
Yeah, Commissioner Hennessy, that's a great question. And again, in the conversations that I've had with infectious disease specialists and others in that field, they have not seen any increased risk or illness to children because of mask use. There are other people that I would have loved to bring to this conversation today. In fact, the offer was made to me to bring a panel of experts to speak today. And I would very much have loved to do it because we have extraordinary expertise in this community who could address these questions in a very factual way. However, I have chosen not to do that And I've chosen, to be frank, not to do that because of the aggression and the threats that so many of us have received. I am not going to put other people who are working their tail off to serve this community, put them on the same stage that I'm on right now to be the target of aggression. So there is information and there are experts locally who can speak to that. And I wish they could be here today.
Adam, I greatly appreciate that you have been on the front line, handling everything, handling all of us, the pros, the cons, excuse me.
Please.
That you've been, really there for all of us as a community, and you've been there since March of 2020. You've done this without a break,
All right.
I appreciate
Please, quiet.
I appreciate everything you're doing, and I understand you're doing this for the public health of the community.
Thank you, Commissioner. So, Commissioner Burrell, you're next. Please, so we can proceed.
Thank you, Vice Chair Steck. Adam, thank you for being here today. I had to step away for a few minutes, so if this was already asked, please forgive me on this. I've had many phone calls, emails, communications over this past weekend and the last couple days from parents saying they know what's best for their children, not our local health department. Could you just maybe expand on that a little bit and help these folks, help everybody understand a little bit more, please?
Thank you, Commissioner Burrell. I respect where they're coming from. I'm a parent myself. My wife and I together, we have 7 children. This is difficult, but it goes back to that, not just the power and the duty, but the responsibility that the state law puts upon my office to call balls and strikes. And when I see something that is an imminent danger to the well-being of the community, I don't have a choice but to intervene accordingly. And other interventions were not going to work. And so this is where this led us to. I do wish there was a better way. And again, I do wish that we had a better system that did do a better job protecting everyone's rights and public health. We don't have that. We've got this law that we've had for 43 years. And I realize that the power that my office has is extraordinary because of it. But it is the law, and it is the responsibility I have when I do see that imminent danger is present.
Right. Thank you.
Are you done? Commissioner Bolkowski.
Thank you, Vice Chair Steck. My name is David Bolkowski, Commissioner, 16th District. My district is entirely in the city of Grand Rapids. Like most of us, I'm not a fan of mask wearing, washing our food, and all of these things. That being said, we have done these things throughout this last 18 months because as a community, I do believe we're all in this together. I happily don't wash my food anymore because that recommendation has left. However, when it comes to mask wearing, I do believe, and I wholly support your action on this, Adam, and I thank you for your tireless work over the last 18 months. I know that you and your staff continue to work to get the optional vaccines to everyone who makes that choice, working not only for the vaccines to be available and to be safe, but also for the transportation to and from vaccinations and the like. And again, that's just the tip of the iceberg of the great work that you and your team continue to do. At this time, my simple question is, are there any local hospitals against this mandate?
Thank you, Commissioner Bolkowski. There are no local hospitals in Kent County that are against this. I know that in Ottawa County, Holland Hospital, North Ottawa Health System are also supportive. I can't speak to any other hospitals beyond that scope.
Thank you.
Thank you, Commissioner. Commissioner McLeod?
Thank you, Chair. My name is Michelle McLeod. I'm the County Commissioner for District 13, which represents Kentwood, or at least a good portion of Kentwood. Thank you, Adam, for being here and taking questions and providing the information that you've provided today. I just want to, say that I also support your decision, but I also want to just ask a question. You've mentioned a couple times imminent danger as one of the reasons why you decided to issue this order. And so with that in mind, I just want to ask, without a mask order for specifically K through 6, the children that are unable to acquire the vaccine, how quickly might we expect that Kent County schools, since they're just starting and some have not started yet, without the mask order, how quickly would we end up in a situation similar to the southern states that started school quite a bit before us? With the severe, type of community transmission that they have. What would you expect in the experts that you've consulted with in terms of how quickly we might end up in that situation without some order in respects to the order that you've issued?
Yeah. So within a month, we will already see some outbreaks. The Delta variant does spread 2 or 3 times quicker, at least, than the original strain of coronavirus that we're looking at. And so we would see interruptions over the next few weeks. We'd see interruptions of classrooms and schools. And then we would see greater challenges as that increase in an instance in the community spilled over out of the schools into the community, putting stressors on the hospitals and putting stressors on families as well. And the ability of school to continue in person with quarantine, with teachers who are exposed and sick. This is really designed to keep our kids in school, keep them healthy, keep everyone out of the hospital, and to get through these next few months as best we can, so we do have that vaccine available as an option to those who want to pursue it.
Thank you.
Thank you, Commissioner. Commissioner Wooden has a question or a comment. He is participating virtually pursuant to a medical exemption.
Thank you, Vice Chair Steck. Thank you, Dr. London, for coming today. In line with the other commissioners, my name is Stephen Wooden. I represent District 18, which covers Northeast Grand Rapids and the remainder of Plainfield Township, not represented by Commissioner Green. I wanted to start my question off with a little bit of a story of why I'm not there in person. I'm recovering from an illness myself that I got from my son, who is, as of today, 12 weeks old. And last week, we had to bring him to the emergency room because of COVID-like symptoms. He had a fever, he had congestion, he had a cough. And under the advice of the pediatrician, we were brought to the emergency room to ensure it was not COVID. Thankfully, it was not. But in the hours between his test and the results, his mother and I were terrified. And we were terrified because we did everything right according to the CDC guidelines. My wife and I both got vaccinated. Our parents, his grandparents got vaccinated. Extended family members have all treated this very seriously since he himself is vulnerable. And even then, we were concerned that he could have gotten the virus. And to me, that demonstrates the importance that protecting our unvaccinated children is unfortunately not an individual responsibility alone. And that is largely because of how mask wearing and other social distancing measures are more almost about protecting those around you than it is protecting yourself. And can you demonstrate and explain in more detail why wearing a cloth mask has more an impact on protecting those around you than it is about protecting yourself, and thus why universal masking is so critical to protect this unvaccinated population?
Thank you, Commissioner Wooden, and my thoughts and prayers for your son and everyone's recovery. As the studies that I referenced discussed, masks are effective at arresting aerosolized droplets of moisture. Now, we have talked ad nauseum, all of us, about masks for the past year and a half. Fully recognize masks are not a perfect protective tool. Virus particles are far smaller than the pores and the passageways in the mask and around the outside of the mask. I understand all that. However, they do a good job of arresting and stopping a great deal of the moisture particles, which are larger, which contain many of those virus particles, arresting them out there, and then also dampening the flow of your breath and your speech and the projection of saliva to that area around your face instead of pushing it outward into the atmosphere where others are at. By doing this, it reduces the viral load in that shared atmosphere, reducing the risk to all people in that space. So there is a protective factor for the person who wears, but there's an even greater, we believe, protective factor for the shared environment of that space, that indoor space, when people are all wearing a facial covering.
Thank you, Dr. London. If I can ask a a slightly different question. You've shared about the timing of your decision, and to me that demonstrates also your own hesitancy to use this authority that was given to you, that you do not take that lightly, that you issued guidance, that you waited to see how things would escalate, and only then did you issue this order. Could you also demonstrate over your tenure as the administrative health officer, how many health orders like this have you administered yourself? And to further demonstrate your own process for issuing such orders and the understanding of the power you have and the responsibility you have with that.
It's a good question. It's single digits, and it is usually related to things such as a home that was a clandestine drug operation or a laboratory, things like that, where there is an order about not occupying a building. This is by far the most extensive and far-reaching order that I have issued. And so I do take that authority with a ton of humility. I do not issue it lightly. It's not a power play on my part. I truly, truly wish I didn't feel compelled to order it. All of us here feel that way. And I know it certainly puts a great deal of stress and fear and trepidation in all of us to use that power. And so, again, this is why I think this hopefully can be a catalyst for a conversation on both sides of the aisle in Lansing about how do we create a system that better protects public health and our rights, because that's incredibly important here as well.
All right. Thank you, Commissioner. We are up to Commissioner Womack.
Thank you very much, Vice Chair. Adam, I'm going to be brief because I really want to get to hearing from the public, because the government is the government, and democracy is only democracy when it's included the voice of the public. So I'm very proud that everybody came out today. Your leadership through the PFAS, your leadership through the lead poisoning of our children has taken us through uncharted territory before, and here we are with something that's very much uncharted territory when we talk about the COVID-19. One of my questions for you is that even with your education, you said you didn't lean to just your own understanding of this and research. When you mentioned Kent ISD, Michigan Academy of Family Physicians, the Michigan chapter of American Academy of Pediatrics, Helen DeVos Children's Hospital, I noticed a lot of those letters are dated in August, some as late as August 16th. Do you know what prompted them to give you some of their recommendations that you considered so late and so close to the school year? Because I know there's been a lot of questions on why your final announcement was so close to the school year. Do you have any idea why some of those recommendations came so late to you?
Yeah, Thank you, Commissioner. The CDC recommendation that all people in the K through 12 environment be masked came out on July 27th. And so that is what prompted, along with the developing urgency of what was happening in the southern states when it was growing growing in appearance and to our knowledge about how severe this could be based on what was happening there. I think those two things together started to bring these organizations together, saying, what are we saying to our schools and to our public health leaders so they clearly know what we as an organization of healthcare providers think.
Thank you very much.
Thank you, Commissioner. Commissioner Skaggs?
Thank you, Vice Chair Steck. And Adam, thank you for your work and for the work of the entire team at the Health Department. It's been a long year and a half. You've done a fantastic job. I want you to know that this community is lucky to have you as its Chief Health Officer.
Please,
and your orders have saved lives. I think it's clear from the evidence that this health order will save lives as well. It will save people's health, and it will help keep our kids in school, which I think is the goal of everyone here. Nothing has proven the wisdom of the legislators who wrote the Public Health Code back in 1978, that authority on public health orders should be placed in the hands of experts at health departments rather than politicians in Lansing, than what we've seen in the last few days.
Please.
So I just want to go over, you briefly talked a little bit about what our local hospitals have done. That's, I think, the place where most people in this room take their children when they are sick. And I just want to ask you a series of leading questions, if I may. Spectrum Health's Helen DeVos Children's Hospital sent a letter, and it said universal masking is one of the best ways to prevent outbreaks and keep schools open and operational. Did you receive that letter?
I did.
And the University of Michigan Health, Metro Health, wrote, and I quote, "In addition to vaccines, the safest process to minimize the transition of COVID-19 and provide our children the opportunity to attend in-person classes is to abide by the recommendations of universal masking in school." Did U of M Health send you that letter?
They did.
And the chief medical officer at Mercy Health wrote that, quote, "Mask wearing is a proven strategy to mitigate the transmission of COVID-19 and is critical component in creating safe environments in our schools so that our children can continue to attend classes in person." Did Mercy Health write that?
They did.
So you've talked a little bit about the spread of the Delta variant in southern states. And I'm hoping that you could talk a little bit about long COVID complications in a little bit more extensive fashion.
Yeah, so thank you, Commissioner Skaggs. And this is a challenge that I think we're all going to be faced with in the coming years, is what was previously called long haulers syndrome, difficulty breathing, pain, other symptoms that loss of scent or smell or taste for periods of time that are unclear what those chronic effects are going to be or how long they're going to be with us. And we see with other viral infections, in some cases, we don't learn about their long-term consequences until years or decades down the road. And we really don't know with this particular infection what the full scope of long COVID looks like, but we know it's real. We know it's affected many people in our community. And it is something our pediatricians, and to your point about the healthcare system, our pediatricians are unanimously coming to me and saying, we're worried about this because we're seeing some of these strange symptoms weeks or months after the COVID itself, the acute symptoms have passed.
And so that would mean that death rates should not be the only thing, or hospitalization rates should not be the only thing that we're looking at when we're considering the effects of COVID.
That's right.
Quiet, please.
So just a couple of other comments that aren't questions for you, Dr. London. I was looking back at some previous comments. There was a health order that was issued on March 15th, 2020 that reduced occupancy limits. I believe that was ahead of time of the state rule on occupancy limits. And then I did just look up the World Health Organization. They quote, advise that children under 12 and over should wear a mask under the same conditions as adults. Thank you.
Thank you, Commissioner. All right. I think that we've covered everyone that's requested except for second round, and I'll get to that in a second. Almost. Commissioner Ponstein, sorry.
Thank you, Chair Stack. So, Adam, thanks for being here today. You're in a position today that you shouldn't be in. We have a state of Michigan who has failed us and the citizens and have put you in this position. I think one of the problems is that a lot of the elected officials, political parties have found a way that they can gain power, lose power, take power away, raise money, not raise money. And it's really disappointing in my 41 years as an elected official to see that that's what we have become. And, we don't have to look far. I keep hearing our governor saying that she wants to do what's best for all Michiganders. And with this crisis with us right now, I would expect that she'd be here, but I think she's on her way to Aspen to attend a fundraiser for her next governor race. And it's... And this age of information that's available everywhere, you get your information one place, I get it another place. Whether it's a magazine, YouTube, or a journal, there's bias in everything. I mean, there used to be a time when studies show that beef was bad for you, now it's good for you. Margarine was better for you, now it's butter. And all these were funded by special interest groups. So for all the information out there, it's a tough job, and I appreciate everything that you've done. The thing I learned in that 41 years is 21 years of it was on a school board. And the one thing that I know I can trust complete, besides my Lord and Savior, is that when a parent comes up to me on an issue and tells me, I know what's best for my children, though I may disagree, that's where a lot of this passion is from, because we're talking about parents and children. And I hope no one's offended by it, but it is an emotional issue, and I appreciate everyone coming out today. I've just got 3 real quick questions, which is kind of odd for me. There's been some talk about the FDA when they gave the approval to the vaccine. Now, is that approval that the Pfizer is safe, or is that just an extension of the emergency order? Because there's a lot of confusion on that.
The Pfizer vaccine has the full FDA approval.
Okay, all right.
Oh, please, quiet.
You have told me in the past when there's other outbreaks like norovirus and that there are certain things you do, and even with the cold and flu season, washing hands, social distancing, mask. How do you rank those 3 of the most important to stop the spread, or all 3 equal?
I'm sorry, Commissioner Ponstein, I'm losing your voice a little bit.
So we've talked in the past about different things like norovirus or E. coli breakout or whatever
Sure.
it is. And you've always said that washing hands, social distancing, mask are all good. Do you rank those equally, or is one more important than the other?
Well, it depends entirely on the virus and its mode of transmission. So for a person-to-person or a foodborne illness, hand washing is incredibly important. For a respiratory illness, it's less important. It really depends on the unique characteristics of each infectious agent.
And then another question that I've been getting is that we have been talking about what we can and won't restrict. What is the status right now of large gatherings? I know the Venando Arena is starting to have concerts where there may be 5,000 to 10,000 in the audience. Is that something that we're going to need to address coming into the future?
I hope not. I hope that by doing the simple things that we can keep the rate of illness low. We can keep our hospitals not overwhelmed. We can keep the burden of morbidity and mortality in our community as low as possible. I think at this stage, many of those things are possible without that sort of restriction, but we really have to watch the epidemiology. But I can tell you, I don't have a plan for that sort of order, but I'm not the only person, as you all know, that has that authority.
Okay, then my final question is that, you know, there's so much misinformation, and you have stated that, and I agree with you 100%. But this information is out there for parents to see on a daily basis. I work for a company called Costco Wholesale, and over the last 18 months where I had to wear a mask 5, 6 days a week, 8, 9, 10 hours a day, I mean, it's not pleasant, but we sold tens of thousands of these masks. And I'm always told by some of my colleagues that I got to follow the science. And science not always is just the doctors. Sometimes it's the lawyers. And on every single box of these masks that were sold in our store has got this disclaimer on it, protecting the manufacturer. It says, these masks are not personal protective equipment and are not intended for replacements or substitutes for personal protective equipment. These products are not intended for medical use or to prevent any disease or illness. Each mask Each mask is intended for a single use only, discard immediately. And there's a lot of leeway in there, and I think, you know, this is the confusing part is that some of these people wear these.
Can you move that along, Commissioner Ponstein? You're.
So I guess my question is, it's not just these masks that most people are wearing, but what people consider masks. And I haven't seen the widespread because I see them every single day on what the effectiveness is. And I still think that there's other things besides that mask that are protecting people from this virus.
Commissioner, was that a question? Or?
Well, I know time's short, so we can talk later, but it's
Okay.
a statement. I'm pretty sure your answer I already know.
Okay. All right, thank you, Commissioner. So, Adam, as the chair of the meeting, I still get the last couple of questions. And I have two for you, if you would. First, out of my own personal experience, I have 9 grandchildren, as you probably know, and I have seen firsthand what an 8-year-old can do with a cloth mask, and it's not pretty. Have you taken into consideration in your assessment of the efficacy of cloth masks the fact that children in school being asked to wear these for 6, 7 hours in the 1st, 2nd grade are rarely going to comply with any of the regulations or directions on use?
Yes, we have, and we've had that concern shared and discussed with pediatricians, teachers, and others who also understand how those children behave with those masks. And again, we fully realize and recognize that the masks are not a perfect protective tool. They're risk reduction. And even when they're not used perfectly like an adult would, they still are reducing the amount of aerosolized virus and contagion that is put into that shared environment. So they're not perfect, but they are risk reduction, even when they're not used perfectly.
So, Adam, as we go forward, Are you open to continuing to monitor whether these masks are being used in effective ways and consider whether we need to change your requirement for use of masks?
Oh, not just open, but committed to that.
Thank you. So I have one other question, and then I'm going to ask a summary question, and that is, with respect to the order, how is it that your department anticipates enforcing these orders?
So we always take a progressive enforcement approach. We always use education to begin with. We have required that the schools turn in by the end of this week their prevention strategy, which ought to include masking and how they intend to enforce it. If we have non-compliance, we'll work with the schools, of course. We'll try to identify what the unique obstacles to compliance are. We'll try to find solutions. We are also working to understand, the public health code has penalties within it. We want to avoid those, but we are working with corporate counsel to understand how and when it would be appropriate to use those. But it is a last resort all the time.
And again, in the experience, if you find that enforcement is not practical and the compliance dwindles, are you open to discussions on alternatives?
We're absolutely open to explore what works for the community and what is effective.
Okay, thank you. So what I would take from that is you would be willing to sit down with commissioners to continue to explore what is appropriate, what may be considered as you begin to look at what's the experience out there in the schools?
As always, and I think I've had a long history of working with all of you and working with the administration, and I would welcome that. Again, though, in the law, that responsibility ultimately falls upon my office.
I think we've heard that the role of your office and the role of our position, we understand those. I am asking, though, really your commitment to sit down, not because we can control, direct, dictate, or enforce your rules, but can we bring to you concerns and you'll listen to us?
I would welcome that.
All right. At this point, we would typically go to a second round, and I want to get to the public's comments and get started with that. So I know that there are some commissioners that wanted to do a second round. Let me first see. Commissioner Antor, you would like a second round. Have I cajoled the rest of you into not doing a second? Well, so here's the problem. If we go to a second round, this first round took us well over an hour. It'll be another hour before we're done.
Chair, I tell you what, I will yield to the public because I think they'll address, I'm sure they're going to address some of the questions I had, so I'm good. Thank you, though.
Are other commissioners acceptable with that?
Yes.
All right, thank you. So now we're going to move to the section of the meeting where we will hear from the public. And just a second.
We were just going to ask if we needed a break to go to the bathroom. Does everyone need a bathroom break, or do you want to get started?
My concern is if we take a break, it'll be difficult for us to reconvene, and it'll be a half hour. So
yeah, let's go.
If you're not offended by a commissioner occasionally getting up and using the restroom, I won't be offended if you choose to do that as well. So all right. I suspect we have some staff that can take care of that for us. In the meantime, I just want to run through the process for public comment. You already understand that you have been asked to identify, if you are interested in making public comment, to acquire a number from the folks in the back table. Once you have a number, it will have an even number or an odd number, and if it is an even number, we're going to ask you when your sequence arises to sit on my right, your left, and if it's an odd number, on my left, your right, until your sequence number comes up. Then you will be asked to address the commissioners at the podium. Please, these are public comments to the commission. They are not conversations, so while you may ask rhetorical questions, commissioners do not engage in dialogue back and forth in public comment. We want to hear what you have to say or what your concerns or statements may be. Please note that in the course of the process, there are lots of folks that are still behind you, so we have under our rules the discretion to ask all of this group to identify 2 or 3 to speak. We're not going to do that. We know that many of you want to speak, but we are asking you to limit your comments to 2 minutes. And at the point of some point, there is a system here that will shut the microphone off. And so please understand, it's built into it, because the only way we're going to get through this many folks is if we're able to do that. So, and then if your time is up and you are completed on this side, the microphone on the other line will simply be turned on. We'll move on to that individual. Lastly, we take the public podium very seriously at the Commission. This is the opportunity for the public to comment and address us directly, face to face. And so we don't really tolerate disruption of an individual. If someone is speaking to us, they have a right to speak to us. They have a right to express their concerns, no matter what it is, whether we like to hear it or we don't like to hear it. They have the right to do that. So I'd ask you to respect that when they are speaking. You may agree with them, you may not agree with them, but they have a right to do that. So we are very careful about protecting the integrity of that public podium. It is essential to how our democracy functions. So I please ask you to respect that as well. Did we get the sanitary wipes? Yes. We got them. All right. So when it is your turn, again, we'll go sequentially. Please identify yourself, state your name, state your address, and then you may proceed with your comments. I guess the other comment is there is a timer, I think, on the screen. So you should be able to see exactly how much time you have as you are commenting. And again, given how many people want to address us, please respect the limits. Thank you. With that, somebody got the lucky lottery number 1.
Hello, my name is Chris Warren.
Chris, good morning.
Morning. My address is on record. Hello, Mandy. My wife said to say hi. Barbara Pavlov, go Bronson Vikings. So, this is very loud. So, shout out to Kristen Megan, a true patriot for decades. Yes, decades. Wait until you all find out. She's not just a licensed maths expert. Look up barium and aluminum in the air. Okay. So I am also an Air Force veteran. My 2 kids go to Granville Public Schools. My kids went to summer school at Granville, no masks. They did a meet and greet last week with the teachers, no masks. On Tuesday, 2 kids from Granville High School on transportation got overheated from being on a bus that was too hot. They were wearing masks, fully soaked, sick to their stomach, and I heard they needed medical attention. Also, one of the bus drivers passed out while returning to the bus garage. They checked the temperature inside that bus, and it was 128 degrees, and I have someone that I know that works with that. 128 degrees. These are facts, people. Also heard that there was a child that had thrown up in their mask. I mean, I don't even get it, but I also heard that transportation said it is not the bus driver's responsibility to make sure that the windows are down. I'm wondering who would be able to have that responsibility when you're 5 and 6 years old? You all know how those old school bus windows work, and trying to get them to work their way down. They don't work. So that night, our superintendent, Roger Barra, sent a letter out that said that there were some concerns on the heat of the buses while transporting children. Concerns, okay. They now have half days yesterday and today. When a child dies on one of these buses, who are we going to blame? Roger? Commissioner Steck? Mr. London? I think Mr. London. So masks do not work. This is the only reason we have them in K through 6 is the COVID grants that are come to the county received from the state. It needs to stop here. Our kids need oxygen to learn. Pull your kids from physical school. We did on Monday. Once they have openings, they will be at a Christian school from now on. So that's
Thank
what
you.
we've
Your
already
time has
decided, so-
expired.
Thank you, Chris. Number two.
Before we begin with the next speaker,
Hello?
I would like to request that folks who are issuing public comment, please step close to the microphone so that we can get your comments in the record.
Thank you. At this time, we'll call numbers 2 through 20. If numbers 2 through 20 can come to the mic, please.
All right, you may go ahead.
We're sitting in our chairs like we were told to do this morning. You're going to make them stand for 45 minutes?
Okay.
I believe there are chairs for them to sit on there. Okay. I'm sorry, go ahead.
Nisa Smulligan from Comstock Park, Michigan. Good morning. There are a number of reasons why I disagree with masking our children. Many of those reasons will be stated today by other citizens. What I choose to specifically address is the dismissal and rejection of my religious beliefs and my rights. For over a year, I have struggled with how the policies such as the mask mandate are contrary to my deeply held religious beliefs and how officials such as Adam London are attempting to act as my authority over my life, liberty, and religious freedoms. I believe in Jesus Christ as my Savior, protector, and almighty authority. I do not live in fear, but live in the assurance of God's strength, power, and protection. We are created in the image of God and called to be a light in this world and live with an unveiled face. 2 Corinthians states, "Now the Lord is the Spirit, and where the Spirit of the Lord is, there is freedom. We all, with unveiled face, beholding the glory of God." I can no longer, in good conscience, comply with orders that compromise my integrity as a Christian. My children and I are not in imminent danger by this virus by freely breathing the air that God created, through the lungs that God created, and with the immune system that God created. My children and I are not a direct threat to others by breathing unmasked. We ourselves are responsible enough on our own to make medical decisions to protect ourselves and those whom we come in contact with. As God is my authority and not the Kent County Health Department, I stand here today to say that forcing the masking of our children is against my religious rights and is an unlawful order under my First Amendment rights to religious freedoms and the Michigan Civil Rights Act. God bless America.
Number 3.
My name is Tammy Clark. I live in Rockford. I am an occupational health and safety professional and an OSHA-credentialed PPE expert. I am also a court-approved subject matter expert and an expert legal witness who has testified in front of legislative bodies and in court cases all over this nation over the past year on the actual science behind masks and why they do not work to stop the spread of aerosolized respiratory infectious diseases. Those in my profession are the subject matter experts, and we are the only professionals qualified to provide guidance on pathogen protection and disease mitigation strategies that include respirators, PPE, and masks. We actually are the ones who sit on pandemic and emergency response boards, and we are the ones who provide guidance to hospital systems and government agencies. Adam London is trying to hijack our profession, and he should be held accountable. Doctors are not credentialed to speak on pathogen protection, PPE, masks, or any protective factors unless they are occupational doctors. Doctors and healthcare workers have limited knowledge about PPE. In fact, they only know what those in our world teach them about their own PPE and masks because of professionals like us who train them. Doctors heal. Those in my career fields of industrial hygiene, occupational and environmental health and safety professionals, we protect. That's our job, to teach about protection and protective factors. When doctors speak as experts on PPE and protective factors, they are guilty of malpractice. We all need to stay in our lanes. The traditional multidisciplinary approach to pandemic response was completely ignored with COVID-19, and for the first time in our nation's history, the professionals who manage pandemic response plans were left off all COVID-19 task forces, and we were completely ignored. Government bureaucrats are now dictating mandates on us with absolutely zero science or data to back them up. I know because I have FOIA'd the science and data that the Michigan Department of Health and Human Services was
Your time
relying
has
on.
expired.
Thank you. Number 4.
All right, just as Tammy said, we are the only 2 subject matter experts in this room. My name is Kristen Megan Kelly, and I am a senior industrial hygienist, and I am cross-credentialed in public health. I worked for the federal government for 12 of my 19 years in this field, meaning I superseded and controlled decontamination lines for the entire city of Chicago. Masks do not stop aerosols. The fact that Adam said that is disgusting. I apologize that you all had to hear to an official speaking from his rear. Speaking of the rear, you spread aerosols through your rear. Are we going to put masks under children's rears? If this was about public health professionals, which I am one, we would have put toilet seat covers over the toilets. We would have removed the air dryers because aerosols can stay suspended in the air for up to 30 days. If you were an industrial hygienist, you would calculate through Stokes' law and you would have figured that out. One of the commissioners sitting here in a dark-colored mask called one of the highest credentialed industrial hygienists, professional engineers, and certified safety professionals a quack. His name is Mr. Stephen Petty. He's the top exposure scientist in this country, the lead exposure scientist on the Monsanto cases, who has put videos on Rumble telling you that masks do not stop a virus because industrial hygienists, we conducted the baseline surveys. Where's your baseline surveys? Where's Adam's baseline surveys? A baseline survey is when you say something's wrong, you put in a control, you go back, you verify the confidence in those controls, and if they don't work, you remove them. They didn't work. They cause self and cross-contamination. Children are dying? Is it because of the treatment that was withheld? Are children dying because of suicide? Because the reason there's states that don't mask their children is because Tammy Clark and I went there on our own dime, and I'm a United States Air Force disabled veteran, and I'm in my own litigation because of discrimination, and I stand by these bus drivers. OSHA Rule 5, file OSHA discrimination. You have violations under the General Duty Clause. OSHA recordable.
Thank you. Thank you. Go
Elizabeth
ahead, number 5.
Johnson, Cedar Springs, Board of Commissioners, elected officials, despite...
I'm sorry, can you put that just a little closer?
Despite what Mr. London says, we have nowhere else to turn. I hope that you are looking at all these pissed off voting mama bears in this room. I hope you take note. Now, we've heard a lot of BS about how scary COVID is, but I addressed the chart. Did you notice he didn't mention much about deaths? Look at this chart. Look at the age level. 3 of the age of school has died from the Delta variant. 3. I ask you, is this reasonable? He's relying, he says he has the legal precedent to do this. Let's look at those laws. MCL 333-2451, I'm paraphrasing. An imminent danger must exist in order for a health official to issue an order. And imminent danger has a definition. It must be reasonable to expect to cause death, disease, or serious physical harm. Reasonable means not exceeding the limits, not excessive, moderate, endowed with reason, capable of rational behavior. I ask you, is this reasonable? Next one, MCL 333-2453. During an epidemic, the local health officer may issue an emergency order to prohibit the gathering of people, nothing about masks on kids, and it is only to ensure the continuation of essential public health services. Where are the makeshift hospitals? Where's the overrun hospitals? I can make a well child appointment today and get in within a week. Believe me, I know. Furthermore, epidemic has a definition. I know this is an ever-moving goalpost in our present time, but according to our legislatures, it occurs when 70% are vaccinated, and by Mr. London's admission, we have obtained that. In other words, there is not an epidemic. This is a law that is only for the continuation of public health services, and it is only for the prohibition of gathering. Mr. London, you have no legal leg to stand on.
Thank you. Your time has expired.
Okay, I'm sorry, go ahead.
Hello, my name is Micah Jones, and I'm a resident of Kentwood. I'm a student at Grand River Preparatory High School, as well as a student at Davenport University. I have a little sister who is in 4th grade at Cross Creek Charter Academy. As a student, I would like to thank you for being mindful of students as well as the school faculty's health. COVID has affected us all greatly. We have all seen the grim and devastating effects it has had on and has brought to our country. As a student, I have felt these effects. My little sister, who is in 4th grade, has felt them as well. It is one of the hardest years I have had to name in my academic career. But I didn't complain. My little sister didn't complain. We understood that our compass need to be amended in order for the greater good of staff, students, and faculty. This year we will go in person, and this is made possible by this mask mandate. This mask mandate helps our learning environment be void of dangers, and we are able to learn in a safe environment. I took AP Environmental Science, which is an advanced placement class, and I understood and we learned the skill of having an open and respectful dialogue between opposing sides that are void of antagonistic and negative speech. I learned in AP Government that you can have an opposing view with someone, but that doesn't mean you have to yell or shout. We have had an open dialogue, and we are all Americans, and you may not agree with me, and that's your prerogative, that's okay. And I'll leave you with this. You are made to wear a shirt and shoes in public, but a mask is too much. It seems that many of us only care about democracy if it benefits ourselves. Have we forgotten what this country is built on? It is built on unity, is in the name. Thank you.
Thank you. Next.
Do you have a number 7?
2 minutes. Can't do it. We could, but there's just no practical way that we will be able to get through this. We're using the same time period, I think, that was used at Ottawa County. And so we are asking you to keep your minutes at 2, please.
Cordier. I'll take a few seconds back. My name is Sean Cordier. I'm out of Rockford. I'm going to speak to you guys, not to them. You have been mismanaged, misserved, and marginalized at every level of your government, local, state, and federal. It's time for you to take a stand. This board, they're going to return a verdict today that their hands are tied and they can do nothing about that. I would tell you right now that they are all in violation of their oath of office, and so is Adam London. They're here to serve us. Here's where I'm going to tell you it's going to go, because I told all the parents in schools that their exemptions were going to go away. The schools are already starting to pull your exemptions, right? This is the direction that you're going to go down. My father was mandated by the Veterans Administration of New Mexico to receive a vaccination to continue his care. He served in Vietnam and was shot out of a tree, broke his back, and he needed the care. He took the vaccination. My father died 4.5 days later. So I'm telling you, the mask issue is to subjugate you. It's to marginalize you, discriminate against you. The people that are vaccinated are able to catch COVID. They're able to spread COVID. In fact, recent studies indicate that they spread more viral load than an unvaccinated person. So I'm asking you all to dig deep and do what you need to do. You consent to be governed, right? You give the power to the government. Time to stand up, time to quit being afraid. I've been doxxed online. I've received death threats. They've got penises drawn on me on Facebook. Listen, I will tell you guys, stand up, hold these guys accountable, hold Adam London accountable, and the simple thing is, you do not comply. Do not comply.
All right. Thank you. Next.
Hi, I'm Beth Razan. I'm from Cedar Springs. I have a lot of things going on with this right now. I actually care about my kids, and I don't want them abused. The environment that they are being in and they're forced to be in right now, I will pull my children. The masks do not work. We've actually had people say that. I'm watching my mother die in our healthcare system right now because she doesn't have emotional support. All she sees is nothing but a mask. There is nothing behind her. She's what's filling the hospitals, not COVID patients. And then you want to turn around and mask my children so they can end up getting depressed, commit suicide, have mental issues of God knows what amount that I will not be able to afford to care. And this is much more than that. This is our country. I'm for choice. If you want to wear a mask, that's fine. I do not. This is our country. They have attacked all levels of us. We have it coming at from all directions. So if we don't stand now, and you guys don't unite with us for freedom of choice, where does that leave us as a country? The girl that got up here and stood, masked, that is her right. She feels protected, and if mask works, then that's good for her. It is not good for me, it is not good for my children, and it is not good for our country when we have communism on our doorstep. I will not welcome it in. I will not. This is our country. And if we don't do something about freedom of choice, we won't have it. I give it 5 years. 5 years. Thank you.
Yeah. Good morning. Go ahead.
My name is Anna Noskowski. I'm from Cedar Springs. I'd like to congratulate the commish that was on screen earlier on receiving a waiver. Anybody else get waivers these days? To the panel, I just want to say thank you for allowing us the opportunity to talk here this afternoon. I do appreciate that. I am sorry that Adam London has thrown you all under the bus to deal with his mess. Adam London says that his decision was about the science and that he makes his decisions based on CDC guidance. We know that's a lie because the CDC doesn't have a mask mandate in place right now. My guess is this has more to do with outside influence than science. We'll call it bullying by the KISD, Spectrum Health, St. Mary's, and anybody else who is trying to get to him. By the way, I would also caution Commissioner Morgan, I believe you have a conflict of interest. We are guaranteed the pursuit of life, liberty, and happiness. Emphasis on liberty. This is not us versus them. Please understand that there will be people talking today that you've already heard from who believe differently from them. This isn't us versus them. This is us wanting the choice to do what is right for our families. As my friend Randy says, you are either the hero or the zero. And unlike Adam London, I will give you the choice.
Thank you. Next.
Chris from Kentwood. The Revised School Code Act of 1976 states that the public schools of this state are required to serve the needs of the pupils by coordinating with the pupils' parents and legal guardians to develop the pupils' intellectual capabilities and vocational skills in a safe and positive environment. Safe and positive. The Kent County Health Department and the State Health Department have violated that code by mandating that masks must be worn. A mandate is not a law. It is a myth that masks prevent viruses from spreading. The overall evidence is clear. Standard cloth and surgical masks offer next to no protection against virus-sized particles or small aerosols. The CDC website also states this. The mandatory mouth mask in schools is a major threat to a child's development. It ignores the essential needs of a growing child. The well-being of children and young people is highly dependent on the emotional connection with others. Masks create a threatening and unsafe environment where emotional connection becomes difficult. Children who are learning to read in first grade, kindergarten, whatever, they can't see the teacher's mouth move, and they will not know how to pronounce or read when it comes to it. Regardless of the lack of safety and efficacy behind the decision to require a child to wear a mask, it is legal to mandate EUA-approved investigational medical therapies without informed consent. The FDA statute further recognizes the well-settled doctrines that medical experiments may not be performed on human subjects without express informed consent of the individual receiving the treatment. By requiring children to wear a mask, you are promoting the idea that a mask can prevent or treat a disease. If you look at the warnings on a box of cheap masks that the hospitals and nursing homes hand out like candy, you will see that their own words will say they don't provide any protection. In closing, what you're doing to the students of Kent County by mandating masks amounts to child abuse. Let the kids be kids and trust that the parents
Thank you. Your time has expired.
know what to do when their kids go to school. Thank you.
Thank you. Next.
Hello, my name is Erica Burton. Because of my small stature, I told myself my words would go unnoticed. But then I remembered the even smaller persons my voice and presence here today represents, and I realized that in their eyes, I am Mama, I'm strong, I'm courageous, and prepared for battle. So here I am today, standing up for what is most precious and worth defending. When this pandemic started, we were presented with a prepared set of statistics and data that was shared with the public to reassure us that COVID-19 was not going to control our lives and society. In the weeks that followed, we all witnessed America come together, willing to make sacrifices to help them flatten the curve, to protect others from harm, and to keep the economy afloat. In the past months and weeks, however, it has become very apparent that now COVID-19 is indeed controlling our society and livelihoods. Americans are no longer willing to work together. We now demand others sacrifice for us, even to the point of harming healthy individuals that, mind you, were once considered among the most vulnerable. And yes, we've allowed our economy to suffer immensely and continuously. Do you see the irony here? Everything that was once protected is now under attack. I could present my own set of verifiable data and information to support that COVID-19 is no longer an imminent threat to our society and livelihoods, but those continue to fall on deaf ears. Right now, I speak to the Board of Commissioners and to the public because that is where the power truly lies, and we are most assuredly in dangerous days. Commissioners, parents, grandparents, and legal guardians, our fight today is not about masks, vaccines, and is certainly not about our health. It is about the authority to dictate the lives of our children from an American constitutional perspective that God has given us rights that belong to the parents. And right now, these policies and systems put into place are trying to take autonomy over our children. I am not about to relinquish that over. Annalie, Kenzie, Braden, Gabrielle, Michael, Evie, Eric, Harley, Sadie, Victor, Sage, Emmy, and Josie, and the American sons and daughters, I am not giving up. I will fight.
Okay, thank you. Go ahead.
Heidi Reed, 204 East Muskegon Street, Cedar Springs, Michigan. My name is Heidi Reed, and I'm the president of the Cedar Springs Public School Board. In our district, we have 12,000 voters and 3,400 students. We are located in northeast Kent County near the border of Newaygo and Montcalm counties. For the record, Kent ISD does not speak for us. The Kent County Health Department recently made one-size-fits-all decision to mask K through 6 students 3 days before school started. Today, I stand before you for the parents who are being denied the right to make medical decisions for their children because of the medical mandate that is being forced on them via the Kent County Health Department. Further, the public health order was worded to put the burden of enforcement on the schools, not personal responsibility or the public in general. Schools are not designed to be the enforcement arm for the health department. In education, we use multi-tier systems of supports, interventions for problems. This educational process can be applied to COVID-19 virus, and we can use the different mitigations should we have an outbreak of this illness. To have successful interventions, people need to agree, and it needs to make sense. We have the ability to work individually with the Kent County Health Department, just as we did during the past school year, when the team did a great job keeping us face-to-face and open. The Cedar Springs community has filled our boardroom podium, demanding, asking, pleading, and imploring the school board to do something. This is an excerpt from an email we received. Please fight for our children. Fight for our children's rights. The children K through 6th grade are the smallest voices in our community. They are silenced. These children are in the least danger of the virus with a 99% survival rate. Masks need to be a choice. The compassion and acceptance at the same time we have seen in our school district for those wishing to wear a mask has been incredible. County
Thank you.
Commissioners,
Your time has expired.
Thank you for listening.
Thank you. Go ahead.
Hi, my name is Brenda, and I'm a voice that God gave me, and I will use it. I am very, very disappointed that you had the chance to question 2 top industrial hygienists about mask experts, and not one of you guys questioned them. That's pretty sickening. I also want to reiterate, our rights are from God, not you guys in any way, shape, or form. You were elected in to do your job. Nothing has changed with a 0.003%. Would you take chemo? Come on, you guys, wake up. You don't need a PhD or a doctor behind your name. You need common sense to follow what's going on here. This is ridiculous. I also want to say, if you think the Kent County Health Department, CDC, World Health Organization knows best, follow the money trail. Follow the money trail. All of us have been doing it. The SARS has been around since early 2000. Where is our burden of proof? There's no burden of proof, and I'm sick of the verbiage of fear-mongering going on for your safety. You took an oath of office for the Constitution. That has nowhere on the safety. The Constitution was written in a crisis, and it does not overrule whether it is 50% rate or a 0.003. The patriots in this room are growing God's army, and we will not be quiet. We will fight this medical tyranny, and civil disobedience is a must. God bless America.
Thank you. Go ahead.
Craig Ladyman, Rockford, Michigan. I'm a candidate for the school board for Rockford, Michigan for 2022. And these people are gathered here today to have one message. We need to stop the liberty hate in this community and stop the liberty hate locally before we take this globally, folks. We are waking up here to your demise of the contract that you need to hold. You hold a contract called the Constitution and Bill of Rights. You sign that Constitution and Bill of Rights through your oath. If you are not exercising that contract, we are here to address our grievances. Do you understand? You stand under the greatest country that has ever been formed on the face of this planet, and you take a doo-doo on the Constitution and use some sort of subjective science to go ahead and have your little debates and have your little quorums of what you're going to do for us and how you're going to keep us safe. What are you doing for us? What are you doing for us? You're ripping our communities apart. You're causing division. There is more justice, equity, diversity, and inclusion in the United States Bill of Rights and Constitution if you just take it out and follow it and utilize it during your discretion and decision making. I advise everybody who's here, who has aspirations of being a lifelong liberty political candidate, to go across the street, sign up at the election office on the second floor of the Kent County building, put your name down for these school boards, put your name down for these prosecutors listed, the judges, all the seats that are open. They are locally elected, and if we do not take our place at the seat, we are going to continue to allow this subjective science to rule over a people who died for the very things that you committed to say you're going to stand up for. My time has expired. God bless America, and God save this country.
Thank you. Go ahead.
Hi, my name is Stephanie Boone. My address is on file. I have 6 kids who actually do have a medical mask exemption for school. But that hasn't stopped the schools from treating my children like lepers for the past 18 months by discriminating and segregating them. After many months of working our tails off to convince our Kent County School District boards and superintendents that there is absolutely no reputable science out there that proves masks work effectively to stop the spread of an airborne virus, and finally seeing the light at the end of an extremely long dark tunnel for our children by being told that they would leave it up to parent choice this school year, we are extremely disappointed that those same superintendents and boards that we thought we could trust went behind our backs and actually asked the KISD and Adam London to issue a mask mandate for schools the Friday before school started. Why did they do that? If they took a vote at any of the last 6 school board meetings we've all been at and asked for parent input, the answer would have been clear. We want choice. What science and data specific to each district in the Kent ISD was brought to Adam London to help him make his decision that each district warranted the need for a sweeping order due to imminent danger? I would like to see that science and data because he says that was his gauge that he used to make his determination. So where is it, superintendents? Where is it, Adam London? Where is the imminent danger? What gives an unelected official the right to make unilateral life-altering decisions about our personal medical freedoms on behalf of the vast majority of people that want to make the choice for their own children? Go to the stores, go to public venues, look around you, no one's wearing masks. We know they don't work. The choice is clear. Stop bullying and abusing our children. Thank you.
Thank you. Go ahead.
Hello, my name is James Streeter, and I reside at 4305 Indian Lakes Road in Algoma Township and in the Cedar Springs School District. I'm a father of 3, a 5th grader, a 4th grader, and a pre-K student. And I'm here today to speak on my family's behalf to those who would deny us our freedoms and our autonomy. As an RN here in Grand Rapids, my wife was unwilling to leave her patients to be here today. She has gone from being a hero to a racist to a conspiracy theorist to now an unfit parent. And that is exactly what we're being called, as there are some who have decided we are not capable of choosing what's best for our own kids. We are not anti-mask or anti-vaccine. We are pro-choice. In response to this, my wife and I have begun exploring options which range from pulling our kids from school and even moving to another state. It appears that everyone wants to pass the buck, and I get it. I really do. But as the saying goes, with great power comes great responsibility. And there are many who are showing us that they are unworthy of both. I leave you with a question and a quote. If you felt your children were needlessly being put in harm's way, to what lengths would you go to put a stop to it? And think about that. And the quote, and I urge you to look up who said this and the story behind this. I was always willing to be reasonable until I had to be unreasonable. Sometimes reasonable men must do unreasonable things. My wife works at the hospital. There are not bodies in the hallways. They're stressed out because they're understaffed. And now they're going to fire another third of them. So I don't know where he's getting his information from, but Spectrum has put out an order telling doctors they could lose their license if they write up any of these exemptions. Thank you.
Thank you. Go ahead.
Hi, my name is Beth Johnson. I am speaking on behalf of a friend. Can you hear me?
Thank you for lowering that. Yeah.
My name is Beth Johnson. I'm speaking on behalf of a friend and neighbor. She's a mother of 4. Her youngest child is 8 years old. Mentally, he's 2. They have many struggles with this situation because he's on the autism spectrum disorder, Williams syndrome, sensory processing disorders, global development delays, aortic stenosis of the heart, double crossing of the eyes. He's non-functional of self-care, nonverbal, OCD, and possibly ADD. The powers that be have made it nearly impossible for him to get a mask exemption. This child cannot wear a mask. The school district wants him to wear a mask. The special education department is trying to follow him around with a mask. This is not right. His head is the most sensitive area on his body. He cannot tolerate having his ears cleaned or even wearing a simple hat. He relies on facial expressions and lip reading for communication because of all of his disorders. You are severing every facet of communication to this child through this mandate, and also to hearing impaired and deaf children and people like me. I am hearing impaired. I rely on lip reading. Thank you for having the screens so I can help receive your information. This child gets so frustrated because he cannot receive communication. He bangs his elbows on every surface he can get his elbows on. He beats his head on the wall, leaving marks because of his frustration, and he cannot communicate. Is this how the mask mandate is supposed to control our children that cannot speak? It's not helping. It's hurting. This is not acceptable. This is hurting children even that are not in special needs, asthmatic children.
Thank you. Your time has expired.
Hi. Hey, please. Quiet. Thank you. Go ahead.
Hi, my name is Carrie Vanderboon. I currently reside in Lowell, and I'm a mother of 2 amazing kids, one currently in Lowell in 10th grade, and one graduated 3 years ago. All summer long, our children have been able to feel somewhat normal again, and then we receive word once again that our children will have to mask up again. Our children now have to endure another start of the school year of constant badgering and feeling oppressed. The very definition of oppressed is worried or uncomfortable, exercising authority or power in a burdensome, cruel, or unjust manner. Does that sound familiar? Another year of our kids being coerced into wearing a facial covering. I'll give you the definition of coercion. The practice of persuading someone to do something by using force or threats. Does that sound familiar? Oppressing and coercing our children to wear a face covering that is completely useless and actually trapping all kinds of bacteria, cutting off their oxygen supply and causing all kinds of other mental and psychological health issues in exchange for their education is at best ignorant and at worst tyrannical. This created so much anxiety and stress on our little kids in addition to what they already go through on a daily basis. Since when does the county health department or the state get to decide what my child has to wear? what to do with their body, or what medical decisions need to be made for them. You don't get to decide what's best for my child. That's my job. There are 0 significant studies proving that your mandate to mask healthy people will help slow the spread of viral infections. I can give you dozens of studies providing that they pretty much have no effect on stopping the spread of viral infections and actually cause more damage than is being reported. Some of those detrimental effects include reduced intake of oxygen, which leads to breathing in extremely unhealthy amounts of carbon dioxide toxins, germs and
Thank you. Your
bacteria
time has
being
expired.
trapped.
Thank you. Yeah, you may have to adjust that up a little.
Yeah. Thank you.
All right,
Hi, I'm
thank you. Go ahead.
Holly Forwerda of Belmont. It is crucial that you stop and truly listen to what myself and so many other parents are asking of you today. We are here representing the thousands of parents who are standing up for the health and safety of our children. When you and other health officials or anyone in the educational system that say you are masking our children for their health and safety, my stomach turns. It is the most wrong, evil thing that you could say. If you truly cared about their health and safety, you would not require masks. There is a vast amount of data out there that proves that masks are physically harming our children. They are emotionally harming our children. And they are mentally harming our children. The oxygen levels are so drastically reduced when wearing a mask for just a couple of minutes, and there are studies that have been done on that. You need to look at the actual truth in the data that is right. It affects their brain development. So no, you are not providing a safe, healthy learning environment. You are doing the opposite. I'm sure I'm not the only one with a story about bacterial mouth infections in my daughter with horrible, horrible sores that is directly from her mask. The threat of detentions and making a mockery of one of my children in front of class consistently, do you know what that does to a child? Because I do. Do you even care? We all have stories like this, the anxiety, the depression. It's all impacting our children. The mental health of our children has plummeted. You need to do your job and know the correct data. We live in a society where people talk about doing the right thing and standing up for what's right, but then few actually do it. I challenge you to do the right thing. Right the wrong that has been done by stripping away the choice to wear a mask. It is a choice. Everyone makes mistakes. Some are bigger than others. You have the opportunity to change things, to redeem the situation. It's not too late. Make the right decision and make masks optional. Do the hard thing. I challenge you to step up to the plate. You have an amazing opportunity to bring a community together and strengthen it instead of tearing it apart. Stop being afraid of the what ifs, what the higher ups are doing, furthering your political career, and worrying about the money pleasing. And Adam, real quick, it is great that you were able to make your personal decision regarding your health and safety to not be here.
Thank you. Go ahead.
My name is Valerie. I'm from Comstock Park, Michigan. I have 4 children, and praise God they were able to get exemptions this year, but they're going to school with a lot of kids that don't, and it's 88 degrees today at my school with no air conditioning. We are in an air-conditioned room, and I applaud those that want to wear a mask. That's fine. That's your choice. I respect your decision to stand up and do so, but our kids don't have a choice right now. So us parents, we're the voice, right? We are the voice for our kids. We are fighting for them. And today, if you want to wear this mask, go for it. We respect that decision. What if this mandate was reversed? What if it said there are not masks allowed in school? What would be happening then? I am calling today with this last minute I have. Obviously, you know how us parents stand there in this room. There are a lot more, unfortunately, that would love to be here, but that are working today, and that's why they can't pull their kids out and homeschool them, else they would. We are asking you to please hear our voice. There are people out there, teachers, principals, superintendents, school boards that do not agree with this either, but have been put in this position because of this mandate. Fight with us, not against us. You did not have the choice for this mandate, but you have the choice to do something now. Fight with us. We need you. We cannot do this without you. Let's go after this law. Let's go after this health department. Commissioners, Some of you were awesome today, and I can tell that you're for parental choice. Thank you. Please work with us to fight this mandate and let it be parental choice for what's best. We know what's best for our children. That's all I have to say.
All right, we'll take 21 to 30 now.
Thank you.
Hi, my name is Angela Regas, and I'm from
Go ahead.
Caledonia. First, I want to address the parents that are too nervous to speak at a meeting such as this. If your child was being bullied by a neighbor kid, I know that you would not hesitate to confront that parent. I want you to tell you right now that Mr. London is the bully. It is your duty to speak up now for your children. Nervous or not. Mr. London, you absolutely disgust me. You have not followed the silence. The case numbers are very low for the age group K through 6. In fact, children are more likely to die from suicide due to your abusive mandates than COVID. You are a child abuser and you should be arrested. You have sold our children to Big Pharma, and I'm here to tell you, sir, that our children are not for sale. This mandate is not about the safety of our children. This mandate has everything to do with coercing us parents to give our children a shot of poison to purchase their freedom to breathe freely, socialize, and have a normal childhood. I have 2 children affected by this tyrannical mandate. One is speech language delayed, and the other has microcystic anemia, which affects his red blood cells. They're smaller than normal, and it affects the way his oxygen is circulated through his body. He also suffers from bicuspid aortic valve, anxiety, and depression, and I will not comply, and my boys will not comply. Our rights were granted by God, paid for by the blood of patriots, and it is duty of our government to protect those rights, not run our lives. Government gets their power from the consent of the governed, and I'm going to tell you right now, we don't consent, we will not comply, and parents hold the line.
Thank you. Go ahead.
Thank you. Thank you for allowing us to speak and share our perspectives with you. I went through this study, I guess, that was released from the Kent County and the Ottawa County Public Health Departments. And of the 62 studies that are cited here, not a single one of them is a prospective randomized control trial. These are all retrospective or observational or advocacy styled studies. There's only been one study out there. It's called the Dan-Mask study. You can go look it up. It is a randomized control study in Denmark of 6,000 people. Half of them are masked, half of them are unmasked. Guess what the difference is in infection rates? 0. It's the only randomized control study out there. You know, it's interesting that Dr. London cited the CDC because Dr. Rochelle Walensky, who was the director of the CDC, was on this week, last Sunday, and cited the CDC found statistically insignificant differences between schools that required kids to wear masks and those that didn't. The interesting thing is they didn't include that study in their report until today. In the study, which analyzed some 90,000 elementary students in 169 Georgia schools from November 16th to December 11th, found that there was no statistically significant difference in schools that required students to wear masks compared to schools where masks were optional. Now, the interesting thing is, we never talk about the damage that is done. But if you look at the University of Florida study, where they submitted 6 masks to analysis of contaminants, they found that fungi, bacteria, parasites, and 3 dangerous pathogens.
Thank you. Your time has expired.
Bacteria were on these masks.
Thank you.
23, anyone? No. Go ahead.
Just a reminder for folks that are addressing us that we're required to get a name and address. If you can state that clearly when you start so that they get that in the minutes. Thank you.
Good day, my name is Rina Baker. I live in Grand Rapids, West Side. Those of you, it doesn't matter right or left, who have children or grandchildren should be shaking in your boots with someone like Adam Landon, director of Kent County Health Department. I therefore urge you to get the information directly from scientific study produced in Research Institute, who also declare no conflict of interest. The mask has been proven by several studies that has almost no impact on health, no benefits. It is all about power. Children are not at risk with COVID. In fact, children, anatomically, they do not have ACE receptor on which the COVID virus will latch on and produce the infection. So Adam Landon has failed to get scientific evidence on which to base Kent County health policies, starting at the beginning with the PCR, inflicting fear, throwing out numbers several times a day of 1,000 people infected, thousands of cases. PCR is 97% producing false positive every time, then the cycle is over 25 cycle. He has failed to publicize effective early home treatment. Then several studies have proven to reduce hospitalization and mortality up to 85%. So the people, thousands of people who die in the United States, 85% could have been saved if the early treatment, which I brought for you today in case you get sick and you can look it up,
Thank you. Your
was
time has expired.
publicized.
Thank you.
Good afternoon. My name is Dallas Lanier.
Hold on one second, if you would. Yeah, just give it down to the end and they'll distribute it. Sorry, just hold it 1 second, okay? Thank you. All right, go ahead.
Good afternoon. My name is Dallas Lanier from the city of Grand Rapids. I'm here today representing the Black Impact Collaborative. I'm also a local pastor. The Black Impact Collaborative is a group of individuals and organizations formed to identify and illuminate the needs of Black people, specifically in Greater Grand Rapids, in light of the COVID-19 pandemic and beyond. We certainly want to give gratitude to Dr. London, the entire health department, local superintendents who have all been providing leadership throughout this crisis. We believe that this is a public health crisis, not a personal health crisis, and therefore we are grateful for, again, the leadership that is being demonstrated. We've observed that there are other local school districts who've required masks all of the 2020-2021 school year, and were able to limit COVID cases in those situations. Others around the country who began this year without masks and have seen a surge of cases are now instituting masks or going hybrid or virtual. I appreciate the comments from my fellow citizens, and I contend also that there would be others present who support this mask mandate, but they feel unsafe in an unmasked environment. The BIC instituted the Home Stretch program, which was created as a direct response to the inability of children to finish the 2019-2020 school year and getting off to a rocky start of the 2020-2021 school year. They were falling behind, and our hope is that wearing masks will help our children to stay in school for the entire school year this year. Hopefully, the mandate will not continue that entire school year, but we hope that this will be get us off on the right starting blocks. Matthew 25.
Thank you. Your time has expired.
Thank you. Yeah, next.
Hello, my name is Bonnie Burke. I'm from the northeast end of Grand Rapids, and I want to say to all of you, welcome to World War III. How do you control people? You do it by fear. You take a Wuhan manufactured global pandemic and tell people that if they go out and jog, they're going to die. We're not as stupid as some of our stupid leaders think we are. They want to do this because they're gaining power, and they will keep it at any cost, even if it's mandating that your kids have to sit all day in a hot room in a bacteria-filled mask. Well, one thing I'd like to say is there is a therapeutic. It's called hydroxychloroquine, ivermectin, and budesonide. So when you allow people to go into a hospital because they can't breathe anymore and give a remdesivir, which kills 25% of the people giving them pneumonia, we got a problem, folks. So one thing I'd like to say that I observed about Mr. Landon today, I think there is something rotten in the county of Kent. When you go to a KISD meeting on Thursday night that is closed and not transparent, and on Friday you come out with a mask mandate that is contrary to the CDC, the state of Michigan, the WHO, and other counties, then we have a problem. And I'd like to ask two final questions I'm sure everyone in this room would like to know. Who hired him and who can fire him?
Thank you. Okay, go ahead.
Hi, my name's Alexa Oddie. I'm a Grand Rapids resident, and my address is on record. As a parent and as an American, I am sincerely concerned with the quick erosion of personal rights and freedoms. We are 521 days into 2 weeks to flatten the curve. 521 days. Where's the emergency? Restaurants are open. Movies are open. Stores are open. Only one store still cleans their carts. There are 3 children in the hospital at Helen DeVos with COVID. 3. Checked yesterday, checked today. While that is awful, there are thousands of children in Kent County that are being forced to wear masks at school. My kids are at GRPS. No air conditioning. It was 102 the other day. I pulled them out. And again, where's the emergency? The emergency is not COVID. We can go into a restaurant, and if you choose to wear a mask, you can take it off at the table, but the children aren't allowed to do this at their desks. And then many have to ride exceedingly hot buses home. This is wrong. Children are the least affected by COVID. The Kent County Health Department, Adam London, GRPS, and other Kent County school boards are using each other to spread fear amongst our area. The schools were getting major pushbacks from the parents regarding their mandates, so Ron Kohler, superintendent of KISD, emailed Adam London asking for a mask mandate. This is awful and should be investigated. That's right. I think we can... Thank you. I think we can all agree that the UK and Europe have been dealing with the Delta variant longer than we have. So what have they been doing? They have not been masking their children. Children under 12 are not masked in the UK and the 27 nations that make up the European Union. What they do? Stay home from work, hand washing, ensure appropriate faculty cleaning, and have appropriate ventilation.
Thank you. Your time has expired.
Thank you. Okay, go ahead.
Okay. My name is Amy Deemter from Lowell. I'm reading a letter from my sister-in-law. She wrote it and sent it to our Lowell School Board and administration. To the Lowell School Board administrators, you have poked a bear. Well, quite a few bears. But this bear was in deep hibernation, attempting to people please and listen to authority. I sat consoling my second grader Monday night as she lost emotional control over craving above all else to go to school, but breaking down even more over the thought of wearing a mask another year. At that point, I knew I needed to stop hibernating. The claim is to wear these masks to protect the vulnerable. She is the vulnerable. She is the one who gets the sickest in our family, but the bigger reason is she is vulnerable is my daughter spent the first 6 months of first grade last year in emotional turmoil over wearing a mask all day. Her teacher had no idea she was suffering from this because my daughter hid it trying to be compliant. Thankfully, she's young enough not to consider the concept of suicide, but her outcome could have been drastically different had she been a few years older. We persevered in a mask through the year because we were doing it for the good of others, and banking on the claim that this year would be different. This year will be different. We are showing our kids they matter too, and we will not send them back to school until this mask issue is resolved and becomes a parent's choice. To be clear, we are not asking for masks wearing to be banned. We are asking that parents should be able to decide what is safest for their children. Mark and I grew up in Lowell, and we moved back home because we believed in raising our children in the same Lowell community we were raised in. That's not the same anymore. We feel you have turned your back on us to be compliant. We all have different viewpoints, and that's what makes a community great. Whether you believe in masks or not, trust in the parents who represent. Majority of us are stressing over what is best for our children. Please stop playing victim and fight for us. Let us have a choice in our children's health. At this point, you are not acting in the best interest of all families you represent. By not fighting
Thank you.
for
Your
us
time
now,
has expired.
Thank you. Go ahead.
Hi, Susan McGowan. I live in Grand Rapids. I'm just here today to say this is more than a fight about masks. Can we take a minute to take a look at the mental health of these tiny little humans that we are here to take care of? We are here to watch over them. All they want is to go to school, play with their friends, smile at each other, and play sports. Instead, they're crying, not wanting to go to school, come home from practices, complaining of how hot they were, how they couldn't breathe. Are they just whiny kids? No, they are not. This is the true problem now, is obesity. Obesity in our country is fat. What is happening when these children do not want to go to school, do not want to play sports? Guess what? We are making that problem even worse. We are raising children who are going to become obese. They are going to be the next generation of obesity. This is the health crisis. This is what we need to do. We need to stop that crisis. And what is the mask doing? Making it worse.
Thank you. Go ahead.
I am Kylie Rash. I live on Fruit Ridge between 8 and 9 Mile. I'm the yellow bicycle mailbox. If you ever want to stop in, Tom, you're always welcome for a cup of coffee. I had prepared a full statement requesting that this board move to remove Dr. London because he has clearly overreached his responsibilities and he should go back to worrying about our groundwater, not worrying about our health crisis. But instead, I took some notes when you made your opening statements, Commissioner Steck. You commented on how this board functions with different viewpoints, and you all work together towards your community. I'm here to say I believe in my community that we can do the same in our school, that I can have a mom who's concerned about her child's health, put a mask on her child, and that my child will be respectful of that, even though she may not wear a mask. And I would like you to give us that control back. We believe in our communities. It's clear. Give us that power.
Now calling 31 to 40.
Thank you.
Thank you. I'm Tim Morris.
Yeah, go ahead.
Livonia, Michigan. I'm a Board of Education trustee, and my wife is a teacher. So I can speak to this a little differently than maybe as just a parent. And I got to tell you, our board noticed something was up in June this summer, where we had maybe 100 people show up, but certainly dozens. And they were concerned about what was going to happen next with the masking of their kids in the school. Since then, at every meeting, these parents that are concerned have been showing up, carving 3 hours, up to 3 hours each Monday night to come voice their opinions to us on masking. And it's really came to a point now where last week I thought we had this thing nailed down to where we could decide on this. So we did, as a board, we talked about it. We didn't hold a vote on mandating because we kind of knew that's where it would end up as no masks, as a mandate. What I want to know is where's a mass study on practical application of kids with masks in school so we can really find out what the deal is. We don't have it. We have kids that are facing developmental issues when it comes to not being able to understand the teacher or understand a friend. It causes friction in the classroom, certainly. The waiver. What genius created this waiver? It's impossible to even get. And that is another frustration that the parents are having. We're concerned about enrollment. We have good schools. Come down to the bottom line here. Parents, you need to know this. It's a natural and fundamental right of a parent and legal guardian to determine and direct the care, teaching, and education of their children.
Thank you. Your time's expired.
Thank you. Yes, go ahead.
My name is John Roche. I'm from Kent County. I believe you guys have my address. For the board, I know you're not listening or going to be able to do anything about what all these concerned parents are talking about right now. It just falls on deaf ears, and that's fine. Some call me a rebel. Some call me a radical. Some have called me an insurrectionist. I prefer a son of liberty, honestly. In 1775, we sent a petition to King George, and we said, listen, we're willing to work with you. Help us. Let's come to an agreement. Well, that letter was sent 18 months ago. And you know what happened? There were some radicals that were born by the name of Washington and Adams. And they refused to back down. And right now, you're about to start another revolution because these parents will not comply. I will not comply. My kids will not comply. And it's time we stand up and take this country back.
Thank you. Go ahead.
Good afternoon. Good morning. My name is Kim Boer. I am from Granville School District. You have my address on file. One of the things I haven't heard yet is how no one has seemed to address the law from 1976, which seems to prevent any educational system, anyone in authority over them in education, from restricting the right to breathe. Now, I emailed one of the commissioners, and he very kindly was trying to find an answer and thought, well, maybe the public order can supersede it. But show that to me. We haven't seen that anywhere. Laws are not supposed to conflict with each other. So the fact is, you could have gotten around it by giving the parents the right to choose. I don't buy that you don't have any authority over this. We've seen it already in Allegan County where they took a vote. We know that the vote is not enforceable by law, but stand up, have some guts to support these parents. Show us where you stand. Show us that you'll support us. I'd like to let you know, we know, what do we know about the mask? We know that we're trying to protect from possibly getting a virus. But here's what we do know. We know that the AMA has come out with a peer-reviewed study that said the carbon dioxide levels are up to 25,000 parts per million on our children after 270 minutes of an average school day. When they wear a surgical mask, that number is only at 374. Not 374,000, 374 parts per million. You say that it doesn't deprave their oxygen. Sorry, we don't buy it. They're getting headaches, they're vomiting, they're throwing up. My child had a vision disability. I've pulled 2 of my kids so far because of this mandate. I have 1 left. He was able to get a vision exemption last spring. Guess what the school wanted to do with that exemption? They wanted to email every parent in every one of his classes, because at that time he was middle school.
Thank you. Your time's expired.
Thank you. Go ahead.
Glenn Crabtree, I'm from Kent City. I am the parent of a student of Kent City Community Schools. I also sit on their Board of Education as a trustee, though I'm not speaking in that capacity today. I'm speaking for myself as a parent and for my child. Since this all began almost 18 months ago, public health recommendations have waffled between no mask, wear a mask, 2 masks. Following the science was like watching someone fail a sobriety test. It became evident early on that public health officials had no clear competency to be making recommendations. They have lost all credibility and destroyed the public trust. Doctors take an oath to do no harm. This order and all previous like it have done more harm to the mental health of our children than any physical benefit they could have ever had. Child suicide is up 5-fold since we masked them up. Depression is skyrocketing nationally. We are told to follow the science, yet there's very little being followed to issue these orders. Public health officials prefer to manipulate data and numbers from a faulty PCR test and use anecdotal examples and conjecture. Noticeably absent from this current health department order justifications are supporting published peer-reviewed controlled studies of mask efficacy, as well as supporting documentation from the credentialed industrial hygienists who are the mask and PPE experts, because they do not have any of this. Here's one statistical fact that I will use today. This mandate targets children between the ages of 5 and 11. There are 1.9 million children in that demographic in Michigan. Since the first of the year, there have been 3 recorded deaths, with COVID stated as a contributing factor. This does not exactly support what the health department is asserting. Parents are the experts when it comes to their children's overall health and well-being. We have protected them from things that are far more dangerous to them than the coronavirus since they were born.
Thank you. Your time's expired.
Thank you. Go ahead.
Thank you. My name is Jason Rourke. I'm from Rockford, Michigan. I moved out here about 3 years ago from Oakland County, originally from Wayne County. I love to be involved, love to help people and manage employees. I care about my employees very much. I take care of them at a mass level through the pandemic. We worked through the pandemic. We understand the mask mandates. We followed protocol. We cleaned. We did everything we're supposed to do. And as we continue to see it break down and change and change and change and change, science has gone out the window. We keep going to observations and opinions to take control of our children. Now our children are under attack, and that's not okay with me anymore. We do have laws that support not taking a mask on our child for breathing purpose in 1976. It's not being talked about. We have studies from Dr. Pierre Corey and his 2,000 affiliates that did ivermectin treatments that sat in front of Senate in September and talked about it with proper treatment to take care of this whole virus, this whole situation, and treat it right now. You don't hear the Kent County Health Department talking about that. Why is that? We're under attack. Communism is here. Biden is showing it daily. And I'm not a political guy. But I can tell you, I've not been happy with what I've seen. I talked to Mr. Morgan the other day, and then I talked to Adam London personally on the phone at 5:20, and he had no scientific data. He told me that. He said it's opinion-based data that he's stepping up with. So it is time to stand up and stop the communism takeover in our country and have a backbone, and I'm willing to do it if you're not.
Thank you. Go ahead.
Hello, my name is Mike Loix, and I live in Ada with my lovely wife right here. And we have 4 children in the school district. I'm here to ensure that our kids, all kids, have the choice of medical freedom. I think we hear the theme pretty strong today. The question is, will you? 2 big things, obviously. We really expected masks to be optional, and we were surprised as everybody else. I don't need to repeat what happened in this district. And also what's we're worried about, and you've heard a little bit about it, is the vaccines that could be next. It's like dominoes. I do consider, and my wife and I consider, the masks, because we've heard the data is not consistent. The vaccines, data is all over the place. I consider these experiments. So I'm going to read to you something from a code. And I'll explain what this is from. This code states the voluntary consent of the human subject is absolutely essential. This means the person involved should have legal capacity to give consent, should be so situated to be able to exercise free power of choice without intervention of any element, force, fraud, deceit, duress, overreaching, or ulterior form of constraint, coercion, and should have sufficient knowledge and comprehension of the elements of the subject matter involved as to him to make understanding and enlightened decision. This latter element requires that before acceptance of affirmation decision by the experimental subject, there should be made known to him by nature, duration, and purpose of the experiment. Duration and purpose of the experiment. The method and means by which to be conducted, all inconveniences hazardous, reasonably to be expected, and the effects upon a health in a person which may become participation of this experiment. This is from the Nuremberg Code from 1947, after World War II. I'm a mama bear. I'm a papa bear, and my mama bear's here. These decisions, I'm standing between.
Thank you. Your time's expired.
Thank you. Before you start my time, could you please get Adam back on the screen? He was online. I don't know where he's. I will wait. If we can get Adam back on the screen, I would like to be able to see him. We will work on that while we continue. Thank you. No, we can wait to be sure Adam is watching. Let's wait. I think everyone here is willing to wait so we can see Adam. Nicely done. I did ask for him to be on the screen earlier, so I will follow up again. Nope. This is. Are you starting my time? I asked you to stop my time. Yeah, we'll restart your time, of course. I'm going to continue to wait for Adam. Okay, you can continue to wait. We would like to, if you want to wait and address him, that's fine. We will get him on, but we need to get to the next. Okay. I have been asking for him to be on the whole time. I did say that. Guys, I understand. I asked for this an hour ago or so just to make sure he's still on. So we will get him on the screen. We need to continue. Please continue. We can recess and get him on. Is that what you'd like me to do? I'm trying to move on and come back. Guys, we all want to hear from you. We set this up for you. He absolutely should be here. That's absolutely right.
Excuse me. Everybody, excuse me. Ma'am, just real quickly. We all anticipated Adam London being part of this. This is right. Well, listen, just let me talk. I'm as disappointed as all of you are. If anybody knows me, you know I'm extremely disappointed, but we have a situation here. We're trying to track him down, but the yelling and screaming, as much as I want to do that, I don't know. Those are great questions. I know that, but we can't, this isn't going to accomplish anything right now. I'm with you people, okay, 100%. But we got to be civil, okay? Because anything we do now, if any media is here, they're only going to cover this stuff. regardless of all the great comments and all the great input, they're going to cover this, okay? So we're doing trust our chair, please. Okay, we got the message. We got the message loud and clear, but now we got to get this back in order, and so we get Adam online.
We need to continue to get all your voices on record. We need to continue to get it in the minutes. We need to continue to get and gather all this information. So I mean, his lack of participation now is I mean, you're asking to stop it for him.
Hold on. Hold on. Please. Yeah, please. So, one thing, I'll not go to the bathroom again. Big mistake. Second, we do want to hear from you, and there are limitations, I've got that, and we can explore whatever else we need to do afterwards, but we want to start by hearing what you people have to say. And we are here to listen, so please.
Chair Stack, could I make a quick point of order on a slightly unrelated note?
Yes, Commissioner McCallman.
When I, a few moments ago, peeked around the corner at the video, it appears that the videographer over far across from me is putting his personal opinion into how he's Could we ensure that is either stopped or that gentleman's replaced?
All right. Your point of order is that there is a commentary on the broadcast. I'm not aware of that. That obviously should not happen.
Just to be clear, Chair, what I saw when I peeked around the corner, he's zooming in and out, avoiding signs, etc., and using the video to control the perspective of those viewing online.
All right. We will follow up. Thank you for bringing that to my attention. Unaware of that. I don't want that to distract your ability to keep talking to us. So that, whatever it is, needs to stop. But I want to get back on track so that I can hear what you people have to say. So we'll deal with that later. I can't deal with that right now. So please. I'm sorry, who is next?
Next, and she refused to go because Adam wasn't.
Oh. Okay. Number 36, and please, we understand you can raise these questions, these issues. We'll deal with what we can. Right now, the only thing we can do is to hear you and hear you talk to us. We're not a school board. We aren't the department. We're commissioners, and we want to hear what it is you have to say. If you are urging us to send messages to Adam London, we will do the best we can. We are what we are. So, well, please. Somebody wishes to wait. Somebody is lined up in queue as we asked her to do. She will go. Thank you. I'm sorry. Let's make your point. We want to hear, how painful it may be, we want to hear everything. Can you turn her mic on, please?
Hello, there we go.
Gotcha.
My name is Angela Brooks. I am from Rockford, Michigan. My address is on record. When I asked for Adam to be there, I knew he would not, because I have called him, I have emailed him, and I am a conflict of interest for him. He cited 2 times today that he is not looking at reports of conflicts of interest. So I'm not surprised that he is not here. Adam cited that he is focused on making a decision that is not based on political pressures. He's putting political pressures aside, and he has to think about the science of what we are looking at. It is clear he is not looking at both sides of the science. He is looking at one side, one data fact that supports his interest. Linda, you started this meeting by secretly asking if you should go into funding, and you were told no. I would say that answer should be yes. Follow the funding. Adam is making his decisions based not for the protection of my child, but for the funding and for the political stance that he is on. His decision is not about protecting my child. My child got off the school bus. Since Adam's not watching, I emailed this to you, Adam. This is the mask that my son had on. It is nasty. For that child that said they don't complain, my child doesn't complain either. My child doesn't complain to wear this mask. It is my job to keep him safe. This is not safe. He's not complaining. My child's in Spanish immersion. It is in all of their handbooks that it is essential. It is imperative for these kids to watch the exaggerated facial expressions of their teachers and to read their lips to understand and to develop their minds. We are stripping our children away from learning, and the mental health that you adults have, that we adults have as adults, stem back from your childhood. We are damaging our child. We are damaging the development of these children by masking them. It is
Thank you. Your time's expired.
Thank you.
Hi, my name is Marissa Valenzuela. I'm here today to stand for my 3 children, my nieces and nephews, and all of the other parents who can't be here today. I'm a stay-at-home mom, so I showed. I believe Jesus Christ is my Lord and Savior. I have since I was 3 years old. So do my children. The Bible says in Proverbs, train up a child in the way he should go. Even when he is old, he will not depart from it. Isaiah says, all your children shall be taught by the Lord, and great shall be the peace of your children. Our children don't have peace right now. Hear, my son, your father's instruction, and forsake not your mother's teaching. I am my child's mother, and their teachers or their grandparents or whoever, because of this mandate, is forcing a mask on my child, even after I say, don't put a mask on, it's not safe. The Bible says, Jesus said, these are red letters, let the little children come to me and do not hinder them. I'm telling you, you are hindering our children. It is my duty to raise my children by the convictions of my heart, not yours. You are violating our religious freedom. You are violating our bodies and the bodies of our children. This is a serious offense. We are not here to request anything. We are here to claim our constitutional freedoms and our parental rights. I am not sure what God you serve, but I serve the God of heaven. He gave me free will. I serve the God of heaven, who gave the United States of America constitutional rights and liberty. The God who gave his son on the cross, who gives eternal life to all those who believe. The one true God stands with liberty, freedom, and justice for all.
Thank you. Go ahead.
My name is Mark Van Kuyk. I'm from Walker, Michigan.
Can you just talk a little closer to that?
My name's Mark Van Kuyk. I'm from Walker, Michigan. I have right here, you can't see, but this is COVID survival rates from 0 to 19, sourced from the CDC. It is 99.997% for those ages. According to the document released by the Kent County Health Department on the 20th, children between the ages of 0 and 11, the mask mandate was required because over 120,000 children across the U.S. Counted as positive. Well, there's 48 million students as of 2019 in the U.S. That comes out to be 0.25% of the children population affected by COVID-19. Of that, only 99.97% survive. That's a very small number. Where is the pandemic? Our school district closed down or have required mask mandates because, according to the Kent County Health Department, there were 59 cases per 100,000 people. That's considered a code orange, whatever that is, as a high risk. That's only 0.059% of the Kent County population to have come down with COVID. What are we looking for? Zero? It's not going to happen. And one other thing, this mask mandate conflicts with the Michigan law Michigan 380-1307B, the revised Code Act of 45 of 1976. Statement of prohibited practices. The state policy under section 1307 shall include a clear statement that all of the following practices are prohibited for school personnel in the public schools of this state under all circumstances.
Thank you. Your time's expired.
Thank you. We are aware of that section, surely, at this point. So thank you. Go ahead.
Hi, my name is Lindsay Pike. I have 4 children at Caledonia Schools, and my address is on record. Adam London said it. Survival rate isn't the only metric we should look at, right? So let's look at some of the things masks are doing to our children. Vision processing disorders. My kid has one. At age 7, he was diagnosed and went through 52 weeks of intensive therapy to cure him. 100% cured. Enter illegal breathing restraints, which block the lower half of every student's visual field. I've watched you all with your restraints on today, trying to read your notes, raising papers and straining necks to look down vertically to read. Enter chiropractic care and ergonomics. With a breathing restraint on, using a readalizer performed by our PhD behavioral optometrist, reading and comprehension levels dropped 2 to 3 grade levels after having a mask on for 20 to 30 minutes. My son has now regressed. He will require another 40 weeks of therapy at a cost of nearly 40 grand. I can send that bill to you guys, right? FYI, our doctor, the PhD, can't fill out any medical exemptions. The state threatened her license. 1 of 4 kids have an undiagnosed vision processing disorder. Breathing restraints are literally handicapping these children, creating an increase in sensory processing disorders, ADD, and ADHD. My 6-year-old had chronic eye styes last year from wearing his breathing restraint all day. It required him to almost constantly use antibiotic eye drops. This summer, not one. Breathing restraints on buses. We heard about this. Someone passed out on the bus. Come on, you guys. We do better for our dogs. Speech and language development. Have you ever tried to learn phonics without being able to visualize a mouth? Mouth airflow and tongue position is critical to learning to read and speak. Our children have developing brains. Covering 2 to 5 of their senses, their voice and their smell, is going to create a tidal wave of complications for these children.
Thank you. Your time has expired. Numbers 41 through 50, please.
My name is Elizabeth Crosby. I'm from Caledonia, and you should have my address on record. Thank you for the opportunity to speak. I think a lot of the frustrations that are coming from people are directed at you, but they're also directed at the man who is still yet to be found. 2 things I want to address. First is the word imminent danger. 3 children dying out of 2 million kids in this state is not imminent danger. That does not meet the legal justification. And you as a board of commissioners should be calling him out on that. We shouldn't have to go to court and wait for months for our kids to get unmasked because he is abusing the words that are in a law. The second is that this current order does not allow for religious exemptions. Can someone please remind me when the Kent County Health Department suddenly got more ability to determine whether I had a religious liberty based on the Constitution of the United States? But my school says I can't have a religious exemption. because the Kent County health order doesn't explicitly state that that's an exemption. I don't remember when Adam London got the ability to tell me whether the First and 14th Amendment applies to my rights as a citizen of the United States of America. I'm asking you as a commission, you were talking, can we have further conversations with you, Mr. London? Can we talk about this further and possibly see what we can do? Two things you need to address. Number one, the fact that all medical professionals in this state will not write medical exemptions because they have been bullied into getting their medical licenses yanked if they do. And second, there should be no reason why I should have to explain why I have a religious exemption, and a school should take it. That's it. That's it. They shouldn't have to wait for Adam London to say you can take a religious exemption.
Yeah, thank you. Good morning, Representative.
Thank you. My name is Thomas Albert. I'm the state representative of the 86th District. Also a Marine Corps veteran and a dad impacted by this recent order. I come here today to voice my opposition to this recent and abrupt mask order that was unilaterally implemented by the Kent County Health Department director. I, along with several of my colleagues, advised the director to not force this mandate on the children of Kent County in a letter a week prior to it so being ordered. Like many thousands of parents in the districts we represent, our words were outweighed by the so-called experts. Unless something is changed without my knowledge, we do not live in a technocratic society where a chosen subset of elite experts get to decide what is best for their subjects. We live in a democratic republic where the government receives its authority from the consent of the governed. The statutory authority given to the health department is not given by God above. It is given rather through the legislature. Pretty simple. The people choose the legislature writes the laws. The statute currently written does give a wide degree of latitude to the health department director, but that does not justify the order. I look forward to voting yes on limiting these orders to 28 days when the Unlock Michigan 2 petition is up for a vote. I suppose the silver lining here is that this order is going to make gathering those signatures pretty easy. The central problem here is that this unilaterally decided mandate is a classic case of poor governance. A decision of this magnitude was best to be made at the school board level, just as Governor Whitmer has recently stated. I've been asked a lot recently if I will withhold funds from this at the state level to try to get this mandate overturned. I encourage the director to rescind this order so we don't have to find out. You know, if I could just end with this. As a father of school-aged children, I want the director to know that he crossed a line. It is the responsibility of a parent to raise a child and care for them and protect them, not a government official. As a state legislator, I promise you I will use any tools I have at my disposal to change this policy, which, yes, includes the power of the purse. Thank you very much.
Thank you, Representative. You know, we get 2 representatives to us in one day. That's a first. Good. Welcome.
Thank you. I'm Steve Johnson. I represent Kentwood and Gaines Township as well. What I see here today is a crisis of governance, where you guys, the elected officials, are being told that one unelected bureaucrat has more power than you guys do. That the unelected bureaucrat that's supposed to work for you gets to make the law, and there's nothing you can do about that. Now, you guys ran for office. You actually were duly elected. You had to go to the people and share your view, share your vision for the county and be voted in. Not the health department director. That's right. No, as you guys are here facing all of us today, the health department director doesn't even have the guts to be here, but instead shows up via Zoom. That's the bad news, but here's the good news. Now, there is something that can be done. Now, it's be very rare that I'm ever going to tell you to follow the lead of Governor Whitmer, but I'm going to tell you to do that today. See, Governor Whitmer, earlier this year when she saw her political polling tanking because people were so outraged with her response to COVID, What did she do? She fired her health director, Robert Gordon. Just as the governor has the authority to fire her health director, so too does the Kent County Board of Commission have the authority to fire your health director. If the health director refuses to follow the values of Kent County, where we believe in parental choice, allowing parents to make decisions for their kids, then it is not only your ability but your duty to fire the health department director and to require that the county administrator hire someone to replace that person who actually shares these values and will get rid of this mask mandate. Thank you for your time today.
Thank you, Representative. Go ahead.
Hello, Matt from Rockford. I'm here to ask the Commission to take a look at the order and really scrutinize it. This order carries the weight of law. You heard Mr. London talk about how there are penalties associated with not following this order. I would expect then that this order should be flawless. I would expect that the factual findings that are in here should support this law that he's put out, this order that he's put out. But if you get in and look into the statistics, the factual findings here, there is not one statistic about kids under 12 years old in Kent County. Not one. Either one of two things: either he doesn't have the statistics, or they don't support this order. So is it deception or incompetence? One of those two. You look at the rest of the stats that are here. So you start talking about the 120,000 under number 3. I started to go into these stats, and I would ask you guys to do that. Scrutinize this order. 120,000 children. When you start looking into that, you recognize that over half the states include 19-year-olds and 20-year-olds as children. So I have a college student in Tennessee that's gotten COVID, and now my 5-year-old has to wear a mask 1,000 miles away. That's what we're going to use to support this. You look at the study here, one of the studies that he puts in, a study from North Carolina says that masking can reduce cases by 40 to 70%. Interesting, I went and looked that up. Well, it's a guess by a researcher. And on that study, in big bold letters, it says, this is new medical research, quote, new medical research that has yet to be evaluated and should not be used to guide clinical practice. That's what you're going to support this with? That's your evidence? On the very face of your evidence, it says not to use this for clinical practice, but you're going to create a law based on that.
Thank you. Go ahead.
Hi, I'm Jason Reister. I reside in Kent County. Billy Graham once said, "Courage is contagious. When a brave man takes a stand, the spines of others are stiffened." And we've seen that today. Appreciate everybody here. I also want to thank all the law enforcement in the room. You have a job that nobody wants, and I appreciate you guys. We, the parents and children, ask that you take courage to please quit following the elite and their wishes and the media's propaganda. That's right. Masks are hurting our children's mental and physical health. We are asking for local authority for the school districts to allow parents the choice on the health and well-being of their children. Please restore personal choice and allow the exercise of our God-given freedoms under the Constitution of the United States of America. Joshua 1:9 says, "Have I not commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged, for the Lord your God will be with you wherever you go." Amen. Thank you for your time and consideration.
Thank you. Go ahead.
Yes, my name is Charles Curtis. I'm from Rockford, Michigan. And this is such an embarrassment to our community that we have to waste our time fighting against something that is so stupid, so inane, so asinine, so unscientific, so anti-common sense, and so against parental rights. This is insanity. The decision to mask our children is peak stupid. There is nothing in my life, and I'm a little older than some of you, there is nothing in my life that I have ever seen that is so stupid as this. We are fighting insanity, and it has to stop. And it needs to stop with you in our local communities. This is nuts. We've been conditioned like frogs to think this is normal. This is so abnormal. This is so stupid. This is so insane. And we have to waste our time fighting for something that is so common sense that parents should be able to control the health care of their children. When are we going to wake up to this? You have poked this old bear. There is so much science. Adam London spoke platitudes and opinions and of healthcare people. He didn't cite one statistic of a randomized study that showed that masks were necessary. Not one. There has been more truth in this audience by far than the false health information that came from Adam London. False health information.
Thank you. Your time has expired.
Thank you. Thank
Grandparents to have my children be faced with this nonsense in the public schools of Rockford. And I believe that this is a tipping point for our community. This is a tipping point where our communities will be divided. They will be denigrated by the
Thank you. Thank you. Sir. Thank you. Okay, go ahead.
Hi, my name is Adam Bush. I'm from Granville, and I'm fervently opposed to mask mandates of any kind, but especially for our children. I've spoken about this at great length at our school board meetings, and I've gotten used to hearing, sorry, our hands are tied, public health order, got to follow the rules. And as frustrating as that was to hear, I gave our superintendent the benefit of the doubt and trusted that he would do what's right and fight for our kids. So imagine my surprise and dismay when I learned on Friday that my superintendent, along with many others in Kent County, had everything to do with the most recent mask mandate. With such limited time up here, I barely have time to express my own opinion, let alone convince you how horrible of a decision that is to mask our children again. So I'm going to use my time up here to draw some attention to this public health order because I think a lot of people did not read the fine print. So all summer long, our superintendent reassured us that barring any legislative action or public health order, that masking would be optional for our students. And then 2 weeks ago, Kent County also ruled against mask mandates, giving us even more reassurance that our students would be able to breathe freely. And then out of the blue last Friday, the Friday before school, Kent County Health completely reversed their decision. Masks are back for students, but only for K through 6. What? How did this happen? Let's take a look at that public health order. And there it was, right there in black and white. The Kent County superintendents have requested a public health order requiring masks for everyone in buildings with students that do not have the opportunity to be vaccinated, so that's kids under 12, as well as any other unvaccinated individuals, regardless of age. In case you missed what I just said, the superintendents want everyone, students, teachers, staff, who are not vaccinated to be in a mask. It is not just for K through 6 kids. That's just for right now. Read the order, read the whole thing. This should be very concerning to everyone. And please take note of another clause in this order. It will remain in effect until a COVID vaccine is authorized or approved for ages 5 through 11. Essentially, as written, this mask mandate can exist in perpetuity and eventually pertain only to those unwilling to get the vaccine. Folks, we are on a fast track to segregation in our schools once again. This needs to stop. Parents, keep up the pressure.
Thank you. Go ahead.
Hi, I'm Cyril Murthew from Lowell Area Schools. You got my address on file. I kind of changed course on how I wanted to approach this today. I had thought these things through, but something affected me when I saw Adam and the other official who you guys wanted to talk to. You asked them to come in here and explain to you and give you some knowledge on the backs of these decisions, on why they made these decisions. And you wanted them to explain to us why they made these decisions. But the first thing that both of them said was, you can't do nothing about it. You have no authority. They both started their speech with, you can't do anything about it. You have no authority over us. I think that's wrong. I don't know why. They should have came in here with open arms and wanting to tell us, our parents, why they did it. They should have came in here with open arms trying to explain to you why they did it. But instead, all they got to say is, oh, there's nothing you can do about it. And I also want to point out a couple things that Adam said during the conversations that I took down. One point that he said a lie. He said that he had a study that said a single layer cloth mask can present 95% of aerosols. That's a lie. There's no study behind it. There's no way that one single piece of cloth is better than an N95 mask. I don't care. And then he went on to say that multiple layer masks can protect 70% of the droplets. What kind of study is this? It sounds like he stood up there and lied to us. That nobody gave him them numbers. That was ridiculous. The second thing he did, he also lied because he said that the school boards came to him because they didn't have the authority. Well, the governor and the Michigan Health Department gave the school boards the authority. The school boards made their decision, and then he overrode their decision. So by him standing up there and telling us that that the school boards asked him to change it because they didn't have the authority, they did have the authority, and most of the school boards had already ruled. They had already made their decision before that Friday when he made his decision. So I know our school board voted to have parents' choice, and that's how it should have been. All the school boards should have been decided that way.
Thank you. Your time has expired.
Thank you. Thank you. Yes, go ahead.
Good afternoon. Thank you very much to the commissioners. My name is Tom Lambert. I'm from Kentwood. Thank you very much for your time here today and for the help of everyone that has helped put this event on today. Again, thank you very, very much. Also, thank God for the rule of law. The rule of law is what keeps our society together. It applies to all of us as it applies to the health department. It prevents our society from descending into mob rule where horrible, horrible things happen. With that rule of law, the health order has invoked 2 statutes for power. Regardless of what everybody thinks, and I know there's opinions on both sides, maybe not in proportion, regardless of whether we think it's good or bad, we look to the law to see whether these laws allow these orders. Again, 2 sections have been invoked, 2451 and 2453. 2451, I asked that Mr. London be asked to show cause as to why this order is not invalid on its face. 2453 allows 2 things. Prohibit gatherings. Nothing in this order prohibits gatherings. Or ensure emergency health services. Nothing in this order pertains to emergency health services. So 2453 is out. The other one is 2451. 2451 explicitly requires findings to be included in the order. And it says it can be invoked when there's imminent danger. Look at the order and tell me where there's a finding of imminent danger. It doesn't exist in the order. Get that straight. The order makes no finding of imminent danger. The foundation, the most basic thing, the first thing it should have done, it doesn't do. Just look to the statute, forget opinion, look to the law. Why should we not think that this order is invalid on its face? Thank you for your time.
If you have number 51 and forward, can you please, we have time, we have open mics. If we have those numbers, you can please come forward. Again, odd on my right, and no, even on my right, odd on my left. There we go.
Not this time. Not this time.
To clarify, we're looking for numbers 51 through 60.
Yeah, we know how to count.
Are you queued up? You ready? 51?
That's correct.
Oh, 51 is an odd number. Haven't lost
What
everything.
are you doing, segregating us?
Yeah, odd and even.
Not today,
Blue eyes,
sir.
brown eyes.
Not today, sir.
No.
It won't happen today, sir. I'm going to sit on this side.
Okay.
My name is Dwayne. I'm an American citizen. You're not required to give your name
wait.
or address unless, of course, you are expecting a response from them, then they would need that information. I've been to several board meetings in the last several months. I don't want to even go to the mask. You've got enough people here talking about masks. I've been to several board meetings, schools, city councils. And I want to say one thing. I'm so happy between myself and others, we've been able to get them to actually say the Pledge of Allegiance that they were not doing for months or years for all we know. Many of you guys know, well, first of all, my friends know I'm not a veteran, but my daddy was. He flew the flag every single day. I learned that from him. I'm proud of that. Since I started going to the board meetings and those people that failed to do the pledge and we forced them to shame themselves into doing it, I've been carrying a little flag of my own. I'm going to ask also if I can get a couple friends of mine to help out, and I'm going to do the Pledge of Allegiance. Yes. Those that want to join in, I appreciate it. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, guys. I'm really ashamed of the fact that the way that this room was set up. You took a lot of time to figure out how you were going to divide us all, but nobody had 15 seconds to say to themselves, maybe we should get an American flag in here. I'm ashamed.
Excuse me, sir. Sir, thank you for speaking. If you would be willing to share your name for the record.
My name is Dwayne. I'm an American citizen. Who asked the question?
I'm
an American citizen. If I want a response from you, I will give you my name and address. Other than that, I am not required under an Open Meetings Act to give you that information. It says
Thank you, Wayne. Dwayne, I certainly did not require it. I just simply asked if you wanted it for the record.
All right. All right, let's keep going. For the record, we do say the pledge, and we have an invocation before our meeting earlier today. So go ahead, ma'am.
Hi, my name is Kathleen Zarelli. I'm from Lowell Township.
Could you just get a little closer? Thank you.
Kathleen Zarelli from Lowell Township. I moved here 3 years ago. I have 4 kids, and everybody has covered exactly what I feel. My safety of my kids being raised the way I feel is right, is my right. It's mine. That's my child. I know my child more than anybody could know their child. When something's wrong with my child, I'm able to act as a parent. My hands are tied. I delayed enrolling my children in school. Last year they were homeschooled. I am one of these few women that are able to stay home because my husband makes enough money. That is not my choice. I would like to work. Last year I homeschooled my children. This year, I delayed enrolling them until Adam Lambert or London said it was okay, that he was not going to mandate. He did that on the 13th of August. I enrolled my kids. I took them out shopping for all the things that they needed, from the shoes, the backpacks, to the school supplies. We're talking $350. We're talking 3 kids so excited to finally be able to go to school because it was their choice. They didn't have to wear a mask. And then I get the news that I had tried to do everything to prevent my child from being let down. I did everything as a parent that I'm supposed to do. And he took this from us. How am I just supposed to look into my kid's eye and say, I've got you, I did right by you? Instead, I had to say, oh my God, you don't get to go to school. Because there is enough evidence that I will not put a mask on my child's face. Fatigue, dizziness, throwing up, are those a healthy environment for my child to learn? We're supposed to do that. We're supposed to be able to give that to them.
Thank you.
If number 52 is here and they were looking to speak, if they could come up.
So we're up to number what?
52. Well, that was 53.
Oh, so we need number 54.
Well, 52 if they're here.
Oh,
52? Okay, then 54?
okay. Let's go with the next one in sequence that's here.
Yep, we're on 54.
Good afternoon. Go ahead.
Good afternoon. My name is Sherry McDaniel. I didn't come prepared to speak. I came 15 more minutes before the meeting started because I couldn't stay home any longer and wait for other people to fight the fight that I've been dealing with. We've written commissioners, legislators, dealt with our school, and written the health department, and yet still we remain to fight for our kids. One of the things that has been very apparent is that schools are afraid. Superintendents are afraid. My children are ages 4 years old up to 12 years old. They attend Westside Christian School, except they're not attending right now because when I went and spoke to the school, they said if we don't comply, they could put our chains on the doors like they did to Libertas. Schools are afraid, superintendents are afraid to do what is right. As you've stated, you said that you can't do anything to change this order, yet you said that you will hopefully have a further conversation with Adam London. As you meet with him, I guess one thing that I would like to know is, since this was such an emergency last year and he is the health director, why wouldn't he begin gathering statistics using the mitigation strategies that they put in place, such as masks last year, and begin gathering data to see if those mitigation strategies were actually being effective? Clearly, we all know they're not being effective because here we are, 18 months later, still in the same place, having our children either at home because of how they're being harmed with masks or other reasons. I tried to get a medical exemption for my children and was denied. Religious exemptions are not allowed and not being accepted. Parental exemptions simply saying every day my child came home with headaches, unable to function at night, anxiety, and this needs to stop. We all know that. And the last thing that I wanted to say, if you give me 2 more seconds, is that us parents are at a point that we will no longer subject our children to Adam London's tyranny. Yes, thank you very much.
Thank you. Before you introduce yourself, can you also give us your number, because some people are not, it would be helpful if you give us your number too. Sure. Thanks.
I am number 55. My name's Renee Botel. Oh, yeah. Go ahead. Give me my full time, please.
We'll give you some grace, obviously, on that.
Okay, cool. My name's Renee Botel. Address is on record. I'm not going to talk about science or lack thereof, because we all know in this room this isn't about science. Mr. London, this is a medical experiment you're putting on the backs of our children and on their faces. To call my child in imminent danger because they are social, physical, and spiritual beings. They are not in imminent danger. What this world is an imminent danger of these philosophies overtaking our world. This is ridiculous. I'm not a doctor. I'm not a nurse. I'm not a medical first responder, though my husband is. He has seen no uptick in the amount of people he's gone out to, and he is the first line worker. This is ridiculous. I'm not a commissioner, and I'm not a health director, but I am a mom of souls, 5 of them to be exact. And I am not going to sit down and watch my kids be muzzled every dang day for other people's fear. This is the time we have to defend our children and their rights too, because remember, they too are citizens. It's not just us adults in this room, they are citizens. You are traumatizing our children, Mr. London. You are traumatizing them. These teachers who are enforcing this, knowing better in their souls, deep in their guts, are traumatizing these children. Stop! Just stop. Here's my question to all of you.
Thank you. Your
and
time
my
has
husband-
expired.
Thank you. Thank you. Is the next
We're at 56.
number 56, please? Is 56 here? Let's move to 57 then. I don't know. Good morning.
Good afternoon.
Sorry, yeah, I recognize you from this morning, so good afternoon.
Good afternoon. My name is Renee Russo, and I'm from Belmont, and I have kids both in the public school and in the Catholic diocese. And unfortunately, the Catholic diocese is not recognizing our religious exemptions either. And I'm pretty sure Dave Faber was in the room with Mr. London. And it just makes my stomach turn. I've got two girls that suffered terrible mental health this past year. And one of them to the point where we believe her hormones were so screwed up, and they say that the face mask can affect your hormones, that she's shown on ultrasound to no longer be ovulating. How can people say that that is not affecting our children? He's not keeping track of those stats. I get it. He can't keep track of everything. But people hear us. We know that this is not good. And we should have the right to say. To do something that is potentially harmful to yourself for the good of others is heroic. Most of us here believe that heroism should never be mandated nor coerced, right? Never in history have we had entire corporations disallowing doctors to make medical decisions, such as medications and exemptions. There are so many people and organizations in bed with each other, evident in censorship, doctors afraid of losing licenses for prescribing cheap, affordable medications and writing exemptions. Natural immunity is no longer valid. Not right. I believe our founding fathers would be appalled by the freedoms that are being squelched right now.
Thank you. Go ahead.
Mr. Adam London isn't here, but these guys.
Yeah. Yeah, go ahead, ma'am.
I think that you would pay more attention than that.
I'm number 58.
Please.
My name is Sarah
Ma'am,
Gitchell.
wait a second, ma'am, can you get out of the way? Thank you. Go ahead.
Sarah Gitchell. I live in Sand Lake. You have my address on file. It's funny that the previous speaker spoke of our founding fathers because I come to you before you with quotes because you've heard a lot here. I believe that you guys already know what's right to do. I just would like to give you a little bit of inspiration from our founding fathers, our forefathers. The greatest tyrannies are always perpetuated in the name of the noblest causes. Thomas Paine. Of all tyrannies, a tyranny sincerely exercised for the good of its victims may be the most oppressive. C.S. Lewis. I know no safe depository of the ultimate powers of the society but the people themselves, and if we think them not enlightened enough to exercise their control with a wholesome discretion, the remedy is not to take it from them, but to inform their discretion by education. This is the true corrective, of abuses of the constitutional power. Thomas Jefferson. Those who deny freedoms to others deserve it not for themselves. Abraham Lincoln. Open your mouth for the mute, for the rights of all who are unfortunate and defenseless. Open your mouth, judge righteously, and administer justice for the afflicted and needy. Proverbs 31:8 and 9. Our children are defenseless. They are being muzzled and told to get used to it. Being muzzled is good for them and good for others. It's a lie. They are being afflicted and oppressed. They're needy of oxygen and freedom. Commissioners, rescind the mask mandate. Find a way. Thank you.
Thank you. What number are you, ma'am?
59.
Thank you.
Thank you.
Go ahead.
Thank you. Kent County Commissioners, Dr. London and fellow guest, I'm Cindy Patton from Sparta, Michigan, and serve on the Board of Education at Creative Technologies Academy, a public charter school in northern Kent County. I am requesting the data and rationale specific to our area behind your decision to mandate masks. I seek this information to explain to our families why this decision was taken away from our school district. Our district provides our students and families with a choice for a free public school education. Data shows parents are the first and the most essential part of a child's education and success in life. When parental involvement is taken away or does not exist, a child's success rate will be affected and diminished. Our district prides itself on being transparent and collaborative with our families, and we were well prepared for the start of the school year. On August 13th, you, Dr. London, communicated to all of us that the decision around mask requirements would be left up to each district. At our August 18th board meeting, we worked with our school leaders to approve our district COVID prevention strategies, including mask wearing as a highly recommended option, while also providing and supporting parents to choose if this was the best option for their child. Our plan included social distancing, extra cleaning, along with additional safety measures that are specific to our campus. When you changed your position 3 days before the start of school, you tied our hands, both the school district and our board. It took away the choice of our parents that they value the most when they choose our school in the first place, and took away the opportunity for us to partner with our families. I serve as a board member, knowing that there will be times when I would be required to make hard and unpopular decisions. It requires courage to bear these decisions and any subsequent consequences, even if it's not popular. Your mandate took that away from us. Each school district, based on their data, should have the opportunity to work with your office on what safety protocols best support their needs. Your mandate does not allow for collaboration. I ask you to consider a different approach that best supports each school district. Thank you.
Thank you. Good afternoon.
Hi, my name is Jennifer Ostermeyer. I live in Rockford. I am part of Ben Green's district. I'm very fortunate that I homeschool my kids. I have for over 10 years. And I'm praying for all of you because I know you have tough choices to make. This is child abuse. This is child abuse. I do have a child who started high school last year. And you know what? Great year until the spring came along and they decided they were going to start testing weekly COVID tests for my child to play golf, a sport that he had a better chance of getting hit in the head with a golf club if he came within 6 feet of people. So he quit the team, and then he got a job washing dishes at a restaurant. Did he require a COVID test to wash people's dishes? No, he did not. This is stupid, and I call on you to give parents the rights to make choices. It doesn't make sense. This order here, which no one today has spoke about, says that children inside schools playing sports will be required to wear masks. My daughter, who is a homeschool daughter, intended to play sports this fall with my parish school. No, She's not wearing a mask to play a sport. Where's the line? One of you commissioners asked him where his line was today, and he did not give us an answer. This is not going to end with these masks today. Our high schoolers will be wearing masks before the end of this year. They'll be determined that they will need a COVID test if they are not vaccinated to enter the building. This is where this is going, and it needs to stop. This is abuse. We, the parents, have the choice. And I'm thankful that we live in a state that has given us the choice to make these decisions about their education, and we are very fortunate. And I pray that anyone who enters into this homeschooling community helps us to retain these rights, because they are coming for us next.
Could we have numbers 61 through 70, please?
Yeah, thank you. Good afternoon.
61.
Can you give us your number and then
Yeah, I'm
proceed?
61.
Oh,
My name is
yeah,
Kelly
thank you.
Poole, and I am in Cascade Township. Only 35% of school districts in Michigan have mandates. If this was such an imminent health threat, why isn't the governor's office issuing a statewide mandate? 2 words: campaign season. Yes, the Delta variant is present, along with thousands of other variants. Yes, it is more contagious, but the detail that is not being told is that this variant is 17 times less deadly than the original strain. COVID poses virtually no risk to the majority of children, and even less with the Delta strain. As has been mentioned earlier, facial recognition and cues are critical to every child's emotional and psychological well-being. Masks hinder this and also affect a student's ability to listen and to learn. Honestly, the most frustrating thing about all of this is the continual passing of the buck. The governor blames the legislature. The health department blames the governor. Local health departments blame the state health department. Local school districts blame local health departments. The goalposts keep moving. Apparently, no one in government has the power to do anything. Adam, who has apparently gone AWOL, maybe someone should check on his well-being, has told us he has no power to rescind the order, and then later proceeded to tell us in one of his 3 conditions in order for us to not to have the mask date, that he himself was the only one who could remove the mandate of the mask order. So he needs to pick a side on that one, because he went both ways. My brother is an ER nurse at a very large children's hospital in Texas, in Houston, a huge children's hospital. Yes, the ERs are flooded, but it is not because of COVID. It's because kids have not been treated in this last year. We, the parents, are the ultimate decision makers of our children and their health. Allow parents to choose whether to mask or not mask their child. Stop treating our children as vectors of disease.
Thank you. Go ahead.
Good afternoon. Thank you for having this meeting today. I just wanted to speak on behalf of my kids, my community, my country, and my world. That's a pledge I took in 4-H when I was a kid, and I think about that every time I keep saying I need to fight for my community. It resonates because if we don't fight at our community levels in our schools, we're not going to have a country, and we're not going to have a world that has any freedom. I have some questions I want to ask you. The first one is, if I do not comply with these rules and my kids don't comply, will we be placed on house arrest like the citizens of Australia, where we have an hour to go outside with a mask on? The second one will be, if we don't comply, will my children be removed from me for noncompliance, for fear of their safety? And number 3 will be, will we go to the CDC green zones, AKA quarantine camps, AKA concentration camps, that they can treat us so that we are no longer a threat to society? My children are in distress dealing with mask use, particularly my youngest one. She spent about 45 minutes yesterday crying because she said, I don't want to go to school with a mask on, because her little private school, who had to make the decision on Sunday for fear of them losing, or get lawsuits for being a private school, they're trying to do the best they can so they won't get in trouble. So my daughter said to me, when is this going to be over? Can we please move to another state that won't make us do this? And I told her, you know what, Amelia? I'm doing the best I can to find a plan. And quite honestly, we are trying to find a home in another state. And I call it a refugee house. And if that tells you anything, it means I do not feel free here. So yes, on Tuesday with a group of parents spent, never mind, time's up. Good job. Thank you.
Thank you.
63, is there 63?
Is 63 in the House? 64? Is 65? Okay, good afternoon.
All right, I'm tall, so I'm going up. Good afternoon. My name is Maya Hahn, and I am from Hudsonville, Michigan. We all know why Michigan Department of Health and Human Services is pushing masks on our children. They want to push and coerce our young children into getting the dangerous COVID-19 vaccinations. As a speech-language pathologist and autism specialist, I must advocate for my patients and students. The research coming out on these vaccines is alarming, to say the least. Not only are these shots showing that children are at increased risk of myocarditis, the passive VAERS reporting system is showing many death reports in children and multiple systemic adverse events. And we know that the VAERS reporting system only captures, at a very minimum, less than 10% of those that are being affected. As a mother, a healthcare provider, and educator, I have grave concerns that our regulatory agencies are captured and not working in the best interest of the public, and that Adam London and the Michigan Department of Health and Human Services is putting unhealthy and unscientific-backed mandates and protocols onto us and our children, and it's time we stand up against this attack on our children. I signed a court affidavit testifying under oath as to why the masks are counter to pediatric health and development, including significant negative impacts on speech, language, swallowing, pragmatics, and behavior. My husband, who's a dentist, also signed a court affidavit testifying that masking is causing significant dental and health problems in his patients through increased caries and gum disease, because mask wearing increases mouth breathing and increased oral bacteria. I have sent the chair of this commission those sworn court affidavits along with many more, and anyone here in this room who wants to subpoena us, when you sue Kent County Health Department, we are here willing to testify.
Thank you. Your time has expired.
Thank you, Maya. 56? 66. Is 66 here? If not, 67? Oh, I get that. 68? Oh, all right. Well, you didn't say it was Kevin Green. No, your time is done. Just kidding.
Levity's good, guys. Levity's good. First of all, I had to pick up my kids from school. That's why I just came back. So we got to get them air conditioning. So that's my first lobbying thing. I want to say, I know that you care. I've been on your side of the position many times as well. I know this is hard for you as well. But we're making this plea because we're parents. And one thing Adam London said when I was listening to him is that he based this on observational studies. Well, I want to say that, trust us, we see this every day. It's our observation as we the people, we the parents, are seeing the impacts on our kids every day. I have a 6th grader and a 7th grader, and they both go to the North Rockford Middle School. They're in the same building. My daughter has to wear a mask, my son doesn't. They're in the same building. What kind of policy would allow the discrimination for half of them? And so the other thing that Adam London said, he said that these policies have to be even-handed and they have to be rational. So even-handed, meaning they can't show prejudice to any certain group. Well, these are our precious young ones. These are our most vulnerable. This is why we're all here. That's why you see the motion that you see, is because we love our children dearly. And you have disproportionately singled them out, right? It's just common sense, guys. And, you know, and then the rational part of that is they're the least vulnerable. Like if you look at all the statistics, you can look on any website, you're going to see that it's near non-existent on the threat to them. We had 3 children die, 3 children this past year to COVID, and they had underlying conditions. Compared to the flu was 2. So we didn't do this for the flu, and here we're going just a little bit nuts here doing this to our kids. Compare that
Thank you, your time has expired.
Compare that to 300 accidents.
Thank you, Kevin.
We're at 68.
68. Is 68 here? I feel like I'm playing bingo. 69. There he is. Good afternoon.
Hello. I'll keep this short. My name is Vince Perez. I live in Rockford. I'm a concerned parent to a 4- and 8-year-old that attend Rockford schools. I'm a former special operations medic, as well as a healthcare provider that has fought on multiple battlefields in defense of this nation's interests. I also hold a degree in health intervention and disaster response. I'm sure you chose your career path with good intentions and still believe you do your job with pure intentions. I bet you never thought, you know, I would like to be screamed at by concerned parents nonstop for my job. At this point, I can somehow understand your level of extreme cautiousness in regards to masking children. To a point, our children are everything to us. But to what point will we be controlled by fear? I have a few questions about the mask justification and hope you can find time to really think about them and answer them. First, what is the definition of a mask or face covering per the Public Health Code? What duties must the mask perform? And what studies validate that every single mask that every single student wears performs those duties? There is no point in reiterating the fact that the flu has been more dangerous to kids than COVID. I ask, would masking prevent children from acquiring the flu? If so, why weren't we masking them before, during flu seasons, and will we be masking them in perpetuity? If we know we aren't too scared of children being affected by COVID-19, are we worried about transmission to fully autonomous adults who are fully capable of making the decision at this point of being vaccinated? If so, why? Since health officer powers are associated with things that are considered imminent danger, such as COVID-19, and knowing the effects of the flu, wouldn't flu season constitute as imminent danger as well? Why the hypocrisy all of a sudden? Have you considered the health effects of breathing through spit and snot, these disgusting bacteria-filled masks? Do you care? Be honest. Can you honestly say to yourself that you break the chain of transmission, like disinfecting your hands, every time before you touch your mask to adjust it or scratch your nose? If you touch your face or the outside of your mask at any point, you would have ruined your clean technique. In regards to you being honest with yourself, do you expect a 4-year-old to be able to do the same all day, every day, while being hot and sweaty? I noticed that the underlying data of the study, the CDC and the American Academy of Pediatrics about the 93,000 children lacked a null hypothesis. Does this concern you? Many studies have agreed that the high percentage of communication is nonverbal. Some may even say up to 93% of communication is nonverbal. Have you ever considered the effect that masks will have on our children's ability to communicate and understand social cues? I learned from early adulthood what leadership is. Leaders eat last, and
Thank you,
leaders
your
eat from
time
the
has
front.
expired.
Thank you. Next. Are we at 70?
We actually are at 71. 70 is next.
71. Good afternoon.
Good afternoon. Sean Gregory, Ada, Michigan, and again, just like to thank those of you who are here taking the abuse. Someone who isn't here should be. This isn't about masks or a virus or COVID or even a pathetic guy that was on a screen earlier. It's a lie. It's about the premeditated, systematic destruction of the American Republic. Our public institutions are rotten to the core. Our executive, legislative, judicial branches are all controlled by demonic influences and are completely corrupted. We've turned away from God. We've taken our freedoms for granted for so long, and the enemy has systematically taken these freedoms away one by one. Our freedoms don't come from government. Our rights come from our Creator. Our founders and many brave men and women through the years have shed their blood so that we could enjoy life, liberty, and the pursuit of happiness. It's our time. It's our calling. We either stand up now and take back our freedom, or we will lose it forever. And I'm not joking. It's here. I choose to stand.
Thank you. Can you state your number, sir?
72.
72. Thank
Way
you. Go
too
ahead.
low for a tall guy. Okay. My name is Dan Sherwood. I am a Byron Center resident and a very determined Papa Bear. There's a lot of Mama Bears here. I'm a Papa Bear. This is not a question of what is the right decision or whether it is effective. It is a question of whether it is right to take that decision from the parents and the communities that we live in. I wish Adam was here, but Adam, hopefully you're listening. I do not know you, but my father does. You may recognize the last name Sherwood. You sat on a board with my dad. He is a wise and pragmatic man. He raised a wise and pragmatic son, I think. I run a successful financial advisory practice in my 30s. I am not a crazy person. My family are not crazy people. My dad insisted last night that you were a good man. He was also very stunned by your decision and disturbed by it. My community was finally beginning to heal after a very contentious year. We were all preparing our children for a normal year. On Friday of last week, Adam London made a royal decree and tore our community apart once again. Many children shed tears because of his actions. Nobody was living under a fear of COVID in schools last month. We were terrified of a last-minute mask mandate. My child has a medical exemption due to her reaction to masking. This morning, she was teased on the bus on her second day of DK because she was without a mask. She cried before she even stepped foot on the bus. My middle child spent last year suffering migraines 4 to 5 days a week, never on the weekends. My oldest daughter had to get glasses because of the long-term effects of masking that cause peripheral vision deterioration. Don't you dare tell me there's no side effects from masking. I know firsthand what that looks like. Call it an observational study. Now, if you believe these numbers, and I assume you do, then educate the community. Let us decide. You are not responsible for making my parental decisions. Also, this is an illness that is by far and away impacting the elderly. The elderly have the ability to get vaccinated. If they don't, that is their problem, not my child's.
Thank you. Your time has expired.
Just 1 second. Thank you. Sandra, do you?
Number 73.
Yes. If we could get numbers 73 through 90 ready, please.
Thank you. That'll help us facilitate this. I'm sorry. Go ahead.
My name is Amy Fonesbeck. I'm a former teacher, a parent, and a coach. Mr. London, can you hear me? I'm wondering what changed in 1 week. Students did not come to school last year, even with a sniffle. And if you had one symptom, you were sent home for a COVID test. Healthy kids came to school, not sick ones. Masks weren't what kept kids healthy. I'm a mom, and a coach in Sparta area schools. Over the summer, we had 800 kids in summer school, summer programs. This does not include our athletes or practices all summer long and daycare facilities. We did not require masks, and there were 0 students with cases of COVID during that time in our schools. That being said, I know it probably is not the case for every school, but we as a local community should be able to go by district to see what's best for our kids. Even our lovely governor said, we now have tools so that we can take action to protect ourselves and those around us. And she left it up to the local districts. In Kent County, we have just about 600,000 people, and 878 people died last year of COVID. That is a rate of 0.0014 for children. It's much less. There were around 76,000 people in Kent County that had COVID last year. 878 died. That's a 0.00145 that passed away. All I'm asking is that you give our communities local control. If things start to progress, they will take every measure needed to protect our kids and community. At some point, we have to learn how to best live with it. We are not in imminent danger. We deserve choice. Mr. London, if you can be coerced by some school board and superintendents, you can be coerced by these people. Put pressure on Adam London to drop the mandate or fire him.
Thank you. Go ahead.
Hello, my name is Lynn Jansen. I live at 109 Stonehenge in Grandville, Michigan. I came here with some prepared remarks, but everything I had planned to say this morning has been covered by other passionate parents. I appreciate everyone being here. Honestly, the Orwellian display that I saw today with government man on the screen telling us that he and only he has the right to tell us how we're going to live our lives and how we're going to raise our children, and he gives himself that same authority. He doesn't wait for us to declare an emergency. He doesn't allow our representatives to tell anyone when that emergency will end. He is a lone dictator in this county. If that is true, if he is the only one with the authority, then the time to talk is done. I don't believe that's true. I don't believe the time to talk is done. But if our legal representation says that only he can choose, we have awful legal representation, and we need to replace them as well as Adam London. Now, Mr. London, we all know that this is not the end game. Masks are not where it ends. We know that you will come for our kids with vaccines. Mr. London, when people like you want to vaccinate my kids, I tell you bring guns. Do not rely on these patriots in blue to back you up, because they will already be at my house. They will be standing shoulder to shoulder with me as I will stand shoulder to shoulder with them to protect their families. Thank you.
Thank you. Who's next?
It's 75 here.
75?
And 76?
76. Welcome.
I don't have enough time to say it, but I was reading Martin Luther King's Jr.'s letter from a Birmingham jail, which is extremely relevant on this. He goes into the definition of a just law and an unjust law. And this is relevant here. Sometimes a law is just on its face, but unjust in its application. I don't think anyone would argue that it's just to seek general health care by wearing masks, but the application here is unjust. Adam London referred to the length of time, I think it was 43 years, that the power he's drawing has been in place. That doesn't make it right. Segregation was 101 years legal. 1849 to 1950. Women didn't have the right to vote for 144 years. They were not right laws. The only way they changed, because people violated those laws, they protested, they went out, and went after them. Adam London said, we don't know the long-term effects of long COVID, all these effects the long-lasting effects. We don't know the long-term effects of wearing a mask on our children. We don't know the mental effects. We don't know the health effects. He's concerned about the long COVID effects. That's not okay. Just like Martin Luther King did in his letter from a jail, he said, break the law peacefully. Do it knowing the consequences. Knowing the consequences and doing so, breaking it openly, knowing the consequences and accepting them is one of the highest respects of the law. So I ask you all not to comply with this. We will not comply. None of you guys say you don't have the power. I know a variety of you have petitioned Adam London to make this order. I did my research on you. You say you have no power, but you guys petitioned him to write the order? It's unacceptable. Without considering this and without considering the health of our children as well, please petition him to take it away, because we will not comply.
Thank you. Next. Good afternoon.
This opportunity. Sorry, I'm 6'4". Thank you for this opportunity. One quick announcement to everybody in this group. Look around, a lot of us are gone. If you still believe in taking this order away from our kids, come together. Don't be so spread out, because Wood TV 8 and News 13 are going to show this crowd just how it is right here, empty. I talk to my friends and see on social media that those say, if it just saves one child or one person, I'm okay with the sight of inconvenience of sending my child to school with one mask. I'm sure you'll agree. We all agree. We do what it takes to save each and every life. Well, I'm here today to stand for each life. I'm here to stand for the life of the child threatening suicide. I'm here to stand for the life of the child suffering asthma attacks. I'm here to stand for the child suffering with anxiety and panic attacks. I'm here to stand for the child suffering with mental illness. I'm here to stand for the child who will die of a bacterial infection. I'm here to stand for the children who are suffering because of their forced masks. I ask you, will I have to come back in 6 months to stand before you and try to save the children from a mandated vaccine? At what point will you stand up for freedom? You say there's nothing you can do, and that might be true. There's absolutely a lot you can do, but I'm asking you to look within and ask yourself, what can you do? What can you do to keep our freedom? What can you do? I implore you to ask yourself and everyone here this question, and join everyone in the fight for each and every child facing every issue this mandate creates. Thank you.
Thank you. Go ahead.
Hi, my name's Sean Yonker, and I live in Granville, Michigan. You have my address on file. I'm here today because this is crap. I want to remind every single one of you right there, you sit in that position for the people, by the people. Period. This group of people that was here all day long have expressed their opinions, their thoughts, their feelings. I have a daughter who's 9 years old, and I will fight for her until my last breath. Period. You talk about mama bears and daddy bears. Well, this is a junkyard dog, and his teeth are out. And I'm going to come for everybody that comes at my kid with this stupid, ridiculous mandate. And if you think you're going to force a vaccine on her, you better think twice. Adam London, I will come for you. I promise you. Put that on record. Now, you guys talked about laws and why you can't do nothing. Well, then you tell me why you can't do nothing with this law, 380.1307B. Specifically states any restraints that negatively impact breathing. You tell me you can't do nothing because of a law. Well, here's a law that tells you you're breaking the law. Now do the right thing.
Thank you. Next.
Hi, Marcus Little. I'm the pastor of Berean Baptist Church at 1574 Coit Avenue Northeast.
What's your number? I'm sorry.
79.
Oh, thank you.
I have a great deal of jealousy for the gentleman that preceded me at this podium for his ability to get everybody to the front of the room. I pastor a group of back row Baptists, so I'm going to have to figure out his trick. In my capacity as a pastor, I lead a congregation of some 200 to 300 people that have a wide variety of opinions on this subject, and many others in the last 18 months have taxed my ability to be able to keep us together. I will not say that I've been able to do it successfully, but one of the things that I have done over the entire time that I've served as a pastor is to work with community partners. We believe that we exist for the good of our neighbors, all of our neighbors, and seeking their flourishing and their health and their well-being. And I've deeply appreciated, and all I want to do right now is express my gratitude to the health department. Every Wednesday, there's been a call with faith leaders and with Teresa Branson and Mike Fortman, who have provided invaluable service to us to help guide us in making difficult decisions. All of us have been confronted with impossible circumstances over these last 18 months, and I am convinced that everyone that I've interacted with and everyone that I see in public office, everyone that I see in the private sector, every one of my congregant members is doing the best that they can, that every one of us is fighting for all of us, even in the areas that we disagree. And my plea for myself, for my congregation, and for our community, and for us as a county, a state, and a nation, is that we would remember that and hold on tightly to each other, even in the places where we disagree. Because otherwise we lose more than we possibly gain if we succeed in prevailing our opinions on one another. Thank you.
Thank you. Next number?
We're at 80.
At 80? Okay. Can the subsequent 10 numbers too also sort of get ready? Thank you.
That's all right.
Good afternoon.
Good afternoon. My name is Len. I live in Comstock Park. I'm number 81. We went to my local school. They started their comments with the phrase, "We don't have any authority." We came here, and Vice Chair Stan Steck, which I can tell, I really like you. You also started your comments with, "We don't have any authority." And I was actually quite surprised that Mr. London also started his comments, believe it or not, with "He doesn't have any authority." So I find myself wondering, who has it? According to Michigan Public Health Code 2406, you are the governing entity of the Kent County Health Department. According to Code 2428, you have the authority to hire and therefore fire the health officer. According to Code 2433, the health department shall utilize vital and health statistics and provide for epidemiological research studies and also make investigations and inquiries as to the causes of disease and the causes and prevention and control of environmental health sources of illness. Based on this, it's reasonable for me to assume that Mr. London has completed a review of this research, all research on masking, and that all scientific research to the contrary of his August 20th, 2021 order would have not only been reviewed, but clearly rationalized to you as to the lack of its relevance. 27 seconds. I was going to go through the 10 pieces of evidence. I imagine that Mr. London's compiled material that you have reviewed rationalizes why the May 2020 meta-study, which looked at 14 randomized controlled studies of masking, which he said didn't exist, I imagine that you reviewed that, and you reviewed his rationalizations why that does not have meaning here in Kent County. Let me end by this. If any of this is true, that is, if Mr. London compiled material on this matter does not comprise rationalizations that you have reviewed as not relevant, then the premise on which his edict is crafted is at best weak and is at worst
Thank you. Your time has
fraudulent.
expired.
Thank you.
We're at 82.
82? 83? What are, good afternoon. What number are you, ma'am?
83.
83. Go ahead.
My name is Chrissy, and my children attend schools in Kent County here. I'm here as a representative for the parents who are highly underrepresented and decided not to sit amongst the community members here who choose not to wear masks for their safety. I work on a children's unit within a group setting in a hospital, and I'm here to say masks work. I have seen it, I have lived it. We have COVID outbreaks, and it has been minimal because of the mask compliance, along with hand washing and sanitizing and cleaning. The kids that come in that have autism, yes, an IEP, and I believe Commissioner Green called it an IED, is valid and appropriate. These are in place for kids with special needs who should be medically exempt, not for parents who just want to not comply with laws and get a doctor to sign. The reason why I am here is because I support the mask mandate in schools to keep schools open. Our children's mental health depends on schools staying open. We should be doing everything that we can as a community to keep these schools staying open. Masks are not physically harming your children. Doctors wear masks during long surgeries, nurses, mental health workers, techs, all wear masks every day. Again, please.
Well, let her
Please.
speak.
Again, wearing masks does not cause anyone. You can put a pulse ox on from Meyer on your kid with a mask and see their oxygen does not go down. I do know one thing. I beg people to support their children and not put them in the middle. Please let one voice speak for the thousands of parents, guardians, and their grown-ups that are not present here today. I am grateful that our children's hospital is not flooded right now with COVID-positive children. I respect and am grateful we live in a county that cares about our children, our hospitals, and is doing everything possible to keep our children safe and schools open and support their mental health. We support those who want to get vaccinated, yet until K6 we can get vaccinated. We support
Thank you, your time has expired.
Hey, quiet, please. Please. Let's show respect for those who are presenting. Okay, go ahead.
My name is Susan Richards. I live in Rockford. I am a Christ follower, mom of 2 in public school, Roguewood, and I refuse to cover their faces again this year. My son is 8 in Spanish immersion, trying to learn a new language, and last year experienced headaches for the first time in his life, vomiting episodes for weeks, and challenges paying attention. He wants to be at school so badly but will not wear a mask again, and he looked at me Wednesday and made me swear that I would fight for him. My daughter is 6 and was 5 last year, coming home with wet, dirty, chewed on, stinky, soiled masks, and she is refusing to wear one as well this year, also in Spanish immersion, trying to learn a new language. I want what's best for my kids, and so I've spent the last 20 months researching how to keep them safe, and I'm confident that masks are not doing that. I've sent my research to my commissioner here for further review, and I'd like to define dignity of risk for you today. I'm a mental health professional, and it is the idea that self-determination and the right to take reasonable risks are essential for dignity and self-esteem, and so should not be impeded by excessively cautious caregivers concerned about their duty of care. And I would like to argue that Adam London believes that he is this excessively cautious caregiver with a duty of care over our children who he does not have legal authority of. Today, Mr. London stated he implemented this mandate because our children are in imminent danger. So let me share with you the numbers from his favorite sources. From the Michigan Department of Health and Human Services, Kent County has had 811 deaths, not age stratified, so that doesn't help us out here as parents, but 0.1234% death rate. From the CDC, ages 5 through 18, January 2020 through August of 2021, there were 292 deaths with a death rate of 0.0039% death rate. From the CDC, my kids are at higher risk of death in 9 other ways than COVID-19, including riding in a car. And our kids are not in imminent danger. So please allow our kids dignity of risk to live.
Thank you. Next. Good afternoon.
Good afternoon.
Number 85, my name is Mary Fountain. I have 2 children in Rockford Public Schools. Last year, we tried to stay positive, do everything we were told to do. I have a degree in biology, and one thing I took from that is humans are the most adaptable creatures on the planet, and that's what I told my kids all the time. I sat there and I watched my kids change. My 10-year-old came home from school one day and said he would rather die of COVID than keep living like this. My other son has a skin condition. He ended up getting a bacterial infection on his face under his mask. That bacterial infection went into his GI tract and all the way through his body. His backside had open sores that looked like canker sores. It took 2 weeks of topical and oral antibiotics to get it off, and we still can't get a mask exemption. I see a lot of people with credentials that think that they're the smartest people in the room when it comes to our children. Just because you have credentials doesn't mean you know what's best. In April, I was diagnosed with COVID. I called my doctor in the local healthcare system and was refused treatment. I was told to report to the emergency room if I couldn't breathe. I went through America's Frontline Doctors and was prescribed hydroxychloroquine and prednisone. In less than 12 hours, my symptoms were completely gone. The same hospital system treated my father in their emergency room. They sent him home saying he had indigestion. He felt something was wrong. He would turn back, and after arguing for quite some time with the doctors, was finally admitted. He ended up needing emergency surgery. He had an aortic aneurysm. Had he gone another 10, 15 minutes, he'd be dead. We know ourselves. We know our children. We need to be able to advocate for what is best for ourselves and our children.
Thank you. Good afternoon. Go ahead.
My number is 86, Darren Hillary, and my office in GR has paid much more than 2 minutes worth of taxes for me to share my voice. Our resolution on these mandates will come about when more people realize that we're being led by unelected health professionals and not our elected leaders as it should be. Are you powerless? The Department of Health twists the dangers of this virus to keep control. We've handed over the reins of control under the guise of a pandemic to people who have never led, nor were elected to lead. Health professionals could spend the next 1,000 years in efforts keeping us safe from infectious viruses. They will fail every time. We have not heard any news or stats, except the one that just spoke, about treatments that are being used and are working around the world that successfully treat COVID infection. Only a rise in case counts of an extremely contagious, non-lethal virus. Science fiction. My children are lucky enough to have been to 10 other states over the last year. We've seen that the political atmosphere is so vastly different in states without overreaching government mandates. The people have the choice. When I go to my own doctor, I'm given all the facts, and I still have the choice to follow that advice or not. Outside of the political protections that the Department of Health has, they don't govern the choices of Americans. They make recommendations and allow people the choice to follow, like it is in other states in our great country, other states that aren't controlled by these politically and financially driven mandates. Doctors make recommendations, not laws. We're here because our kids are being used in a political power play. Laws are legislated and approved by Congress, voted in by the Senate, and upheld by the Supreme Court. Children in 3rd grade learn this. Should this be reviewed in medical schools across America?
Thank you. Your time has expired.
Doctors, unless they are an elected...
Thank you. Thank you. We need to let the next person present. Thank you.
We got to listen to about 15 to 20 minutes of different people. I actually should have 2 minutes for every single one of you that spoke.
Yep. 2 minutes. Thank you. Next. 86. 86. Oh, that was it? Okay. Good try. 87. It's 87? Okay, what's your number, ma'am?
My number's 88.
Oh, 88. Okay, welcome. Thank you.
Thank
Go
you.
ahead.
And I'm going to ask before I start, I'm going to do request decorum from both sides. And if I am interrupted, I will try to reclaim my time. Hello, my name is Tricia Ophoff, and I am the parent of 2 grade school age children. And like any other parent, my deepest wish is that they have a safe and successful year. As adults, it is our responsibility to make sure children are safe. And last year, we all did an amazing job keeping our schools safe. Over the summer, I think we felt a sense of relief as our friends and family became vaccinated, and the numbers started going down. But COVID wasn't through with us yet, and now we have a new variant we are facing. You've already heard from some very angry parents about this matter. I don't think any parent enjoys the prospect of their child wearing a mask. But I know there are many parents who do recognize the important role they play in reducing the risk of transmission in our schools. I've handed you an open letter signed by over 1,200 people in the past 12 hours. It is now up to 1,500, and I will be emailing every one of you that support science-based decisions in our school and support Adam London and the Kent County Health Department and the mask mandate. I urge all of you to support the Kent County Health Department and the mask mandate and keep our schools safe and in session because we all want them learning. Thank you for your time.
Thank you. Next. Anybody lower than 97? 91. I'm sorry, ma'am, what number are you? Oh, okay. We'll go with 91. Welcome.
Thank you for everybody being here today. I'm going to address the people because we have no government anymore. I'm not going to waste my time talking to these people. There may be people on that board who pretend they're on our side, but they're not. Because if I was in their position, I wouldn't sleep while this was going on. This is insanity, and we need to do something about it. Just last Friday, I got a flyer, a giant flyer in my mail with a picture of somebody on a ventilator that said 99% of people in the hospitals right now are unvaccinated. That's a lie. I know nurses in the hospitals. I know people who work in the hospitals. The very same people that are about to lose their job because they won't take an experimental shot. And we have these people grandstanding and patting themselves on their back and pretending they're on our side. They're not on our side. We have no government. We have no representation. And this is exactly what we need to do right now. The only hope we got is to get with like-minded people who are sane enough to know what's going on. Everybody in this room should know by now. Stop trying to convince people because they've had over 18 months. It is very clear what's going on. We know the heart issues in these kids who have gotten the vaccine. Incomprehensible that you would give a young, healthy person a shot that could affect their heart. The heart does not heal. The heart only scars. And you're going to give them a lifetime condition for a virus with over a 99.9% survival rate, especially in children. And I want to say one more thing. My friend in the hospital who works for the VA, there is now a code for people who have a mandatory vaccine who are vaccine injured. After they return to work, they had to take time off. There is now a code of why they are off.
Thank you. Your time has expired.
Thank you.
92 through 100. Could we get 92 through 100, please?
So who is next? 92? 93? 94. There you are. No 94, no 95. Oh, we do have a 95. Good afternoon.
Is it me or her?
You're up.
Oh, okay. Good afternoon. My name is Laura Lampman, and I live in Byron Center. A quick shout out to the guy who quoted Marvin Heemeyer earlier. I'm here because I oppose the mask mandates for our K through 6 age kids. I talked to our school board, but you all pulled their puppet strings, so I came here. But with all due respect, I'm not sure why we're at this clown show if all you'll give us is laws, mandates, and our hands are tied. So I guess I'm going to pretend that you're the health department. I didn't come up here with a bunch of studies and science and statistics against muzzling our little kids. You've already seen the studies. You know there's no science in favor of masking that age group. You know it's possibly even detrimental, and you've still chosen sadism and abuse towards small children who can't say no. Yesterday, the real feel was 99 degrees. Some of the school buildings don't have adequate AC for that. The buses are hot. Kids were still wearing masks, and it's shameful. Your ridiculous mandates have pushed, and I say push, not forced, because they still had a choice, and I'm not letting them off easily, but they pushed our school board to make decisions that lower their liability rather than decisions that are in the best interest of their students. I'm asking you to get rid of the mask mandate. We do not want or need to be micromanaged when it comes to our family's health. We can handle it. We pay your salary, you work for us. Please fix this. You need to stand up to your political puppet masters like we're standing up to our kids. We will support you. Just give us the option to choose. In closing, I'd like to remind everyone here that we can and have stood up to tyranny before, and that's why we have this country.
Thank you. Go ahead.
Hi, my name is Patricia Driscoll. I live in Tyrone Township. Thank you for being here. When you listen and you're sitting there so respectful, that gives us confidence in leadership. But we have a problem. We have lost confidence in the health director, Adam London. It's dangerous because we're going to have another variant. We're going to have immigration. We're going to have other issues. We're going to have water issues. Not one person that came today is going to listen to Adam London. No. So today I've heard parents that have lost confidence and respect, industrial hygienists, school officials, coaches, medical personnel, veterans, and I've been contacted by a commissioner, one of you yourself, that has lost confidence and respect for Adam London. So as we go through another season of this disease and stuff, it is so dangerous because this could be a crisis. We have to have leadership. A parent cannot parent without respect. Your child has to respect you. A football coach cannot coach a team without respect. Veterans cannot learn unless they respect a drill sergeant. You guys all have to somehow move forward. And to move forward, you have to get respect back. And the only way I see that you can do that is to ask for the resignation. Because if tomorrow he rescinded this order, you're still not going to get the confidence. And it's not just these people. On Facebook website, the maskers come after Adam London. They're mad because he didn't do it quick enough, he didn't do it fast enough, so they're even lost confidence in Adam.
Thank you. Your time has expired.
Thank you.
Thank you. '97. I think that was 95, 97, no 96. Go ahead, sir.
I'm Joe Clement. I live in Tyrone Township, Kent City. First of all, I do want to thank all of you guys for being here. And I could tell who spoke earlier who resonates with our group. And those of you who have opposing views, I defend your right to have a different view than I do. And I got some notes here where I don't know how many of you remember Ronald Reagan, but he had a famous saying, many famous sayings, but least we ever forget that we are one nation under God. We will be a nation gone under. Gosh, I'm getting emotional. That's not normally like me. It's been a crazy year. There was a young lady here earlier that had a child in her hand that was quoting many Bible verses about the God-given charge that we need to raise our children as moms and dads, that they are our responsibility. Imagine a week ago, Friday, telling your little elementary school kid, don't worry, son or daughter, you're going to go to school and you do not have to worry about wearing that mask. And then to find out Friday afternoon, you do have to worry about wearing that mask. Those kids are going to get to school, and the teacher is going to say, I don't care what your parents said, you're going to wear this mask. And you know what that's teaching our kids? That's teaching our kids that the state is the authority. And that is grooming them for communism. And these kids are put on loan to us parents from Almighty God. I have the solution right here, and this is the only solution, and it's not a vaccine. It's not a jab in your arm. If my people who are called by my name will humble themselves and pray and ask and turn their hearts, I can't read this without my glasses, turn from their wicked ways, then I will hear from heaven, and I will forgive them, and I will heal their land. Thank you.
Thank you.
Numbers 101 to 110, please.
Can you give us your number too, sir?
I am 98.
98. Welcome. Thank you.
My name is Kevin Ray, 8670 Wildcat Run Drive, Oakfield Township. In the 2017-18 flu season, the flu killed more than twice as many children in the U.S. as COVID did in the first year, according to the CDC's data. And that was with a majority of children taking a flu vaccine. Now, contrary to Dr. London's claim, there is such a thing as long flu. Look up a website called familiesfightingflu.org, and you'll see those stories. In 2020, a child aged 10 or younger in Michigan was 20 times as likely to die in a car accident as they were to die from COVID. How many parents who are concerned about children wearing masks have been driving theirs to school for years when they could have been taking a bus, which is statistically safer? Children under 18 are over 21% of Michigan's population, but since the beginning of the year, they've been only between 0.5% and 4.5% of hospitalized COVID cases here. Currently, they're 1.3%. Almost all of Michigan's cases are now from the Delta variant, so it appears that despite what you might have heard in the news, by the data, Delta is not a special threat to children. My point here is not to diminish the threat that COVID is, but rather to put it in a proper perspective. It is, in fact, only one of many threats to children, and obviously not the most serious one, even among pathogens. Now, I'd like to talk about the law. The council read the law that the health department is operating under at the beginning of the meeting. And the problem is, she added a sentence to that, limit damage caused by an epidemic. That is not in the law. And this is indicative of what's going on. there's a lot of liberties being taken with just what is in the law and what it limits health departments to. And the only thing that a mask order can actually be done for under the law is to protect a public health service. I ask you, which public health service is going to be jeopardized if young kids attend school without wearing a mask?
Thank you. Yes, go ahead.
Good afternoon. My name is Amanda Van Streen, and I'm the Vice President of the Sparta School Board, but speaking as an individual today. We followed the updates coming out of Washington, Lansing, and Kent County, all indicating that we would have local control, which we have been advocating for since May. We enhanced our summer school program and had the ability to have children in our district in our classrooms with optional masks. Our weightlifting, athletic practices, and band practices all began with optional masks. With all of these activities occurring at school or on school grounds, we had one positive case. We had our welcome back for our staff, new teacher orientation, open houses for our students and their families, and had sent out district communication on our plans all prior to Friday at 2 p.m. Mr. London did an interview Friday morning stating he knew that masks were not being worn properly in schools last year and that no letters he was receiving was influencing his decision. This was all contradicted when the order was released, and clearly the letter from Kent ISD heavily influenced and impacted the decision. Even though masks were not being worn properly last year, and those districts that felt like they couldn't provide the several layers of mitigation strategies had already mandated masks. Ionia, Montcalm, Muskegon, and Newaygo counties are not mandating masks with a county order, but they are relying on either district mandates or the families are allowed to choose. This should be the same in Kent County, and it was indicated a week prior that this would stay that way. The whole time we were told this would not be a political decision, but the impact of waiting until the Friday before school started caused an uproar and an even bigger political divide. Who did you leave to fight this battle for you? The teachers and administrators were put in an awful position of what is supposed to be a day of excitement and welcoming back, and instead fear, anxiety, frustration, and confusion clouded the day and is going to continue to cause tension and stress between the schools and families, where we all need to be working in the same direction to provide the best educational experience that we can for our families.
Thank you. Your time has expired.
Thank you. Go ahead, ma'am.
Hi, my name is Kim Elusky, and I am also on the Sparta School Board, but I am speaking individually here today. Much of what has been said already today I agree with and was part of what I was going to say, so instead of saying that, my concern or my initial question to Adam London was, why can you give local control one day and within a week change it? Our school likes to give parent choice. And last year, we at least had the opportunity to provide virtual options and just other things that the parents could do. This gave the parents no choice. And we're for local control, and we are going to fight for that. I heard Governor Whitmer the other day on TV say, "It is best for students to have face-to-face instruction. Mask to mask is not face-to-face."
Thank you. Is there any other? One? Anyone before 110? Oh. 102.
Hi, my name is Corey. I'm from Byron Center. I've heard many things today, so I'm not going to go into some of those. I want to tell my personal story. I want to thank you all for being here and for listening. I fear we are raising a generation of children that are being taught fear and anxiety. I have 5 kids, 3 of who have special needs. I have one child that was severely speech and language disabled. He started speech in home and group session at the age of 1 year. He transitioned into school at age 3 years. At age 4, he obtained a Dynavox to do his talking for him. He also was in speech outpatient at Mary Free Bed 3 times a week. This mandate is going to affect the speech and language of our children many years to come. And I am here as a voice for these children who have speech and language difficulties. They have to be able to see how you are forming your words, what your facial expression is, because if they can't see then that, how are they able to begin to start communicating? I spent many times in the principal's office to decipher what my son was trying to say. Last year, my son was in a program. Well, before that, I also have a child who, due to trauma, could not wear a mask. His anxiety went through the roof. This trauma is real, and when you start doing this to these kids who have been traumatized, I couldn't do it. He was in a program that mandated a mask. The school would not exempt him. He had an IEP. They said to go to his doctor. His doctor would not exempt him. So he dropped out. There was one doctor that might have been able to help me, but he has retired. He knew my son well, saw him many, many years. This is my voice for the kids. They have to be able to see us modeling our facial expressions, how we are being examples in how we speak, and our expressions need to match.
Thank you. Your time has expired.
Thank you. Good afternoon. Can you give us your number?
I'm 105.
105.
Hi. My name is Jessica. Last name is Webster Heisen. I wasn't planning to be here today, but I got invited by a group of gals from the Caledonia area. I have a 9-year-old in 3rd grade there at Emmons. He hates his mask. Yes, he's fallen behind with his reading over the last year. We'll figure it out. It's not that big of a deal. I just wanted to say thank you to everyone in this room because I have felt like I've been on an island over the last year and a half, and this has been, I've gotten emotional multiple times listening to people speak. So thank you all for being here, and there's still a decent group, but the 500 or so we started with was awesome to see. You probably all follow the same folks that I do online, but if you don't, Dr. Lee Merritt, the medical rebel, I love her. Dr. David Martin is awesome. If you've not been on the Facebook site, which is called We the People, Humanities Network, or his online site, wethepeople.buzz. Masks are important. Our kids are important. I get that. I think there's a lot more behind this from a control and financial perspective that we all need to better understand. And I think he does an awesome job of digging into that side of it as well. So just thank you.
Thank you. Go ahead.
My name is Tessa Jansma. I come here as the voice for my two children that are in school. I have 3, but 2 that are in. My daughter did speech therapy for the last 2 years, and putting a mask on her is just not an option. Yes, there might be a waiver, but if we let this go with the masks, if we let you guys make the decision that masks are more, let me back up. If we let you guys make our medical decisions for our children, where does it stop? Where does it stop since mental health actual mental health is not being cared for? Where does it stop? What about when the vaccine are approved for the kids in elementary school? Then will it be all the kids that get the vaccine can take the masks off and the kids that haven't can't? That seems to be what the underlining of the order is. Now, if we don't stop this insanity now, my fear is that it's going to push to the point of where the health department feels that the mental of our children is in their decision, and if they want to transition, then, well, we don't have a choice because we gave it up with the masks. And it's just going to keep going and going and going. And this has to stop. It has to stop. Virtual school is not an option for me. My daughter has missed this entire first week of school. She hasn't been to second grade yet because we were sidestepped on Friday by Adam London, who left the screen because he was never here. Where do we go from here? What do we do as parents? Because the answer is no for masks, period. The answer is no. The answer is no for vaccines, period. The answer is no. I think you guys...
Thank you. Your time has expired.
Thank you for your comments. Your number, please?
107, John Wood, resident of Cedar Springs. It's like we're living in the Twilight Zone. The name of this episode is The Great Scamdemic. The sponsor of this show tonight is political motivation. The directors of this show are Director Fear, Director Control, and evidently, Director London. I'm a parent of 6. I've seen a few things, so I know a few things. Are you aware of that young children are the greatest cleaners in the world? And the utensil for cleaning are hands. They like to clean walls. They like to clean lockers. They'll even clean the floor. They'll also clean their friend's face. After that, they like to ear, nose, mouth. Can you imagine the breeding ground in those masks? By the second hour of school, it's like using toilet paper over for the second time. Can you imagine by the 6th hour? It's not pretty. So let's all do the right thing. We take that toilet paper and we take that mask and we flush it down the toilet.
Thank you.
Mitch Miller, 110. I'm a Lowell resident. I have 2 children. I think we need to go on the record here. One is I would like everybody at the table that agrees with Adam London in this mask mandate, I would like you to stand up. Well,
this isn't.
I know what it is.
This is our work session.
I'm not seeing anybody stand up, so I'm just going to go by. Nobody is in favor of this. This has to stop. We have had enough. You are damaging our kids' learning ability. When you put a mask on a child, they can't comprehend everything they're supposed to be learning in school. Okay? They are not learning as well as they would be if we would have them unmasked. This is an option. It is personal choice, just like the vaccine is personal choice. We need to figure out today how to get it back to personal choice. We are done. This group is going to get larger and larger and larger because we have had enough.
Thank you.
Hi.
Good afternoon. What number are you?
I am 111.
111, great.
Yep.
Go ahead.
Okay, my name is Aubrey McDougall. I am from Grand Rapids, Michigan. I have read well, not all, but a lot of the facts about the virus, and as a current high school student, the decision to wear a mask or not starts and stops with me and my parents. No one else, not the government, that's me or my parents' decisions. If I am scared of the COVID that has a 99% survival rate, then I should stay home. I shouldn't even be out. And the flu kills people every year. We don't shut down our country. We don't force people to wear masks that don't even work. And we definitely don't force vaccines on people that should be their decision. My younger brother struggles with a lot of emotional challenges. Coming from the foster system, he has dealt with a lot of different emotions, and he was just recently removed from school because he would come home crying because he thought everyone was mad at him because all he could see was their eyes. He couldn't see their facial expressions, nothing, so all he interpreted was anger. He had the opportunity to be medically removed from being able to wear a mask, but imagine the trauma that would come with that when you are the only one in school wearing a mask and everyone else is. After having all of that on him, it's just awful. In America, we land on parental rights, individual freedom, and liberty, and it's time to stop falling victim to this insanity. Please do your job and to protect my God-given right, protected by the Constitution. And lastly, I ask my generation to take courage and stand up for a fight for what is right. Thank you.
Numbers 112 to 120. 112 to 120.
Thank you.
Hi, my name is Jared Sheck. My number is 114.
Okay, good. Go ahead, please.
I don't really have much more to say than what basically almost every parent in this room has said. I just want to reiterate some of the facts because the best way to learn something is reiteration, repeating things over and over. And the fact that you've had parent after parent after parent after parent express their concern about the mask and the mandate behind that. It's not the mask itself, it's the fact that you're removing the choice from these parents to be a parent to their child. I am a father of 5 kids, 4 beautiful girls and 1 son, thank the Lord for that, and my wife. And we have been here all morning. I've been here since 10 o'clock. We went to go get our kids and came back because this is important. I never even planned to speak to any of you because I've never done this before. But my daughter, who's in 4th grade at Granville Schools, deserves to see people stand up for her. And she said to me repeatedly since we've been here, thank you for taking a stand, Dad. Thank you for fighting for me. Because she's 9 years old and knows the repercussions that these masks have on these children. She tells me every day they sit in their classroom at their table with 4 kids per table with their mask on. They go outside and what happens? They take their mask off, they play tag, they run around, they play with each other, they hug each other, and then they go right back inside and not one of the safeties outside say anything about it. The fact that you think that these masks will prevent any type of spread in the least likely candidates to even get the disease, let alone die from the disease, I know that some have, but it's very, very slim, it's disappointing. I'm speaking to you as a father with concern from my heart for my kids and the kids of my community and my neighborhood, that this is wrong. You all know it's wrong. You don't have to listen to somebody that you hired when you can change his job position. So my only thing that I have to say is take the mask off the kids, take the mask off yourself if you choose to, or if you're not. The fact is we have the choice to do so. I appreciate the people who stood up here in front of all these parents who don't agree with them and voice their opinion because we live in the land of the free for now. If we don't keep standing up, we won't have that much longer. So thank you.
Thank you. Good afternoon. What is your number?
Good afternoon. 113.
Thank you. Go ahead.
Okay, Michael Page from Caledonia, Michigan. Address is on file. Commissioners, I'd like to appeal to your call for a working session today, a true working session for solutions. You started by having your legal counsel state you have absolutely no authority or power to fight this mandate. That is a very sad excuse to share publicly. You need more ideas or help from this community, just ask and organize for us to join you. We need to think outside the box. We could redirect funds to cover the penalties that Adam is trying to impose. Look at the school budgets. We can try to nullify his power that he is trying to grab right now. Or we can have him replace. Help find new avenues for the boards of the schools and the teachers to not comply with Adam's mandate, so it nullifies it. Help him fight back against whatever pressure is coming on him from other sides. Present more evidence, argue for us, and be public about what you're doing for us. Because to say that Adam has full control over our kids, that would be a shameful disgrace to not only this county, but this country. So I urge you, be public about the actions you're taking to help us. Show us you're working on a solution, and for goodness sakes, think outside the box to end this tyrannical mandate. Thank you.
Thank you. Good afternoon, ma'am.
Good
Your
afternoon.
number?
116.
Thank you. Go ahead.
Thank you, and I want to thank you for taking the time to gather with us today.
I'm sorry, we need your name too.
I'm Kelly Shute from Rockford.
You're more than a number, so go ahead.
Thank you. Thank you. Thanks for gathering with us today and just listening to all the parents on all sides of the boards. I think we can all agree this is not a one-size-fits-all decision. Passions are running high with the chance to choose what's right for our children, whatever that may be, mask, vax, unmask, unvax. It's really down to us as parents because we know our babies, and you've heard this all day, and I'm sure you feel the exact same way about your children. All parents want, every parent, all they want is what's best for their babies, and we'll do anything to protect them. That looks different for every family. What works for one family, what they believe in, and how they operate doesn't work for another, and that's okay. That's America. Mandates stripped our parental rights, and we don't consent. Parental rights are sacred. We do not live in the spirit of fear. We will not be submissive. You do not have our permission to force anything upon our babies. This is a choice to mask, a choice to breathe fresh air. When my children ask me what I did during these trying times, I will tell them with pride I stood up, even though it was not the popular decision in my personal circle. And I'm going to tell them proudly that I stood up and fought for them. And I fought for their freedoms, and I fought for their right to choose, their protections. And I just thank you for taking the time to listen to us. God bless.
Thank you. Good afternoon.
Number 120. My name is Doug Gleason. I'm in Stephen Wooden's district. Monday night before school started, I had a pretty tough decision to make with my wife, whether we were actually going to send our kids to school or not. She is I'm a little more, I'm not as opposed as she is. I hate masks. I don't like them. I don't think they do anything good. The science shows it. Everybody's talked about it already. I took a little different stand. I said, we're going to put a timeline down because I knew this meeting was going to happen. And I knew we'd all get a chance to talk to you guys. And you guys actually do have the authority because you are our elected officials. And whether you have some kind of a legal note or not, you have the authority because God's given it to you. Because we voted for you and God has given you that authority. So you do have the authority to make a change in this scenario. Where I stand today, I told my wife, our agreement was that we would, for no more than a month, allow our kids to go to school masked. And if it goes beyond that, we're pulling them and going to homeschool. I was homeschooled from first grade all the way through high school. And it taught me a whole lot of critical thinking skills that I think a lot of our kids aren't even getting these days. I learned how to actually learn. So now I look at some situation and I'm just like, oh, wow, I can do that. I can figure that out, right? I can teach myself. And I'm not opposed to doing that. It's just going to take a stretch for me and my family. Fortunately, we have family around us that can come together and help support homeschooling the kids and make sure that they get a good education. But a lot of these people can't do that. So I'm asking that you guys would step it up and make a change. Thank you.
Thank you. Good afternoon.
Good afternoon. My name is Nancy Tui. I'm a resident from Forest Hill School District. And I grew up in China. I've been a U.S. citizen for the past 20 years. Listen to this, everyone. The Communist Chinese government does not mandate masks on children. Children 18 and under are not required to be vaccinated. Why? Mr. London, you have just helped the Communist Chinese government to weaken our American children. Whether you're for or against masks, time will tell. Mask and vaccine cannot protect us. Ask the question, what can you do to be healthy? Many experts have told us, strengthen your immune system, take vitamin D3, and many other options. The public health officials would not tell you to do that. You need to take your health into your own hands. You need to do the research, find out whether the mask will help you or not. More importantly, don't let masks to divide us. Our common enemies are not COVID, not masks. It is these corrupted officials. Now, save your energy. Recall these elected, betrayed us officials. Fire them. Start organizing. Take actions today.
Thank you, ma'am. Good afternoon.
Good afternoon.
What's your number, please?
123.
Thank you.
You're welcome. My name is Nuria, and I'm from Jenison, Michigan, but my kids go to Granville Public Schools. To start, a parent from our school sent an email to our principal letting her know that their children will wear a mask, a one-ply mask, and they are not to be switched to a paper mask. She let the principal know if she had a problem with it to call her husband. That call was made. The principal's response, if they can breathe through their mask, that mask is not acceptable. Truly listen to that statement. If they can breathe through their mask, that mask is not acceptable. I would like to ask Adam London, where is the law? Not an interpretation, not an opinion, not what someone may believe, but an actual law that suspends our constitutional rights, such as our rights under our Religious and our Children's Right to Learn Act that states, all kids living in the United States have the right to a free public education. And the Constitution requires that all kids be given equal educational opportunity no matter what their race, ethnic background, religion, sex, whether they are rich or poor, citizen or non-citizen. Again, where is the actual law that suspends our constitutional rights? Last I knew, no one is above the Constitution of the United States of America. Not 46, AKA Sleepy Joe, not Governor Whitmer, and most definitely not the hidden coward Adam London. My husband Matthew and those brothers and sisters who fought before him, with him, after him, and who are currently serving did not give up their time or lives to lose our freedoms that they fought for. We have our freedoms because of the brave, not the cowards who only care about money and power. Last, I wrote a letter to our superintendent in that letter, I stated my kids will not go to school with a mask on. His response, Nuria, please don't send them to school without a mask. You are putting your kids in the middle of it. No, I am not the one putting my kids in the middle of this. I am the one who cares most about my children.
Thank you, your time has expired.
Thank you. Hang on, ma'am. We'll get to you. Thank you. Okay. Thank you, ma'am. Can you give us your number and then your name?
Lindsay Osterhaven, and I'm number 128, 2004 Conifer Ridge in Byron Center.
Thank you. Go ahead.
Sure. I just want to thank you guys for all being here. I have been listening all day at home and didn't even plan on coming down here, so I know it's been a long day for everyone, but I think you can tell that there's a lot of parents that are just feel super strong about this and just love their kids. So I am an actual nurse. I worked for a very long time in the various ICUs up in the Heart Center, surgical, trauma, neuro. So I have a lot of experience in taking care of patients. I went through H1N1. I went through all the influenzas throughout the year. So I appreciate respiratory viruses and understand that they can be deadly. And I am for sure not against, people choosing to wear their masks or not. That's obviously everyone's choice. But I'm here for my kids. I have two beautiful kids. I have a 12-year-old and I have a 10-year-old. And I'm just here to advocate for them for their mental health. My 12-year-old is high-functioning autism, struggles with some sensory processing issues, some anxiety and depression. And when COVID started, he really started to take a turn for the worse. To the point where he ended up in Pine Rest for an attempt of suicide by wrapping a cord around his neck. My 10-year-old daughter, who has a servant's heart and is the most beautiful child, her anxiety has just gripped her to the point where she cannot sleep at night. She's crying constantly. She doesn't want to be away from us. And when this order came through on Friday, it devastated both of my kids. I'm just asking that besides all of the physical effects, and I do respect them, that go along with COVID, that we just really not forget the mental side effects and what we're doing to our kids, because mental health is just as important as physical health. Thank you.
Thank you. Good afternoon. Can you give us your number and then your name?
Yeah, I'm number 127, and my name is Nick Prill.
Thank you. Go ahead.
I'd just like to start off and say I'm disappointed in each and every one of you. This event, or this meeting, was marketed and talked about in the communities as an opportunity for us to come and attend a meeting where you guys would be questioning Dr. London, and that Dr. London would also be present to hear from the people our concerns. The fact that you've allowed the meeting to continue with his insubordination and him not being here is a mere disappointment. So I'm not going to talk about facts I'm not going to talk about the efficacy or that of the masks, because just like Dr. London, I'm not an expert in that. But I will present you with facts. My daughter suffered headaches all last year. First we thought it was vision issues, then allergies. Nothing we tried stopped her headaches. What did stop her headaches was summer break and not wearing a mask. I as a parent know what's best for my child, and that's for her to be at school with no mask. No one will give us a medical exemption as they've been threatened with their jobs by their employers or their licenses by Gretchen Whitmer. What decision does that leave me with as a parent? Send her to school wearing a mask at her health detriment? No, that would be abuse. Your corporate counsel's remarks this morning were all focused on what you can't do. Have you asked her what you can do? Do you know that mask use for viral transmission prevention is only authorized by the FDA for emergency use only? It is illegal to mandate EUA-approved investigational medical therapies without informed consent.
Thank you. Your time has expired.
I would like to go on the record stating that I do.
Thank you. Good afternoon, ma'am. Could you give us your name and your number?
Yes, my name is Lori, and I'm in Kentwood, Michigan. I suggest that all of you take a look at the app. It's called BitChute. It's an alternative to YouTube, and there are doctors from all over the whole world that are speaking against these masks and against vaccines because they have a lot of experts that they really know what's going on. And I would like you to take a look at the Biederman Report of 1956, which is called the Communist Coercive Method for Eliciting Individual Compliance. There are 8 stages. The first one is isolation, socially distance, make kids stay away from their grandparents, they might kill them. The second one is monopolize perception, make everybody think this is a dangerous virus, even though it has never, ever been isolated. No coronavirus has ever been isolated. The next one is induced debility and exhaustion. Make sure that they're scared to death and that they're fearful every day. Then the next is threats of intimidation. Threaten them that they're going to close their business. Their parents are going to lose their jobs. Their children can't go to school. Then the occasional indulgence of motivating compliance. Telling them maybe you'll be able to go to the restaurant if you all mask up. And next, if you all get a vaccine, you can go out. Then the next one is demonstrate omnipotence. Show them who is in charge. Our health department that doesn't give a shit about our health is in charge. The next is degradation, making resistance worse than compliance. In other words, if you resist, your life and your children are going to be miserable. Then the last one is enforce all these trivial demands. Wear a mask, wear 2 masks, don't go out. Yes, you can go out. You can have Thanksgiving dinner, but no, you can't. You can't be near your grandparents. All of this is going to just kill us all and kill our children. And making, masks should have never come into the schools. Some children wearing masks, some children not. How do you think they feel? Do you have any
Thank you.
idea
Your
of these
time
kids
has
with
expired.
Thank you. Thank you. Thank you. Thank you. Yep. Good afternoon, sir. Can you give us your number and your name, please?
Yeah, my name is Adam. I'm number 130.
Thank you.
It's been a long day, crazy day for you guys. I've sat through some intense times like you all, so I understand what you're going through. But what you all should understand is that you should not have to go through the things that you're going through. Because you as a board have been broken for a long time. Every one of our local boards has been broken for a very long time. You have been controlled by outside forces. We have centralized powers that we have going on in a very long time in our world. Like this unelected bureaucrat in Adam London that now gets to be a dictator locally in our community. We're all afraid of, people are talking about Trump or these other people becoming a dictator. We have them at our local levels right now. Okay? And you all as a board have an ability to stop that. But that weight is a difficult one on your shoulders, and I understand that. There's no longer conspiracy theory. Marxism, socialism that leads to communism is here. It has been here, working its way onto your board for a very long time. You go to your attorney. They make those decisions, and they've been controlling things all over our world. So I urge all of you to fight and research that, because the laws that they're using are equity laws, not the laws that we the people have our power in, which is the common law, which is being educated now across this state and across the nation, across the world. We see people understanding what a real republic is. And they're still coming to America because we have the #1 longest lasting constitutional republic ever. And people are understanding how we fight for that again. Thank you.
Thank you. Good afternoon, ma'am.
Hello, I have number 131. My name is
131.
Katie Warner, and I live in Sand Lake, Michigan, and this is my 13-year-old son, John, who's getting quite a local civics lesson today.
Maybe John wants to sit on this side of the podium for a while. We'll give you a lesson.
So I actually just have one question today, and I think I must be pretty naive because I thought Mr. London was going to be here with us in person, and then I thought he was going to listen to us the whole time. So this is my question for him, and I would like to offer it to you all as well. It has to do with oxygen levels of children wearing masks. I have a friend who, when the mask mandate came out initially, going out into public to the stores and things, her daughter would wear the mask and feel sick, and she had her tested, her oxygen levels tested, and they drop. Every time she puts a mask on, they drop. And I'm sure she's not the only child. I've never tested it on my son because I will not mask him. We live life unmasked and free. But what I know is that oxygen is critical for life. It's one of the necessities. We need oxygen. We need water. And even if a slight deprivation of oxygen hurts our children, it's worth looking at. And I feel like I have the goosebumps from being in the room with the caliber of people that are in here, sharing their stories about the children that they care for, their foster children. And we have all heard today that they have been damaged from wearing masks. So please don't take this lightly. Take this to heart. On Judgment Day, we have to answer for everything that we have done and we have not done. So I just want to ask you all, have you considered what this does to the child's brain development, their hormone development? Human growth hormone needs oxygen. If you're going to have 6 foot, 12-year-old, 13-year-old kids, they've got to be able to breathe. And so please be on our side. Please help us. We really do need you. And we are sincere about our plea. Thank you very much.
If we have any numbers 137, you can come forward. Just make sure you state your name and number.
Okay, thank you. Good afternoon. Can you give us your number and your name?
Sure, my number is 135. My name is Angela Gillisy. I live in Grand Rapids. I want to read Ephesians 6:10 through 13. Finally, be strong in the Lord and in strength of his might. Put on the whole armor of God, that you may be able to stand against the schemes of the devil. For we do not wrestle against flesh and blood, but against the rulers, against the authorities, against the cosmic powers over this present darkness, against the spiritual forces of evil in the heavenly places. Therefore, take up the whole armor of God, that you may be able to withstand in the evil day, and having done all, to stand firm. To all parents and community members, do not put your faith in government ever. God never promised us an easy life or one without persecution. Prepare yourselves, because masks are just the beginning of this battle. To the commission, you have clearly awakened a sleeping giant in us all. I am here to call on each of you to demand Adam London's resignation today. Although perhaps he's absent because he's drawing up his letter of resignation. I want to use my last bit of time to call for a moment of silence for all the lives we have lost over the past 18 months, young lives, due to suicide, which surpasses the number of deaths from coronavirus among young people. This is due to your perpetuation of mandates like this. Thank you for your time.
Thank you. Who's next? Good afternoon.
Good afternoon.
Can you give us your number and your name, please?
Yep, I'm number 139. My name is Jennifer Orlowski. I live and pay taxes in the city of Grand Rapids. One of the really frustrating things about this debate is that not one person in this room is trying to prevent any parent from masking their kid at school. I firmly believe that all parents should have the ability to do what they believe is necessary to keep their children safe. All I am asking is that as a parent, I am granted the same right to choose an unmasked face for my healthy child. When Adam London said earlier that this mandate was to protect kids from COVID-19, my question is, what is being done to protect them from the illnesses that the masks pick up and carry? My then 3-year-old child came down with strep throat at the end of the school year last year. She was in school wearing a mask 3 hours a day, 2 days a week, far less than many children in this room. We knew of no one with that illness, and because of the COVID restrictions, my daughter didn't interact with very many people. After seeing an independent study from Florida that concluded that 1/3 of masks from school-aged kids had strep virus on them, it clicked for me that my daughter got strep throat from her mask. Adam London, you are a coward for not showing up at this meeting today. Also, as a health official, your job is to look at all illnesses and not to have tunnel vision for COVID-19. Most frustrating is that I have yet to find a doctor that will write me a mask exemption for my daughter. I have heard that the state is threatening to take away the licenses of physicians if they write them. How in the world is it lawful for the state to become between the doctor and the patient? I am very pro-life, but if it's unlawful for the state to tell a doctor not to perform an abortion, how is it lawful for the state to get in the way of me and my physician making a choice for my child? Lastly, to this board, I also urge you to ask for Adam London's resignation today and to find someone who will not be politically motivated to take choices away from parents. And parents, your school board hires the superintendents that have also asked for this order. Find out who they are, remember their names, and make sure to never vote them in again.
Thank you. Good afternoon.
I'm Brandon Christian from Rockford. First thing, I don't do any of this, so my number one thing is, what are you going to do about Adam London? You are in charge of the executive director, which is his boss. Will you be hearing from him? Those are things that you guys need to think about. Now, my daughter, I have 3 daughters. They go to Rockford. I love the community. Scheibler is a spineless, worthless punk. I don't know any of you on this stand, but all of you signed an oath and you work for the government, which you're an employee, which you work for us. So start standing up for us and quit worrying about Adam London, because he don't have a clue. You had specialists in here telling you exactly what the masks do and don't do, but yet I got a daughter after 17 months. I'm in HVAC, and not one of your schools, not one of them, has used the funding for anything with HVAC, UV, anything to kill mold, allergens, anything in that perspective. But yet my daughter's got to go to school with a mask on for 8 hours in an 87-degree room. Come up on my roof where I work with your mask on, and I want to see how long each and every one of you last. You're going to last 2 minutes. You know why? Because you start seeing stars, you start getting sick, and you puke, because it happens to me every fucking week. And guess where I work? At hospitals and schools. And I don't wear a mask. Thank you.
Thank you. Good afternoon. Could you give us your number and your name?
Sure. My number is 136, and my name is Amber Swift. I believe I'm the last one, maybe. Not sure, but, oh, sorry, not the last one. Oh, I didn't realize my time started, sorry. I wanted to mirror what a prior gentleman said earlier today, that Adam London is either incapable or incompetent. It doesn't take much common sense to realize that that is an absolute true statement. K through 6 is masking in the school, but what he didn't mention is where they're not masking, which is in the school athletics, on the school fields, at school practices. Why? I'm not sure, but I can tell you that when you go to any of these places, what do you see? Kids unmasked, parents masked, unmasked, kids masked, unmasked. You see both. It is the parent's choice. Don't think for a second that a K through 6th grader is going to go to any of these events and mask because they're supposed to mask at school. It's our choice of what to do in athletics, and it should be our choice in the school. It makes no sense. It makes no difference. The First Amendment is first for a reason. It is among the list that protects our religious liberties and freedoms. As if that wasn't enough, we have the Free and Affordable Education Act. On top of that, we have the federal Stop Bullying program. According to these, comprehensively altogether, the schools may not restrict my child's breathing. The masks do that. My son has a right, not just a privilege, but a right to attend a public school and have our deeply regarded religious beliefs respected. It is my deeply rooted religious belief that he not wear a mask. I'm not going to go into that here, but that is in the crux of one of our deeply rooted religious beliefs in my household. Our family not only respects, but we do not judge or feel any bias towards anybody that chooses to mask, and we have the right, not just a privilege, but the right to receive the same, to not wear a mask. And that right, again, it's not a privilege, it is a right to be respected. Lastly, this is not a left or a right, I'm a Hispanic, not a Hispanic or a white or a black or an Asian thing. This is a human thing. Humans are flawed, some of us more than others. We don't always get it right the first time, but the beauty is that we have a chance to fix our errors or to right our wrongs, to rectify them. And as a voting resident in Byron Center, whose commissioner is, yes, in Byron Center, he is pro-parent choice. We would like to see more elected commissioners stand up for what the people that elected them want them to do. I commend my commissioner, but unfortunately, there are other commissioners that do not want to either listen or poll their voting population. I'm sorry, ma'am, I saw you look sideways and sigh. I know that I am late in the game here. I know that you guys are probably tired.
Thank you. Your time has expired.
Thank you, ma'am. Good afternoon. Can you give us your number and your name, please?
Yes. My name is Amy Sutherland. My number is 140. I live in Caledonia, Michigan, and you guys have my address on file. I am here advocating for my 9-year-old son. We are facing a full-on assault against our children. Brown University came out with a study of 670 that they have followed since the beginning of this pandemic. The findings are unbelievable. The average IQ dropped 21%. The effects of masking, lack of normal communication, and socialization, and found lack of environmental stimulation also played a part. This is absolutely unacceptable. Now we as parents are facing children who experience liberty and freedom and somewhat normal existence, having their rights to see people's faces, social interaction, a public education, numerous other issues based on a virus that has minimal mortality rate. The decisions of these so-called experts have been considered intentional destruction, or worse yet, poorly educated and uninformed. Anyone with a common sense and a love for children could see this from the beginning. We shouldn't have to be pleading with you to do the right thing for the sake of the children. We implore you to stand with the parents. This has been intentional destruction of a child's mind and soul. When cognitive deficits and control are the proven end result, why would it even be considered an agenda in light of the consequences? Who does this? Could it be the one making the decision is living a fear-based life, or just speaking from a sterile scientific environment with no consideration that we are interacting with living, breathing humans with feelings and instincts? To choose masks or gene therapy mandates makes you all enforcers of a very destructive, evil agenda. How can we in good conscience choose to allow this child abuse to continue? So un-American, so inhumane, so anti-family, you could say also so anti-God. Standing 6 feet apart and wearing a face covering is a satanic ritual. Thank you.
Thank you. Good afternoon.
Hi, Angela Rogers from Sparta, Michigan. My address is on file. I'm 141 It's hard for me to talk about this. But how do you, as human beings, stand here and allow child abuse by one man? You are allowing child abuse. 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 You, with your snotty little face, you're allowing it as well. You're allowing child abuse. You're allowing child abuse. You're allowing child abuse. Can't you make eye contact? Because you know it's damn well. You're allowing a child abuse. You're allowing it. You're allowing it. You're allowing it. You're allowing child abuse. 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 You are allowing child abuse, ma'am. You want to look up and pay attention? You're allowing child abuse, and you're allowing child abuse. And Adam should be arrested. No one has the right to tell me what my daughter will or will not do, what she will wear and what she will not wear. This past year, she has came to me and told me she wanted to die because this is affecting her mental health. Who's going to take responsibility of these kids that do take their lives, because this is too much? You don't get to dictate what my kid can and cannot do. You don't know her. You don't know nothing about her. You don't know about anyone's kids. None of you get to make this choice.
Thank you.
144, Diane Patterson, Rockford.
I'm sorry.
Number 144, Diane Patterson, Rockford.
Thank you. Go ahead.
First, pretty much everybody's touched on some of the things I want to say, but I'm going to say them anyway. First of all, Adam London is a coward. I know that's already been said, but any person, man, woman, human being that can't sit here and listen to the people is a coward. Whether he likes it or not, we all hear things we don't like. So I hope that's noted. I would like this on public record, actually, wondering who here does not have an oath of office? Anybody here not have an oath of office?
Yeah, generally we don't respond back and forth. I think you know the answer to the question anyway, but.
Okay, I hope I do, but if you don't have an oath of office, you're excused. Everybody has the right to their opinion, whether they agree with the masking, the testing, the contact tracing, or the shots. And they have the option to do that. All of our God-given rights are protected by the Constitution of the United States of America from government infringement on those rights. I have a question, and apparently you guys can't answer, but I want you to think about, because at some point you're going to have to answer. Can you show me lawful proof that the Constitution of the United States is suspended? The Constitution of the United States of America is the supreme law. Orders, mandates, codes, and even laws that are contrary to the Constitution is the supreme law, and they're null and void. Can you show me proof, lawful proof, that the codes, mandates, orders are, what should I say, a law above the Constitution? Can you prove that? Every person here is here not because they want to fight with you or cause you problems. It's because we need you to hear us. You're elected officials. Adam London is not elected. You all are elected, and you have a responsibility to listen to the people. So for those of you who have been paying attention, we appreciate you very much. Those of you who are tired and really don't want to hear us, I hope that the Holy Spirit will just fill your hearts and break down some walls. Thank you.
Thank you. Good afternoon. Can you give us your number and your name, please?
Yep, my number is 143. My name is Julie Dahl. I live in Walker. I have 4 kids that attend
or did attend Granville Public School, but I withdrew them due to the mask mandate. Okay, I am very grateful that we had an opportunity to speak today, although I have never actually come across so many cowards in my life. It is truly remarkable that you are in leadership positions and you allow this to happen to our kids. It is just, I'm shocked. I am shocked, disappointed, disheartened, sickened, and I want to let you know I am done. I have been done a long time. I will no longer comply to any sort of mask mandate. My kids will not comply to mask mandates. We are done. It's up. You guys, this COVID thing, we understand. I know people will come up here and say the science is conclusive. You may think the science is conclusive. That should send alarm bells. There's never any sort of conclusive science. Science is continually questioning, continually asking questions. And when you try to shut people down and say it's unanimous everywhere, every scientist, that should be a huge red flag. It is not the way science works. It is not. So there are a lot of other doctors, medical professionals, epidemiologists, industrial hygienists coming forward and saying this is not right. We are asking you to listen to them as well as the parents of our children. They are being censored. They are being silenced. It is not one side. There's not a conclusive summary that all of this is okay. All right? So listen to the parents. People tell me I'm not an expert because I'm not an epidemiologist or a scientist. I want to know how many of you have children pre-K through 6. And if you don't, you're not an expert in this area either. So listen to the experts who are telling you we will not mask our children. Get rid of Adam London, grow a pair, stand up to him, and tell him he's done. He's done. We are taking our children back. They do not belong to the state.
Thank you. Good afternoon.
Good afternoon.
give
My
us
name's
your number?
Tim Driscoll from Sparta, Tom's district. I'm also a member of the Sparta Area School Board, which I'm not here talking on behalf of the school board. I'm talking on behalf of myself. The one thing I will say on behalf of Sparta Area Schools, in this letter that was so-called written to influence the mandate from the superintendents, Kent ISD superintendents, Sparta's superintendent was not part of that. He did not back that. So, the other thing I want to state right away is that I really don't think this commission really wants to hear from everybody in the public, because I appreciate you putting it back, but it's Thursday at 10 o'clock. I know it's your normal meeting day and you meet in the mornings, but if you really wanted to hear from a good cross-section of the public, you would have done it after 5, so a lot more people could show up here, because I think this house would have been packed out the door. Most of us have jobs, so fortunately my wife gave me the afternoon off. But, I just, you hear it, wear a mask, it's for your safety. Get the jab, it's for your safety, or the vaccine, it's for your safety. Well, I recall some words not all that long ago. Let's step onto the train. It's for your safety. So, what's next? We talk about a lot of these people that have PhDs and stuff like that. I really want the people that are making these decisions are somewhat of the highly educated, but I read a very interesting thing that stuck with me forever. It said, let's not mistake education with intelligence. You can have multiple degrees and still be an idiot. So, I just want the America that I grew up in. And I do not believe myself, I heard this lady say it, I believe it's a pandemic. For the last year and a half, I've been asking myself, how many coincidences does it take to add up to a true conspiracy, right? Every time the general public does not conform, something else comes up. With this particular thing, it was an absolute ambush on school boards and parents. To come out literally a week before and say, it's your choice, and then take it away.
Thank you. Your time has expired.
Thank you, sir. Good afternoon, ma'am.
Hi, my name is Diana. I live in Byron Center. I'm here. I want to just bring some encouragement to all the people here, encouragement that comes all the way from Iowa. My sister has been watching the meeting today online, and as big sisters are always good for encouragement, I just want to give a shout out to her. These are her words to me today. Keep up the fight. We cannot comply with people who are openly admitting that they are usurping individual rights with the collective community, which is the very definition of communism. It's sick. These are her words from Iowa. I'm sure many other people in this room have friends and family watching this all across this country. A quote she sent me, and I agree with what Thomas Jefferson said. I prefer dangerous freedom over peaceful slavery. The next quote is from one of the signers of our Declaration of Independence, from Benjamin Rush. Unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others. The Constitution of the Republic should make a special privilege for medical freedoms as well as religious freedom. Benjamin Rush. The day Mr. Rush warned us about has arrived. You can stand in the gap for us today. Adam London, along with the administrative director, and I don't know his name at the moment, but apparently he was hired recently, coming to Kent County from Ottawa County. He should be fired also. Two people.
Thank you. Your time has expired.
Thank you, ma'am. Good afternoon. Could you give us your number and your name?
148. Name is Jason Peterson, a resident of Mr. Morgan's district and a spiritual leader in Mr. Green's district. I'll leave alone all the science. You've heard plenty of that. I'll leave alone any motivations and my interpretation of the reasons behind conspiracies, because those are not your duty to deal with, nor are they Mr. London's duty to deal with. When there is no consensus scientifically on where this stands, and he has no authority to dictate to parents how they make medical decisions for their children. I could describe the kind of mental and spiritual consequences I've personally been caring for in the midst of this, but I don't have time for that. Instead, as Mr. London mentioned, he heard of people praying for him. Well, I'm praying for him too. I'll put on my regular hat here as a spiritual leader, because just like he has the rebelliousness to fail to show up here and lacks, well, let's just say the intestinal fortitude to show up here and face anyone, he likewise is rebelling against the authority above him in state and federal law and the Constitution, and he has no authority to do what he does. Therefore, I pray he repents, because he has offended his Creator, who can provide consequences far greater than any of you can provide. So I would ask you, please eliminate his disobedience by whatever means available to you. If you don't see it immediately, get creative. Ask your legal counsel to give you ways to do it rather than give you excuses not to. And make sure those that you are responsible for their actions are serving the people of this county rather than oppressing them by their abuses.
Thank you.
At this time, we're doing a final call. We have 3 more cards up here.
Good afternoon. afternoon. Could you give us your number and your name?
My name is Heather Dow, and my number is 149. And I live here in the city of Grand Rapids. I live right off of Leonard, so really close. I'm up here because I have 2 autoimmune diseases, and I've had them since I was 10 years old. And I wish I had some of these parents, because I probably wouldn't have them if that was the case. So please fight for your kids, because I'm only 38 and I've had 30 years of this. Don't let your kids fall victim to this, okay? That's number 1. Number 2 is I'm a reading specialist. I'm not originally from Michigan. I'm originally from Baltimore, Maryland. I moved here for the homeschooling laws specifically because there's not a lot of choice there. And I moved here specifically for the homeschooling laws. So that's really why I'm here. But I am a reading specialist. And I have been helping kids for years that were struggling with illiteracy in high school and middle school. And then they drop out, okay? That is a real thing. These kids wearing masks is going to affect their phonological and phonemic awareness. And they're going to struggle with reading until they drop out. Because once you get to high school and you can't read, you don't graduate. That is the thing. And I'm so tired of people saying that it's not affecting that. It is. And I have been volunteering my time to work with kids that are having this problem, okay? And I'm just tired of it. I'm tired of people saying the masks aren't affecting this, because they are. They're affecting children's speech. They're affecting all kinds of stuff when it comes to reading, spelling, and speech. And I just want everybody to know that this is a real thing. This isn't just some made-up thing that the speech pathologists and reading specialists have just come up with.
Thank you. Your time has expired.
Thank you. Good afternoon, ma'am.
Hello. Megan Keller, Rockford 150. I spoke the other day at our school board meeting in Rockford, and I left crying, so bear with me. I have a second grader who did not start school on Monday because of obvious reasons of being thrown at on Friday. I had a kindergartner who was ready to start first grade, right with everybody else. Started first grade, did well, and then we had the pandemic. She is now an IEP student, which grateful that there's help, but if it wouldn't have been for this, she would be right on board. She comes home crying. She is completely emotionally and mentally, she doesn't want to go to school. She's being bullied. I am everywhere but to put her in counseling, and I honestly don't know what else to say about it. And if you guys can stand up there and sit up there and tell me right now that this all doesn't have something to do with it, you guys can all pay me $1 million. But I can guarantee you my own $1 million that it does. It even comes down to the fact of what someone else's mask looks like and how it's decorated and how much money we spend on masks to make them more popular than the other kid. This has got to stop. And I withdrew my children, my 4-year-old and her, and they will not be returning until this stops. So, butts in the seats, no funding, because it's not going to happen in my household no more. So you better start listening because a lot more parents are going to start doing it.
Thank you. Good afternoon.
Hi, thanks for being here all day. I know it's been a long day for you and for all of us. My name is Sarah Rolfe. I live in Grand Rapids. My address is on the record. My husband and I have 4 children. We attend a parochial school here in the city, which apparently we have less recourse there than we do in the public schools with all of this. We love our school. We love our principal. Our children love their teachers. We love their friends. And this has been a very difficult week for us with this mandate thrown on us and trying to decide what to do. Ultimately, we decided that being in school is the best place for our children, and so that's why we're here fighting now, because we want them to be in school. I have children who deal with anxiety. We have children that deal with headaches that were made evident after last year masking all year. As stated in the mandate, we went to our pediatrician this week to obtain medical exemptions because of these things that our children deal with. And my pediatrician told me that I'm an idiot, that I don't know what I'm talking about, that I need to leave these decisions to the people who know better than I, and that I need to stay in my lane. And I'm just here to say that as a parent of my children, I am in my lane, and I know the decisions that I need to make for my children, and that I know better than Adam London, who is sitting who knows where, not here, and telling us what we know best for our children. And I just wanted to say that as advocate, protector, and defender of my children, this is my lane. I'm not going to be leaving that spot. These are human rights, and we will not comply. Thank you.
Thank you. I believe that is the last comment. All right. So, again, thank you all for being here. I started this or called this meeting to order, and we noted that this commission is not the body that made the decision that you're concerned about, but this body is equally concerned to hear what you have to say. And they committed to come in today. All of them have jobs as well. They gave up a full day to come in here and listen, and I want to acknowledge them for doing so patiently, listening to all of your comments. But we did say that it was important to listen and to hear what you had to say. We will, of course, be reviewing and conferring as to what it is that we conclude is appropriate action by this board, if anything. But we started by learning, and that's what we want to thank you for helping us do. So if there is anything else, fine, but otherwise we stand adjourned. Thank you very much.